welcome address. Can we please welcome him?
Thank you very much. Good morning, distinguished guests, colleagues, invited speakers. My name is Pharmacist Emmanuel Obayomi. I'm the state coordinator for YPG Lagos. First, I would like to apologize for starting at this time. Some unforeseen circumstances came up, and that's why we are starting by this time. First, I would like to appreciate everyone for taking out time to be here. Today is a public holiday, and I know that from the stress of work, most of us would want to relax, probably go for an outing, just relax, and then you are here this morning for another kind of symposium. I want to appreciate you for taking out that time. God bless you. Also, I would like to appreciate, I can see our keynote speaker already in the hall. That's Fam Shino Okwanubi. I think Fam Shino, to me, I see Fam Shino as a problem solver. Just tell him whatever challenge you are facing. And so that's why we picked him as our keynote address speaker for the theme, the new normal emerging roles for young pharmacists. Why, you might be wondering why we picked this theme. We've seen that from the post-pandemic, post-lockdown, we've been seeing different things emerging, even from different professions. We've had to see people working from home permanently, offices changing the way they operate. And we also see the same in the pharmacy sector, that yes, there are new roles that are upcoming, and most of us might not be aware of those upcoming roles. And especially as young pharmacists, it's very important that we are aware of these rules now, so that we can start making those changes, start positioning ourselves to those roles. And that is why we chose this theme. And then for our keynote speaker, we see him as someone that will definitely deal with the topic. Is like from our flyers, you see that as Project Catalyst. Is someone that just tell him. I remember when he gave the lecture during my induction, and he gave a lecture, and one of the things I got from that lecture was that there are so many problems in Nigeria, because it was like, yes, people after induction, people are planning to japa, and he said there are so many opportunities in Nigeria, so many problems, and once there are problems, it means there are opportunities, and we should look towards these problems and try and see where we can get those opportunities. And since that lecture, before, my mind was straight to Japa. And from that lecture, I started looking deep. And now it has caused some kind of confusion in my head. Do I want to focus on solving this problem that I've already identified? So, and I see that today, it might even change some of us mentality for emerging roles that can be applicable here in Nigeria, which some people have not tapped into. So I want us to relax, open our minds to listen to this lecture. Also, I want to welcome our panelists. They are already seated. Pharmacist Markion was here before 9. I want to appreciate him for coming. He's my mentor in the tech space. I track him. I'm exposing myself. I follow him codedly. All he's doing, I follow him codedly. So I'm happy to have you here, sir. Also, Famuzu Amaka from Sanofi. Maya, welcome. I remember the lecture you gave us on the Sanofi training. And I'm like, no, this woman has to come for my event. She definitely has to come for my event. So thank you, ma, for honoring our invitation. Then also from Omaumi, ma, thank you for honoring. I want to especially appreciate you, ma, because I'm aware that you had to fly in from Abuja, either yesterday or today. And we're not too sure if we're going to make it, because you had other engagement and you flew in into Lagos just for us. So, ma, thank you very much for honoring our invitation. For other young sponsors here, I can see Novartis, New Heights, Mega Medex. Without our sponsors, Pharmastream is here. I'm sure young farmers, we are looking at this beautiful hall. We are all gathered here. It's not for my personal money. So it's these sponsors that have made this happen. And I want us to just appreciate them for making sure that we are all gathered here today to have the opening ceremony of this week. And on a final note, I would like to tell us to please, let's relax, let's listen. We have a lot to give in, and just take note of important things you need to take home with. And I'm sure that after today's event, many of us would start keying into this emergency that have been waiting for us to take. So thank you very much, and have a wonderful evening.
Yes, thank you so much, my coordinator himself and my friend. All right, people. So the lady I've been waiting for is here. Can we welcome from Cindy? Yes, you're welcome.
Good morning, everybody. For the purpose of official introductions, my name is Ozula Chioma Cynthia, popularly known as Cindy Cruz, and I'll be co-hosting this event.
Wow, you know I didn't talk like that. Why? Anyway, she's awesome. You're welcome.
Thank you very much.
So before we do the next thing, I want to tell us that this event is being streamed live on the PSN-YPG YouTube channel, and also the Pharmacistream YouTube channel. So those two places is happening live, okay? In fact, as I'm standing here, I was just seeing my friends, you know, I'll just see what they are doing. So what you're doing at your table, how many sweets you're taking? I can count it, you know, so my eyes are on. Don't mind me. So, but the thing is that we are live, and that's the beautiful thing of it, okay? So thank you so much, Pharmacistream, for giving us an edge in this technological era. Okay, Cindy.
All right. For being here today, I want to congratulate all of you for being part of this wonderful occasion. Like, you know, Lagos does not do average. Lagos YPG, we don't do average.
At all.
So because of our time, we'll just go straight to the next thing on our agenda for today, which is a presentation by guest farmer. I'm hoping they are ready for us.
Okay.
Guest farmer.
So guest farmer, we want to have you first. In no order of first, second, third, but we just want you to come first and give us your presentation. So, guest farmer, if you're ready to have us,
please come forward if you're ready for us.
We're here for you. Can we please welcome guest farmer with a hand clap?
Round of applause for them. I see them already.
DJ, you know that deal now. Yes. Okay, for those that came very early, I want to just call out one MTN recharge card. I feel generous this morning for having Cindy. Cindy, I've been waiting for you. Why did Lagos hold up just kept you from me? Really? Okay, so MTN, are you here? I think, let me just call Airtel.
I'll have to call MTN out.
Okay, I should just call MTN. Okay, all right. All right. Where is the MTN now? The MTN don't fly you. It's like their network is misbehaving again today. You know that? That's Airtel. Guess what? I'm waiting for you, okay? Well, let me call. I have so many recharge cards to call here. 1072 1745 1367 117 it don't complete now. So who is our winner? Yeah, thank you. Got a winner already. Thank you. Okay, so that is for early bets. Okay, thank you very much. That's our winner. I think let me just do Airtel to balance the equation so we can move. Okay, all right, Airtel. I think you recharge your PIN using *555 Airtel. 5700 2355 5771 2113. It's complete. Yay, Starboy! Correct. So thank you very much. Get Farmer, if you're here, we're here for you too. Okay.
All right. There's been a switch in our plans. We'll be having Mega Medex. They are ready for us. So instead of Get Farmer, we'll have Mega Medex now for a 10 minutes presentation before we go over to Guest Farmer. So please, Mega Medex, quickly. All right, I see her. A round of applause for her, please. Please, she's so beautiful. A round of applause for her. Oh, thank you very much, Mega Medex.
The kind things when no consign me. I just run my things, yeah. I say, my darling, sorry, come and be my testimony. You get to something I never see. She said she liking my melody. I say, my darling, sorry, come and be my testimony. You get to something I never
Good morning, everyone.
She said she like.
Good morning, everyone. Oh, we're in the afternoon already. We're still in the morning. Okay. Good morning, highly distinguished men of honor. It's a privilege to stand before you. It is just a minute. Okay, I would crave your indulgence. Cindy, please, can I? Please. Thank you. Apologies, please.
This is another Tolio for my man. Make I tell you waiting happen for a bullet. Body's big party inside my abule. I went there with my best friend Kule. Kule they there with his girlfriend Shile. Ghetto girls them they like Takasufi. So many pretty girls they inside my mule. I just the one that say which can party everything yagba, everything there. Oh shit, I get many girls with them they come from away. AJ boys that
all right,
like.
So thank you. Thanks, Cindy. Okay. So currently, I will just be giving like an appetizer to my presentation because I will not be able to present now. So heads up, for those that come in first, I would be throwing a challenge when I eventually come up, and then it's for trained pharmacists, the Android users, and they're ready to try out what we are giving out. So we have vouchers, shopping vouchers, but I'm just giving you heads up so you get ready when I eventually come up. Are we good? Are we good? All right, thank you very much. Cindy? Thank you.
And it goes like,
my mind there for you, my heart beats for you. Every time when I think of you, I don't know, I feel loved again. I don't want to wait. Let me have you in my arms again, please.
All right. Please, a round of applause for her. Thank you very much. We will not be having the presentation immediately, but she has given us an appetizer, and I want to say that this program is packed with a lot of appetizers, and sit tight, enjoy. All right. If Pharmacy Plus is ready for us, they can come up now for their presentation, if they are ready for us. If not, just go to more giveaways. Are they ready? All right. A round of applause for him, please, as he makes his way upstage.
And I mean, they make her come. You tell me, say that me, they keep her warm. Wine on my body, baby, wine that. She tell me, say my love, make her wine that. She tell me, say my love, make her climax. She tell me, say not only me, they make her move, they make her feel right now. Yeah, your body calling me right now. Yeah, so many things in my mind now.
Don't say I want me, I know the girl, I don't really care about your body type. What be the matter now, your vibe? I be the one for you, one for you. Don't really have to be the one to go. Ain't nobody fine like you. Girl, I be the one for you, one for you. And I feel like I told you my whole life. Feel like I need you in my life. Nobody can tell me otherwise. This baby will be mine. I feel like I've known you my whole life. Feel like I need you in my life. Nobody can tell me.
Please, can we see the screen? He's trying to project his slide. Can we see it? Can't see it.
Turn up your body, make you feel alright. Flying the kele, we go cool my mind. I won't do anything I want tonight. Make you do anything we want tonight. Turn up your body, make you feel alright. Flying the kele, we go cool my mind. I won't do
Thank you very much.
Make you do anything we want.
Good morning, everybody. My name is Roselyn from Pharmacists Limited. We'll be talking on two topics today. The first one is reload, complete nutrition for everybody. Then the second one is innovation in the management of diabetes mellitus. So we'll be starting with reload, complete nutrition for all phases of life. Introduction. A sound health is a complete state of physical and mental well-being, not just the absence of disease condition. A complete well-being depicts a noticeable aura of joy, beauty, and dominance in bearer and influences the environment. So what does it tell us? That for you to be well, it actually depicts an aura of a joyful phase in you and around your environment. Sound health and beauty are not gifts. They don't come cheap. They are something we actually pay for. What are dietary supplements? Supplementation is the provision of relatively large doses of micronutrients in form of pills, capsules, or syrup. This supplementation can come in form of vitamins, minerals, amino acid, fatty acid, and other substances delivered in these dosage forms. It is scientifically recognized by World Health Organization. Now, why do we need the supplements? We all know from our daily lives that the food we eat these days is not enough to handle all our vitamins and mineral requirements. That's why we went back. Oh, it's not. Sorry. Okay. We all know that this food we eat does not meet up with all the nutrients we need for our daily nutritional requirements. So that's why we went back to look for how we can help to address this issue. And we came up with the reload formula, which is for all phases of life. I don't know, the thing is not projecting on the screen. I would have loved you to see what our reload looks like. We have reload. It's not even. Okay, we have Reload Women Formula. Now for our Reload products, Reload actually have 24 fruit and vegetable proprietary blend in every pack of Reload you buy. So for the Reload Women Formula, aside from the fact that it has this fruit and vegetable blend, it also has alpha lipoic acid, which is a very powerful antioxidant needed by the body to fight daily oxidants that can cause and lead to diseases and illness in an individual. Now, for the Reload Women Formula, it actually helps the women for their reproductive health. Then we have, we have the Reload Men Formula, which also contains this alpha lipoic acid and vitamin, which helps rejuvenate and promote vigor in men in their prime. We have the Reload Women 50 Plus formula. Now, the unique ingredient in this Reload Women 50 Plus is the cranberry extract. And we all know the role cranberry extract plays in the urinary health of women in this age group. It actually aids them to manage their urinary health. It prevents the bacteria from cleaving to the walls of the bladder and the urethra, so leading to them actually leading to them not coming down with most of the vaginal infections, which poses a problem to them at that age. Then we have the Reload Men 50 Plus formula. The Reload Men 50 Plus formula contains copper, metal, and other vitamin, which is needed for men prostate health. And we can all agree with me that at that age, these men have issues with prostate. So we have this Reload Men 50 Plus formula to handle such conditions. We also have the Reload Extra. The Reload Extra is actually formulated for people with healthy lifestyle, provides extra energy for daily physical and mental activities. So for people who do more stressful or strenuous work, we actually position this Reload Extra for such people to help handle the stress they go through on a daily basis. We also have the Reload Immunity. The Reload Immunity is a premium once-a-day multivitamin supplement, vital for patients who are immunocompromised. And it offers protection as cellular immunity, lymphatic immunity, epidermal immunity, systemic immunity, circulatory immunity, digestive immunity, respiratory immunity. Now we have the Reload Kits. For the Reload Men and Women formula, both the 50 plus and the one for people below the age of 50, we actually have them in different pack sizes. We have them coming in as 30 pack size, which is for a month's supply. We also have the one that comes as 90 tablets per pack, which is for 3 months supply. Then we have them in sachet, blister packs, which is the Reload 150, which can go for 5 months. And it's easy to retail that particular pack. So we have the Reload Infant Drop. The Reload Infant Drop contains a lot of nutrients for our newborns. It is once-a-day multivitamin supplement formulated specially to meet the physical and mental needs of infants. Provides 20 milligrams of the highest quality of DHA, contains vitamin E, which is very important for children of that age, and available as a 2-month content pack. We also have the Reload Tonic, and this tonic is positioned when there is need for quick restoration of blood and optimal immunity in anemic conditions. Then the benefits it offers includes iron in its high bioavailability form, vitamin C for quick absorption, Then it contains echinacea and berberry extract for immunity. We also have the reload syrup. The reload syrup contains vitamins and micronutrients for children between the age of 1 to 12 years old. But aside from that, it also contains DHA, which is needed for the brain formation of these children. Contains choline, which is needed for normal metabolism, and inositol. And it has a pleasant flavor, attractive, elegant pack, unbreakable plastic bottle, which is one of the things that is of concern to these parents. Then it's once a day dosing. Then we have the Reload Kiss tablet for children who can chew, who have teeth already. And it takes a lot of physical and mental uprightness of Reload Kiss to display exceptional quality and outshine their peers at competition. Reload Kits will keep them going. Thank you. So I don't know how we'll do it. If there's any questions, you can write down your questions. Then I'll take the second topic. Then after that, we can treat the questions collectively. Is that okay?
Something wake up cool in my body, tell me we'll do. I'm in a big mood, cause I feel you. Something wake up cool in my body, tell me we'll do. Make we go December, but some liquor they do me jet. Get something sweet to put on my head, I swear. Now you the cool in my stress, so yeah. Make we go December, but some liquor they do me jet. Get something sweet to put on my head, I swear. Now you the cool in my stress, so yeah.
I'm in a big mood, girl, I dey feel you. I know say I love cause passing money, but I still want you. I'm in a big mood, girl, I dey want you. Now only you, if you cool on my body, nobody but you. Yeah. Every night I go dey rock your body. Baby girl, we go dey no solo. Nobody fit tell me to leave my baby. Bend every night.
So we'll start now. Innovations in the management of diabetes-induced oxidative stress. We all know what diabetes is. It's a chronic disease whereby the pancreas does not produce enough insulin, or even the insulin that the pancreas produces, the body cannot effectively use it. So it leads to a condition called hyperglycemia. Now, the burden of diabetes mellitus can be understood in terms of prevalence, cost, financial cost of managing the disease, and complications when it is not properly managed. The basis of diabetes complication: once there is hyperglycemia, it leads to poor circulation of blood and shortage of oxygen. This can induce anaerobic metabolism of glucose, leading to more production of lactic acid than pyruvate, increasing the production of the form of NADH than the oxidized form, leading to free radical production. Now, inflammation and endothelial dysfunction. What happens? Production of reactive oxygen species and age, that's advanced glycated protein end products, causes the release of pro-inflammatory cytokinase, which combines with lipid to induce endothelial dysfunction. This endothelial dysfunction is seen in microvascular complications like peripheral neuropathy, retinopathy, nephropathy. Now, the gradation of this microvascular complication leads to macrovascular complication like cardiopathy, stroke, and death. The consequence of the imbalance of the imbalance between the pro-oxidant over the antioxidant result in diabetes complications. So what do we do as pharmacists? There's a need for us to mop up these free radicals, which causes the problem, with antioxidants, and shift the balance back by daily supplementation alongside, very important please, alongside tight glycemic control. So the shift has to be from the pro-oxidant to the antioxidant. Now, Pharmaceutics Plus is your #1 supplication or your #1 supplement for healthy nutrition in diabetes. And this is what Pharmaceutics looks like. Pharmaceutics is now known as Pharmaceutics Plus because it contains alpha lipoic lutein, now with lycopene and taurine. Pharmaceutics Plus is scientifically designed for diabetic patients. It balances daily antioxidants that manages oxidative stress. It contains essential vitamins to support and improve metabolism in this category of patients. Contains key minerals and micronutrients to prevent complications. Key component that improves glucose uptake and metabolism. Convenient once a day dose, 1 tablet per day with main meal. It excludes transition elements such as the ferrous and the copper that can be harmful in metabolic acidosis. Now, Pharmaceutics Plus offers the glucose metabolizers, which is the alpha lipoids, chromium, vitamin D and C. The neuroprotective, which is the folates, zinc, magnesium, vitamin B12. The nephroprotective, which is the alpha lipoids, lutein. It improves sight function, and the ingredients responsible is the lutein, the lycopene, and the vitamin A. It's cardioprotective. Taurine offers that, vitamin E, and the alpha lipoic acid. Immunoprotective, which includes the zinc, the selenium, vitamin C, vitamin E, and vitamin A. Now, Pharmaceutics Plus indication and dosage. Pharmaceutics Plus is indicated for microsupplementation, essential in diabetes patients. Management of oxidative stress in diabetes, prevention of diabetes complication, daily supplementation in pre-diabetics patients. Dosage, like I said before, is 1 capsule, 1 caplet daily with meal. Thank you.
Please, we can do better than that. Another round of applause for her. Thank you very much. That was I'm sure we listened. We're not just... All right, do we have any questions? Should we take questions now? Any question for her? We have 2 presentations. We should have 1 or 2 questions from the crowd. Okay. All right. So if you have any questions or you remember any questions you'd like to ask, you can write them down and reach out to any of us. Thank you very much.
Okay, since we don't have any questions, we all know why we should give our patients alphabetic when they need it and reload when they need it. Thank you.
All right, another round of applause for her as she makes her way off the stage.
She wants a gangster in a bed tonight. She wants me, I know.
All right, people. Yeah, we're in for something cool. Cindy, they're not going to expect it.
So just to increase the energy in the room, because some people have started fiddling with their phones, we'll be having a little engaging section.
Yeah.
Yeah, it's just something light, something to keep the energy at optimum level.
Something light, yeah.
All right, so we need like 7 persons to quickly make their
Let's
way.
not make it democratic first. See, if you don't take sweet for your table, I will call you up already. So you're my friend, you know. But I need a volunteer from each of the tables to please just come and meet me up front. Please, thank you. Yeah, I just need a volunteer. I have gifts. I want to give you special sweet gifts. So just volunteer yourself. Somebody just come, meet me here. Okay, if you have won my recharge card, just come, please. Thank you. Just don't let me call you. You're my friend already.
Like you're going to call names
just
like
call,
this.
please. Thank you. Oh, thank
Okay,
you very much.
Someone is coming up stage.
Fact,
Thank you very much.
Beautiful.
I
love
should appreciate her now. You don't want to come up stage, you don't want to clap.
Yes, that's for your table. Thank you. Please, each table bring a representative. Let's just make it democratic.
I think you're going to go into the crowd now and
you're beautiful.
Get some victims.
Just stay here. Thank you. Yeah. All right, any more handsome guys, beautiful ladies. Starboy. How far now? Somebody should call. Yeah.
CJ. Yeah. CJ, please round of applause for him.
I appreciate you.
Please appreciate him. Please, it's your table member. Give him some accolades. Thank you very much.
Three guys, men there. Good. That's the second table from the front. Yeah, waiting for Amy, your table. Welcome.
Elijah, from this table, you cannot hide. Please appreciate him as he makes his way up stage.
Thank you, Elijah. You're welcome.
Thank you. Upstage, please. Thank you very much.
More than 90 million that white money went away with.
This table. Okay, you guys nominated who? Uche. That's my sister's name.
Uche.
Okay,
Uche.
Woo. Uche, please. Thank you very much. Looking good. Nice.
Yes,
okay. Thank you very much, Uche.
Yeah.
Who is the person that ran away?
Somebody ran away.
Okay, thank you very much. What's the name? Taiya.
Uche, you're welcome.
I cannot pronounce that. Thank you very much.
Wow. Thank you. Yes. Some tables
I'm confused between
maybe we can just go
Bom Bom
Let's
and
leave
Farad.
those tables. They will feel jealous later on, but
Desmond.
let's not let them miss out.
Make your way upstage, please. A round of applause for him.
Woo! Desmond, go Desmond.
We have 6 people now.
Yes.
Yeah. So one more person and we are good.
See, any table that there are more than 3, okay, somebody should come.
I don't know. Alright, we have our final person.
Yeah, and let me bring one of the escorts. Thank you, YPG.
No, don't worry. I've got one person.
Thank you. So that you know just.
Please, a round of applause for her. That was 7 people.
Thank you.
I'm just that type. No, them no fit kill my vibe. Them no fit kill my vibe.
Okay, just quickly before we start the game, I'll give you the mic. I'll tell you the rules of the game. Something very easy.
Elijah said, "Oh, no, they dance."
No, you will not dance. You might dance, Sha. Don't trust my word. Anyways, just tell us your name quickly. What's the name?
Odunayo.
Odunayo.
Now you're welcome.
Okay, Ifeme Chijoke, known as CJ.
Oh yeah.
CJ of Lagos.
Uche.
Elijah.
Elijah. Taiya, did I pronounce that very well?
Taiya.
Desmond.
Desmond.
Ekbereka.
Yeah,
Right.
you got it.
Thank you very much.
Yeah.
Okay, do you want to do the honors?
No, please.
All right, so quickly, the DJ is going to give us something
Start with that vibes,
light.
Just give that vibe.
We like the vibes of vibing. So he's going to be passing.
I'll be passing this
that
around, okay?
each person.
I'm giving it to the next person, okay?
When the song stops.
When the song stop in your hand, you just go back to your seat. So DJ, like you, come back. So.
Why is my side? Follow the stars. You shall find them. It's a bad time. If your enemies shine. If you're not a friend of me, enter the light. But you can never kill my sound. It's only just with some sacrifices. Everything was.
Thank
okay,
you.
thank you very much. Please round of applause for her as she makes her way back to you guys.
If you get a woman who on title, me and my guys will take for title. Now her location take for mine. If you leave a woman, she go off title. No lie, because you see that up like the ivy. Me and my guys will make this lady. Big dog boys will make the lady. Big dog boys will make the girl.
Who are you giving it to?
This one, are you sure you are not doing this thing purposely?
Okay, thank you very much. Round of applause for her. Please, let's clap. I just appreciate. It's not easy. But wait, please, DJ. Right now, we're going to switch up the odds. Just maintain a distance, a little distance, just apart. No, you're too close.
So that you can walk towards the person.
So you can walk for it.
Right.
It was too simple all along.
Come here. 10 meters.
I know.
Yeah.
Okay, that's fine. No, that's too far.
You stay here. So
that's too far.
Thank you. So you can just walk. That's if you end for your hand. We don't say that your hand the end. All right, DJ, let's go.
I'm alright. It's a pointer to my head, say make I deny you. I don't know.
Thank you, Elijah.
Thank you very much. Round of applause for him.
See, so Cindy, when we get to the three people, this one will go dance. So the
you have to dance, because this prize we want to give like this. I don't even know the prize. DJ, please. Uche, sad to see you go, but a round of applause for her. Okay, please you have to dance this time. What is song I'm wasting? Who is out? Okay, Odurayo, please a round of applause for her.
Come and be like something. Put that on me, with your coca body. Come and be like something. Put that on me, with your coca body.
CJ!
Have a winner!
Yeah, he's going to dance for us. Give her one spot.
We have a winner!
You will dance for
If you want no Pepsi, you know they keep Pepsi. If you want no Pepsi, you go for Pepsi. Pepsi, you need Pepsi. I got money, you want me spend my money. Allow me to enjoy myself. 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 Allow me to enjoy myself.
See, that's right. Would Kelechi would reach out to you
my
on
guy.
the prize.
No, he's coming out again. He's coming in grand style.
It's not politics. Thank you very much. Please a round of applause for him as he makes his way back.
CJ, thank you. Our first winner for today, CJ.
Thank you very much. All right, I can see the hall is a bit full. It's better than how we started. So if you're just joining us, welcome, and you've missed. That's all I can say. All right. Okay, so we are going to be taking another presentation from Guest Farmer. They are ready. They are ready for us. Please come up stage. Guest Farmer.
One
Round of applause for her, please, as she makes her way on stage.
You get to, don't forget. When I give my attack, you different. It's like you're different. Get to, don't forget. So you see that man, they go,
Good morning, everyone. Good morning. Yeah. My name is Omolade Bolaji, and I represent Get Pharma. I'm territory manager at Get Pharma. And I believe I'm speaking to young pharmacists, the future of pharmacy profession in some time to come. I believe you guys should give yourself a round of applause, because in some few years' time, you guys will be the future and be the leads in the pharmacy profession. Okay, as you can see here on the slides, we want to speak about life beyond allergic rhinitis. So, a patient walks into your pharmacy, Mr. Kunle walks into your pharmacy and complains of very, very severe symptoms of rhinitis, that is rhinitis, that is nasal blockage, pruritus, which is itching, a lot of symptoms, and is a bus driver and also is hypertensive. So how do you, as young pharmacists, tackle this issue, and how can you afford him a life beyond allergic rhinitis? But before I move on, I would like to introduce my company. Getz Pharma is a member of Getz Group of Companies USA. And it will interest you to know that Getz is amongst the few companies worldwide whose manufacturing facility and the quality control lab is pre-qualified and approved by WHO, as well as the pharmaceutical inspection scheme. So we at Getz Pharma have a common goal. We have the mantra to cater for the healthcare needs of every man, woman, and child, and ensuring safe, quality, and affordable medicines to be made accessible. What is allergic rhinitis? So you can ask yourself that. Allergic rhinitis is a common inflammatory disorder of the nasal mucosa, which is characterized by pruritus, which is itching, sneezing, which could be constant, rhinorrhea, and nasal congestion. And this common disorder, as we call it, adversely affects the social life of people. It actually even reduces their performances and productivity at work and school, and leads to a lot of missed school days and missed work days. How does the allergic reaction come about in the first place? So we're looking at a little of the pathophysiology of allergic rhinitis. So the hallmark of allergy is actually an immunoglobulin E-mediated response to hypersensitivity reaction of an inhaled allergen. So this allergen could be dust, could be mites, could be perfumes, could be anything that a patient or person can react to, leading to sensitization and harming of the mast cells, not just the mast cells, but a lot of other inflammatory cells. Inflammatory cells such as dendritic cells, as we'll be looking at, some of them are the T cells, the mast cells, and the eosinophils. So they also produce chemical mediators. Some of them could be chemokines, that's the histamines, the cytokinins, and prostaglandins, leukotrienes. So they bring about classical symptoms of allergic rhinitis, which are the repetitive sneezing that you would see. Most of them will come down with nasal congestion. This has happened to, I'm sure, everybody. But there are some people that actually have pronounced effects of allergic rhinitis that actually affect their daily life. Other manifestations of allergic rhinitis could be ear symptoms. So some patients can come and have ear pains, some of them have eye pain, some of them have swollen face, which could be other manifestations of allergic rhinitis. So you as young pharmacists, as the future of pharmacy, what should be your treatment goal and management of allergic rhinitis? What should be your, what should be at the back of your mind when you're managing allergic rhinitis? So you should know that your patient's sleep should not be impaired. Their ability to undertake normal activities should not be affected in any way. And their symptoms should have reduced and with none at all or minimal side effects. So the management strategies of allergic rhinitis includes, first and most importantly, the allergen avoidance. So we should try to explain to our patients that they should try to reduce or, if possible, remove any risk of allergies. So if they are affected by dust, they should try to reduce dust or perfumes. Another way is medication, which is the hallmark of allergic rhinitis treatment. I will be looking at that extensively. And overall, patient education should be carried out from start throughout the journey of the patient treatment. So what do the guidelines say about allergic rhinitis? ARIA guideline, which is the allergic rhinitis in asthma guideline, actually recommends a series of antihistamines or other medications in the management of allergic rhinitis. But before I continue, allergic rhinitis can actually be classified as mild intermittent, moderate severe intermittent, mild persistent, and moderate severe persistent, depending on duration of the issue and also severity. So we can see here that second generation antihistamines are recommended from first, that is from mild intermittent all the way to moderate severe intermittent, as well as other medications. And leukotriene receptor antagonists or anti-leukotrienes, if asthma, should be recommended from moderate severe to moderate severe persistent allergic rhinitis. So introducing to you Fexet, which is a truly non-sedating antihistamine from the stable of Getz Pharma, is fexofenadine 120 and 180 milligrams, which comes in these packages, in beautiful packages that will afford your patients a truly non-sedative treatment of antihistamine with fast onset of action. So why should you choose Fexet? Fexet onset of action is less than 3.5 as compared to placebo. You can see that Fexet 60 milligrams and 120 milligrams have comparable fast onset of action. Also, it is genuinely non-sedating. So we can see that Fexet at all strengths, at 120 milligrams, 180 milligrams, and even the highest dose of 240 milligrams is genuinely non-sedating as compared to placebo. So you can give your patients kunle this Fexet, and he would not sleep even while driving. He's a bus driver, so you need a medication that will not make him sleep or make him have other kinds of issues. In terms of sedation, looking at it that Fexet does not have any sedation, and comparing it to other antihistamines, which have partial sedation or a percentage of sedation as the medications are titrated up. So we can see here, further reiterating that Fexet is non-sedating, unlike other antihistamines, it shows no dose-related changes, as we saw in that graph. That even at 120 milligram, 180 or 240 milligram, Fexet does not sedate. And most especially, I mentioned that Mr. Kunle is hypertensive. So it has a documented cardiac safety. So a lot of medications, there are some medications that interfere with the QT interval of the heart, which might lead to exacerbations, or patients that are at risk of arrhythmia can actually predispose them to arrhythmia, patients with hypertension. So with Fexet at 180, 120, and 60 milligrams, does not show any cardiac, does not interfere with the QT interval or has documented cardiac safety as compared to placebo. In terms of the onset of action, Fexet works within 45 minutes as compared to other antihistamines. And its half-life is from 14 to 15 hours, which shows that it can actually work for a whole day, which affords the once daily medication. It has no reported anticholinergic activity as well. So what have I been saying? Why do you need to choose Fexet? You need to give your patients an allergy-free quality life. Fexet works in a rapid time of 45 minutes, has a sustained 24 hours coverage, is non-sedating, and will not interfere with the QT interval or affect the patient's health in a bad way. So it is recommended as first line as well in treatment of allergies. Looking at this other part, we can understand that allergic rhinitis, most often seen as a very common disorder or disease, does not just stand alone. It usually is associated with a number of other diseases, such as asthma, otitis media, upper respiratory tract infection, sinusitis, and a number of other comorbidities. So that is why at Getz Pharma we understand these facts, and we are able to provide medicines that would tackle not just allergic rhinitis, but is able to tackle asthma as well. So we'll present to you Montiget. Montiget is Montelukast 4, 5, and 10 milligrams, which is an essential component in the management of asthma and allergic rhinitis. Montiget is a once daily medication that would make sure you have the backing and full confidence of asthma control from day one. Looking at Montiget a little bit, we'll look at this, that comparing Montiget with an inhaled corticosteroid and an inhaled corticosteroid alone, we can see that Montiget significantly reduces the asthma exacerbation of patients to up to 35%. That's if combined with an inhaled corticosteroid. And also, Montiget reduces the advent of daily rhinitis symptoms in patients from 15 to 85 years that underwent this study. So what have I been saying? Montiget is available as 4 and 5 milligrams and is a cherry-flavored, chewable and dispersible tablet, and is the only recommended tablet according to the GINA guideline in the management of asthma. Also, you can see that it was backed up by the ARIA guidelines as well. It is also FDA approved in children from 6 months of age and older in asthma and allergies, and to address both ocular and nasal symptoms of allergic rhinitis. As I said earlier, Montiget is conveniently once daily, just as it, and can be used from patients from 1 to 5 years. That's the 4 milligram strength. The 5 milligrams can be used from patients from 6 to 14 years, while the 10 milligrams can be used from patients 14 years above. At Gets Pharma, we are proud to say that we are one of the few companies in Nigeria that are in the forefront of asthma and allergic rhinitis care. So we have, presenting to you our asthma and allergic rhinitis portfolio is Fortide, our budesonide and formoterol combination, which is a novel treatment in in asthma presently that is recommended by guidelines. That's the Global Initiative for Asthma, that's the GINA guideline, and also recommended by specialists in Nigeria and worldwide. Also, not just that fact, it is a single maintenance and reliever therapy. So we call it a smart inhaler. That is the red-colored inhaler. A smart inhaler that would afford your patients of both relief and control. So your patients just need one canister to be able to take care of both their acute symptoms and also chronic symptoms of asthma. Also, we have Saltrol. Saltrol is a combination of salmeterol and fluticasone, 25 and 125. And we're proud to say we're the only ones with this 25 and 250 milligram strengths. So we say you can step up your patients to the highest dose possible in treatment of asthma. So it has proven efficacy in control of asthma. And also, as we said, and Montiget, they are the hallmark in the treatment of allergic rhinitis for both acute stages and also chronic stages, from mild, medium, mild, moderate, and severe allergic rhinitis. So at this point, I would like all of us to bring out our phones, our mobile phones, and go on Facebook and type LD Nigeria right now. Please, if you can. So you ask me what is LD Nigeria, you should be eager to know what I'm telling you to do. So LD Nigeria is from the stables of Gets Pharma. We're not bringing out our phones. Please do, if you can. Is from the stables of Gets Pharma. So it's a platform from us that we are aimed to share unbiased opinions of experts. That's consultants, doctors, pharmacists. We want you to be part, and we host a number of, we host more than 5,000 Nigerians, and we talk about LD issues and how each Nigerian can actually live better and live a more fulfilling and purposeful life with, with great knowledge of what they are battling, whether they are battling with any issues or any diseases. Thank you so much for listening.
Thank you. Can you please put a round of applause for her? Thank you so much. So on Facebook, you just type Healthy Nigeria and, so that Healthy Nigeria, Cindy, thank you. So I'm a gentleman. All right, so when you get Healthy Nigeria, I'll ask for it. I'll just come to your table. Just screen grab that plate for me, okay? If I come to your table and you have it, man, we have lots of gifts to give out today, okay? But during the presentation, so many people were just talking. There were noise. We couldn't hear her very well. Please, this is not good for us. Let's try to listen, keep quiet.
Reduce the noise,
yes.
please. The noise is too much in the hall.
This camera is going everywhere. So please, that thing we did in the morning, where somebody was taking sweets and we could see you take. So please, when you see anybody that is talking like that, I beg, just help me show the person, okay?
All right,
Cindy, so.
Again, welcome if you are just joining us. And like I said previously, you have missed. Well, in the spirit of benevolence, we would still continue with our giveaways.
Before they freeze our account.
They are,
tomorrow is anniversary.
Here.
Yes.
So, Glow users, 9 mobile users, rather. 9 mobile users. If you are ready.
9 mobile. Are you in the house?
Do we have 9 mobile users? I think. Okay. All right. I'll just start. 8947. I can't even see clearly. 2474 6598 942. Take that again. 8947 2474 6598 942. Nobody got it.
9 mobile.
9 mobile.
Yeah.
Okay, someone got it.
Big
Thank
man.
you.
Somebody got at the back.
Congratulations.
They are calling it. Let me call one. In the spirit of benevolence. If your network start with star 555 star, should I go ahead? Should I go on? No, let me change it. They don't have the.
If you don't know the star 55 star.
Okay, should I go to Glow? Or I should do MTN? All right, let me do MTN. Thank you. 6402. But don't forget to, if you win my giveaway, you will come out and do something, no? 6402 7982 06 37 6 2 2 4 1.
You will still get it. It's not by that one. Somebody will still get it.
It has finished now. I've called all the numbers already. So who is my winner? Yay! Big man. So that's our winner there.
Who is the winner?
Yeah. See him there. That fine guy there.
Congratulations. Thank you very much.
You're welcome. So, Cindy, how for that Squid Game thing?
Well, they said they want to play Squid Game.
Oh yeah, I beg. We'll do Squid Game. Green light, red light.
All right, let's just do something really quick. Something really, really sharp. So, yeah, let's.
All right, so we'll be having another presentation coming up next, but a very interesting one, okay? By one of our sponsors. Robotics will be coming up, but before they want to do green lights, red lights. Don't be looking for green light and red light.
With the help of the DJ, of course.
Yeah, but DJ, now you go start.
But wait, how many of us were at the Abuja conference?
More music on
this year? In July? Just, no. If you didn't come, you would have come. Okay. I see Starboy, I see Brian.
Starboy everywhere.
Just two people in this
Starboy go come do Squid Game.
You do not know we had a YPG conference in Abuja this year. Oh my goodness. Who again? Alright, okay, Vitalis, yeah, welcome.
Where Vitalis? Vitality, where are you there?
Oh, wow, the numbers are poor. Anyway, we played a game, an interesting one. But we decided to bring it down here. And I think people that just came will have to partake in the game because we played one game previously and you weren't part of it. So, just need 10 volunteers.
Volunteer yourself.
We say volunteers first. If you don't volunteer, we'll now
come. And you know me now. If I like your face,
10 persons.
I'll bring you out.
10 persons, please. So, or I'll go table by table and pick as I did before.
And the camera will go with us. So if you're doing no.
Of course, if you come out, you win something. Come out, there to be different. So, do it afraid.
I need a camera on me. The camera should be on me. So anybody I bring out, if you're doing, please, no. It will be on. Everybody will see it. So,
Casey, please start picking.
You know the event is being streamed on PSN-YPG YouTube channel and Pharmacists YouTube channel. So the whole world is looking at us. So please, we need volunteers from each table. Can you
from each table? Please, who's coming out from this table?
Volunteer somebody from your table.
So
who is coming out from here, please? Thank you.
Okay, you. Please come out. Thank you very much. Round of applause for her. Encourage her. Refuse to come and refuse to clap.
Out here,
what is happening? YPs?
Who is coming out here?
This table. Who are you giving? Who are you donating to the cause? They said it's you.
No, actually, a table that is somebody can come.
They have nominated you for this
table that is more than 3.
Please come out.
3 above.
Please come out.
All right.
Round of applause for her. Thank you very much that she makes her way up there. Woo!
Yeah.
Are you clapping for me? Are you clapping for me? Oh, okay. Oh, wow, nice. Nice. Encourage her. On stage, please. Is this smile for me? Nothing else.
So we are volunteers.
The energy is very low in this table.
All right, please come towards me. Come to meet me at the front. Thank you. DJ,
my fine friend, pressing phone. You're pressing phone. You think I will not see you? You're not coming. Who else?
Join me here. This guy is need to hold my phone.
Get someone now. You are just.
Thank you. Yeah, let me stay beside us.
Maureen, go Maureen. All right. Please make your way. It's very simple. You have fun. Please come on stage. Thank you very much, Maureen. How many persons do we have?
Yeah.
Okay.
Some people have not brought somebody.
Okay. Please. Someone has gone out. Why are you so happy? Has anyone come out on this table? What has come out? Nobody. Please join them off stage.
One man thing is another man's struggle.
Okay, Starboy, this time you have to represent your people. Who did you send? You're the next.
You good is a happy day.
He's out already. Ella is out. Ella is out.
Vitalis. On stage, thank you very much. You're just coming. Oh yeah, go on stage. This table, who are we nominating? Someone has, someone has gone, not you.
Cindy, let me bring somebody out from this table.
Many people in this table.
The veto power vested on me. I nominate and I elect.
I think we bring 2 people out from this table actually.
Come on.
Please come out. Thank you very much. No, every table has to have a representative.
Cindy, where's the person? Who?
One more person. You need one more person.
Hi, Blessing. Are you from this table? No.
Please, we are not lying in this table. Okay, for suggestive blessing.
Yes. Can you see her? Yeah, please. Oh yeah, come join me. Oh yeah, now you can put your hands there. Thank
Okay, quickly.
Yeah, quickly.
Because we have an important presentation. So just quickly tell me your names.
Quickly. She came for war. No relax. I'm here with her.
Did you Vitalis? Victor.
She's 001 in the Squid Game.
Chinese.
Finally, you'll be 456.
Blessing. Maureen.
Okay, God will help me. I'll remember all these names.
Okay.
Anyways, the rules of the game. It's very easy, simple.
Now we calm down, relax. DJ, you don't have one way to go. Relax.
So the DJ is going to give us something light.
Yes.
Like we did in the first game we had. But this time we are not passing anything around. You're going to be dancing.
Yes.
And if this, you know how Squid Game goes, red lights, green lights. Red lights, green lights are supposed to move.
Yeah.
Then red light will be you stop. And
your body is shaking during the red light.
You will be dancing or moving your body, and then the song goes off, and you're still dancing, you're still moving, you're out, and like you're eliminated.
See, not eliminate like that. You're just dancing.
Okay, you're out of the game. So quickly, DJ, we got the game, the rules, right?
Let's go there. Move your body.
You have to share your team, your table member. I encourage your table member. That would be it. Another place. So come on, we dancing.
Some tables don't lose already.
Some tables are loose already. You have to dance. You have to actually dance. So it's not just dance. You have to dance.
Girl, I'm in love with your booty.
Hey!
Love with your booty. I'm in love with your booty. Girl, I'm in love with your booty. Girl, I'm in love with your booty. Girl, I'm in love with your booty. I'm in love with your booty. Girl, I'm in love with your booty.
Thank you.
Thank you very much. Okay.
Just go on.
People are not dancing. There's nothing happening here.
Yeah, you. Thank you.
Okay. You guys have to be the judge, oh, so watch it, whoever is.
Many days I've never seen. Every day I'm just alive.
Who moved? Somebody moved. Who moved now? She, Abby? Okay, please. Thank you very much. They said you moved. Yes. Round of applause for her. Please encourage her. Is a table member.
Same is like we also give the two best dancers. The two best dancers
Hey, the energy. It's a party starter. Who moved? Who moved? Nobody moved. No, there has to be a loser or something. Who moved? Round of applause for her. She makes her way back.
Thank you, Blessing.
Thank you so much, Blessing. We appreciate you.
This Squid Game title. This red light no work.
Red lights. Green lights. Oh, nobody moved actually. Nobody moved.
Yeah,
Okay.
time the
It's something shorter and hotter. Let's go.
Give us.
On my head, and I see you on your wrist. I put my hand on my head, and I see you on your wrist. See your body looking sharp, see your body is a baby, make me want to go here. And I'm like that girl. That girl, she got it, she got it.
Yeah.
Somebody moved now. Who moved? Ohala. Okay. I think we might have to make it a little harder.
DJ, play it again. I'm going to watch for this side.
I do the voice and the skills.
head moved.
Oh,
all right. Thank you very much. Please, a round of applause for her now. I mean, this one was really tight. DJ, please, this time, let's do it sharp.
Anybody that is not dancing will just go out. Thank you. DJ,
actually, it's true.
Yes, we can tweet the street game. We can increase the difficulty level. Let's go. That's out of the African camera. Let's go.
I had Bella. Who is the Bella? People should not beat me now. Okay, but somebody moved. Nobody moved. It's like it's only this part of the crowd that is participating in the game. Did nobody move?
You are enjoying the song.
Nobody moved.
You don't know when the person moved. DJ, oh yeah, see if you smile.
I started from the moon. I won't lie when I feel like but I'm bouncing.
No, somebody moved. Who moved?
If your eye is shaking.
Who moved, please? You want to say something?
Eye is shaking, Jerry. Thank you. You said no. Ma? Kenny. They say no, it's not Kenny. DJ, I beg that song, that one way. Oh yeah, do it this time. Because we need a judge. We need someone that will support us. Come. Come and pick.
For me, somebody moved. He moved actually. He moved actually.
Thank you. Can we appreciate it?
I feel like it's very
had me. Vitality. Make us proud. DJ, let's go.
What happened?
You are not dancing, you are
Thank you. So which kind of answer you do? I appreciate that. Say this kind of shake body.
Try. Wait. Bumbo. She moved. DJ, The lady in the middle. Wow, thank you.
It's a round of applause for her as she goes back to her.
But she has been dancing so much today. So Cindy, we're going to give her a gift for dancing very well.
Top three is not easy.
It's okay.
Oh yeah, let's do this.
Oh yeah, shake body.
Look at this big game. I bet that's taking it.
Oh yeah, shake body. I'm going to feel me now. I got the money and they feel me now.
This one is hard for me too. I just remember that I'm a pharmacist. Cindy used to have career in music and dancing. Those days in pants. Me, I was
Please,
in
let's just save them, put them out of their misery. DJ, give us something else. I think she moved.
No more round. No more round. Thank you.
You know what?
Thank you.
They're just going to give it to both of them. A round of applause for them as they make their way.
Thank you very much. Okay, let me call one recharge card as we have Novartis come up quickly. MTN 3684. Should I go on? 3684 1397 91 08 1 9 6 9 4. Who is my winner? Sure guy. Can we please
round of applause for our presenter from Novartis.
All right. Good morning, everyone. Ladies and gentlemen, as men of honor, we join hands. So standing on existing protocol, I would just move quickly to the presentation. My name is Olani and I work for Novartis. I'm the brand manager for the communicable disease franchise. And what the communicable disease franchise does is managing the portfolio for antimalarials and anti-infectives. So today we'll be looking at minimizing antimicrobial resistance and stewardship. So how do we protect our antibiotics? So what's your role as a pharmacist? You are a young pharmacist and you are the future of pharmacy. So we all need you to pay very keen attention to the use of antimicrobials so we can safeguard the future of our anti-infectives. So antimicrobial resistance occurs when organisms such as bacteria, viruses, fungi change the way they react to medications used to cure infections, and that's what results in ineffectiveness. You expose the microorganisms to these antimicrobials at maybe suboptimal concentration and they end up developing resistance. So antimicrobial resistance is a broader term for resistance in different types of microorganisms and encompasses resistance to antibacterials, antivirals, antiparasitics, and antifungal drugs. So it's basically referring to two aspects. So in terms of use and also in terms of prevention. So inappropriate use of medicines is responsible for developing antimicrobial resistance. Example, you prescribe an antibiotic for a viral infection. Your patient comes in, complains of nasal blockage, and you assume it's bacterial. You prescribe an antibiotic. You're also part of the cause of antimicrobial resistance. So for cold and flu, using of antibiotics for viral infections, it's not advisable. Also, the use of low-quality drugs, which is why you have companies like Novartis coming across with affordable medications at quality. Then the wrong and inappropriate use of prescription and pharmacy recommendation. Many a times patients come in and just ask you for an antibiotic, you prescribe, you give it to them. That's wrong. They also come in, they tell you they have a certificate, you do not send them for an MCS. That's also wrong. So let's try to stop that practice. So also poor infection prevention and control, then poor surveillance on antibiotic use and emerging resistance patterns. Then also the diminishing arsenal of tools to diagnose and treat or prevent antimicrobial drug resistance. So the Novartis Antimicrobial Resistance Campaign program aims at leveraging on partnerships to ensure the right antimicrobial products reach as many patients globally as possible. So we're trying to drive patient access to quality medication. So we're trying to do it ethically and in a sustainable way with a 3-tiered approach. Improve knowledge, which is what we're doing now, through evidence-based research and adaptive development techniques. Also drive access to quality medicines. That's our watch patient access. Then also strengthening the healthcare ecosystem through education and stewardship programs. From time to time, we have antimicrobial stewardship programs, both fiscally and virtually. So in 1945, we all know Alexander Fleming. Who's that? He discovered penicillin. So he said the greatest possibility of evil in self-medication with penicillins is to use too small dose. Then also, thank you. So also, instead of clearing up the infection, the microbes are educated to resist penicillin, and a host of penicillin-fast organisms is bred out, which can be passed on to other individuals. That was said by Sir Alexander Fleming. So what he's simply telling us is that you expose a patient or a microorganism to a suboptimal dose, the organism becomes used to the medication, and that organism is passed on. So that resistance strain is passed on from individual to individual via various means. So what's the responsibility of the pharmacist? Promoting optimal use of antimicrobial agents, reducing the transmission of infections, and educational activities. So your responsibility is to encourage multidisciplinary collaborations within the health system to ensure that the prophylactic, empirical, and therapeutic uses of antimicrobials result in optimal patient outcomes. So that will be achieved by aiding in appropriate selection and optimal dosing of the antibiotics, then also the rapid initiation and proper monitoring and the escalation of antimicrobial therapies, then as well as the development of restricted antimicrobial use procedures, treatment, and guidelines. So all these is your job. Then also the operating a multidisciplinary concurrent antimicrobial stewardship program that uses patient outcomes to assess the effectiveness of any antimicrobial that is being used in the healthcare system. Then also importantly, generating and analyzing the quantitative data on antimicrobial drug use to perform clinical and economic outcome analysis. All this we're saying is just to ensure that we involve the community practice, the community pharmacy staff in patient education is very important. It's not the job of just a doctor, it's also your job as a community pharmacist to educate your patients on the impact of irrational antibiotic use. Then also, so the community pharmacists have the most significant opportunities to intervene and prevent unnecessary antimicrobial use, as patients usually come to you first to seek your advice. So make use of that opportunity. When they come to you, make sure you give them the right advice regarding the antimicrobials they use. So from Novartis, we have amoxiclav. Who here doesn't know amoxiclav? I have a gift for you. I was very sure no one will win my gift, so thank you. All right, so from Novartis, we have our amoxiclav, which is a Sandoz brand, and it's the cornerstone of global healthcare system. Antibiotics is the cornerstone of global healthcare system. So our amoxiclav is our generic brand, and it represents the majority of the global market. So as a global leader in generic antibiotics, we play a very key role in ensuring we keep the healthcare system sustainable. We want to ensure the antimicrobials we produce do not develop resistance. So we need to go ahead to ensure we educate our pharmacists. So the antimicrobial resistance will lead to estimated 10 million deaths annually by the year 2050, unless the society acts now, which is what we're doing. We're acting now by passing across the information to you, educating you, so you can as well educate your patients and also ensure the right practice in terms of judicious use of antimicrobials. So patients are the heart of everything, and we will do anything to ensure our patients are well. So antibiotic therapy of community respiratory tract infections, the strategies for optimal outcomes and minimize resistance emergence. So basically, we ensure acquisition costs may be insignificant compared with the therapeutic failure. Then usually the inappropriate treatment of RTIs is expensive. So not using the right drug initially eventually leads to additional cost. Then also, if you look at the cost of the man-hours lost when they're out of work due to protracted ailments. So when there's failure with the first-line agents and there is now prolonged hospitalization and excess costs following the hospitalization. So also, agents that achieve improved bacterial eradication also have the potential to improve long-term clinical outcomes and reduce the overall costs of management. So we have our suspension range for the amoxiclav, and it offers more amoxicillin for appropriate dosing for every weight range. Then also there is availability of a syringe to ensure accurate dosing for caregivers. That's very important. The right dose is very important in order to prevent antimicrobial resistance. So amoxiclav for children offers a broad range of oral formulations, flavors, and packs for appropriate dosing. Then it has a pleasant fruity taste to nurture acceptance. So I'm just going to ask a quick question now. Who can tell us the 3 SKUs of the amoxiclav suspension we have? Quick one. Show of hands, anybody? All right, so we actually have the 156.25 suspension, we have the 312.5 suspension, and we have the 228 suspension and the 457 suspension. So I was expecting someone to point out it's 4 and not 3. So please pay attention. We have 4 SKUs of the suspension. So I'm going to invite my colleague over now to take the rest of the presentation. A round of applause for her as she comes up.
Good morning, everyone. Yeah, I'll just take over from where Niyi stopped. And as Niyi has mentioned, our ranges in Novartis. Novartis happens to be #1 in the world globally, producer of generic antibiotic. And it will also interest you to know that even though we are not the innovator brand of the amoxicillin clavulanate, we are one of the top 3 pharmaceutical companies in the world that produce amoxicillin, that produces antibiotics. #1 in generic leader and top 3 of the antibiotic producers in the world. Basically, Niyi has mentioned about antimicrobial resistance. Okay, can I go ahead, please? Okay, so breaking the antimicrobial resistance, as we know, I appreciate the fact that we have young pharmacists, and majority of us here find ourselves in the retail outlets. Now, when a patient presents to you at your centers, at your retail outlets, with an indication, bearing in mind that the goal of every antimicrobial therapy is to ensure that the pathogens are eradicated totally at the site of infection. Now, how do we break this cycle of antimicrobial resistance? From infection, when a patient presents with an infection, looking at upper respiratory tract infections or LRTIs, but majorly at our centers, if you agree with me, they present with upper RTIs. Now, there's an infection. Once an appropriate treatment is given, and when we say appropriate treatment, we're looking at the choice of antimicrobial given, the dose. These 2 things are very paramount when we are administering antibiotics to our patients. If the appropriate treatment is being given to these patients, we ensure definitely there's going to be clinical cure. And once there's clinical cure, it will definitely result into total bacterial eradication. By that, as a pharmacist, you have achieved the goal of an antimicrobial therapy. Now, once there is an infection, as a caregiver, as a healthcare practitioner, you do not give an appropriate treatment, that's you give inappropriate treatment, there will be failed bacterial eradication. And therefore, we have selection of the resistant strains of the bacteria, which will lead to spread. From spread, then you have increased resistance. Definitely, there's going to be a reinfection. And this is how the cycle of antimicrobial resistance continues until we give the appropriate... Can I have the house, please? Thank you. So this is how the cycle of antimicrobial resistance continues. Unfortunately, we are stuck with the few antimicrobials we have. Not newer antimicrobials are being produced. So we need, as a healthcare giver, you need to actually, when this patient presents to you at your outlet, ensure that while giving an antimicrobial, you first ask yourself, the choice is very important. And secondly, the dosage, it's very important. As I mentioned, the goal of an antimicrobial therapy is to ensure that the pathogens are totally eliminated at the site of the infection. If you do not ensure this, definitely we have the cycle of antimicrobial resistance continuing. In selection of appropriate antibiotic, there are factors that mitigate the selection of appropriate antibiotic. And first in the list is spectrum of activity. As we know from pharmacy school, we are told we have the broad spectrum antibiotic, we have the narrow spectrum, and then we have the extended spectrum of activity. By broad spectrum, they have coverage for the gram-positive, the gram-negative, and other species as well. Then for the narrow spectrum, okay. Can I continue, please? Okay. For the extended spectrum, they have more activities on gram-positive and then fewer activities on the gram-negative. I move on to efficacy, which is very paramount. And that is one of the reasons why when I'm talking about amoxiclav, I usually pronounce it as a KK brand, AMOKSIKLAV. As I mentioned earlier, Novartis is the #1 generic antibiotic producer in the world. And by this, when you are sure of the efficacy of the antimicrobial you are given to your patient, you are very sure that to a very large extent, you are going to break the cycle of antimicrobial resistance. Third, that's the safety profile. No matter how effective, how efficacious an antimicrobial is, you don't want to give something that will jeopardize the health of your patients at the long run. So safety is very paramount as well. And lastly, the dosage. The dosage, you don't want to give suboptimal doses. At the end of the day, the patients won't come out well. The clinical cure is not going to be achieved. So I move on to the possible causes of respiratory tract infections. As we know, we have two types of RTIs, that's respiratory tract infections. There is upper and then the lower. For upper RTIs, we have sinusitis, otitis media, pharyngitis, or tonsillitis. For lower RTIs, we have acute exacerbated chronic bronchitis. There is also community-acquired pneumonia. And their causes vary. It could be of viral origin, typical bacteria, atypical bacteria, and others. I will talk briefly about the upper RTIs. Otitis media happens to be one of the indications for upper RTI. And basically, it's a middle ear infection. And if we have noticed, when for patients who come to our outlets, they are usually younger children between the age of 0 to 5 years. While in adults, just about maybe 15% present with acute otitis media. And the impact is lifelong, depending on how these patients are being treated. The clinical features of acute otitis media, otalgia, irritability in the infant or the toddler, as I mentioned, it's more common in infants and toddlers. Also, there could be discharge from the hair, that's otorrhea. Fever could be present, bulging of the tympanic membrane, vomiting, diarrhea. Now, all these that I've listed doesn't have to be present before you actually... please, can I have silence a bit? Sorry. I will be done with soon. Thank you. Yeah. So, all these symptoms that the patient presents with in acute otitis media doesn't mean they will present with all the symptoms at your retail outlets. They might be just maybe 2 or 3, or even just 2, for you to actually diagnose that this patient has acute otitis media. Also, the pathogens involved are, we have strep pneumoniae, Haemophilia influenzae, and Moraxella catarrhalis. This is a 10-day comparison between amoxicillin clavulanate, that's a penicillin, amoxiclav, and a cephalosporin, that's cefodoxime. Now, this study was done for children below 2 years of age. And if you look at it, that's amoxiclav at 30 milligram per kg per day, while cefodoxime was at 10 milligram per kg per day. And at the end of this 10 days trial, it was discovered that this is comparing their efficacy and also the safety for the treatment of pediatric acute otitis media in children presenting below 2 years of age. And amoxiclav had 93.8% clinical cure rate as compared to the cephalosporin, that's cefodoxime, which achieved 88.2%. So we can see from comparison here between the penicillin, that's amoxiclav, and the cephalosporin, amoxiclav had a higher clinical cure rate compared to the cephalosporin, cefodoxime. What this implies is that oftentimes when we come to the pharmacy outlets, we find that most times pharmacists would usually say they prefer to give the cephalosporins. Why? I wouldn't really know, but we've seen the trend. Now you can see, even practically, this is not just theory. Practically, it's a first-line therapy, that's amoxiclav, in the treatment of patients who present with upper RTIs. What are the possible consequences of unsuccessful treatment when we do not give the right choice of antibiotic and the right dosage as well? There could be effusion, hearing loss, which is usually temporary though, permanent hearing impairment, depending on how well the patient is being treated, and this could also have a lifelong impact on the speech and language development of the child. So it is very important that when these patients present at our centers, that we give the right choice of antibiotic and also the right dose to them. Please kindly, if you have this on your table, could you raise it, please? Okay, thank you. So also, tonsillopharyngitis is also one of the upper RTIs as well. Antibiotic therapy can shorten the clinical course of the strep pyogen, which is responsible for tonsillopharyngitis, and it would prevent suppurate complications. By suppurate complications, we have Quincy's as one of the complications. However, the main objective of antimicrobial therapy is eradication of the pathogen at the pharynx. That is the main reason why we are giving an antibiotic to a patient who presents with tonsillopharyngitis, to eradicate the pathogen at the pharynx. As I mentioned earlier, amoxiclav belongs to the broad spectrum antimicrobial. It has coverage for gram-positive, gram-negative, and also anaerobes. I'll briefly talk about the mechanism of action of amoxiclav. As I said earlier, amoxicillin, which is a semi-synthetic penicillin, and inhibits the penicillin binding protein, which assists in the biosynthetic pathway of the peptidoglycan, which is responsible for the cell wall. Now, once the peptidoglycan pathway is being broken, definitely it will lead to cell lysis and then the death of the bacteria. So we can from this, if you look clearly, you see the beta-lactam antibiotic, which is the amoxicillin, and then the beta-lactamase, which is the enzyme, and we have the penicillin binding protein. Once the beta-lactam antibiotic cleaves to the PBP, it breaks down the peptidoglycan cell wall, thereby causing the death eventually of the bacteria. Also, this is another study which compares the efficacy in treatment of sinusitis and tonsillitis versus comparators. Now, the comparators, we have penicillin susceptible and penicillin resistant bacteria. We have the amoxiclav before treatment. We have 65 patients were placed on amoxiclav before treatment, and the outcome was that after they were treated for 10 days, 4 patients only were left untreated, and this could be attributed to certain factors. Now, what this means is that over 93% patients became better using amoxiclav. Now, if you look at the chart, for cefixime before treatment, you have 69 patients were placed on cefixime, which is a cephalosporin. And out of the 69, 47 patients did not come out well. That is like 32%, which is very poor. Only 32% recovered after treatment, as compared to amoxiclav, that you have over 93% patients coming out better. Now, that's for the penicillin susceptible. For penicillin resistant, we also see the effects of amoxiclav, whereby 42 patients were placed on amoxiclav, and out of the 42, 17 patients didn't get better. This is like over 60% clinical cure rate. Now, for patients who were placed on cefixime for penicillin-resistant strains, there was no improvement at all. So what this means is that if you place a patient who presents to your pharmacy on cefixime, and at the end of the day, the resistant strains are the ones present, most likely the patient would not come out better. So still to go, first-line therapy, go for amoxiclav, as we can see from these studies. And then we have the guideline recommendation. For ABS, that's acute bacterial sinusitis, from the guidelines Sinus and Allergy Health Partnership, the recommendation is that amoxiclav should be given as a first-line treatment in the treatment of ABS, acute bacterial sinusitis. We also have AECB, which is a lower RTI. It's also from WHO model prescribing. Amoxiclav is a treatment of choice. AECB happens to be a lower respiratory tract infection, and amoxiclav still is a first-line treatment. For patients presenting with community-acquired pneumonia, the American Thoracic Society says that a combination of amoxiclav with a macrolide, probably azithromycin or any of the other macrolides, for adult outpatient therapy. Now, for acute otitis media, the U.S. Centers for Disease Control states that efficacy against strep pneumoniae is the most important factor in the empirical treatment of this disease. Amoxicillin is the treatment of choice, and it has a good pharmacodynamic profile against the resistant strains of pneumonia, just as I showed you from the previous slide. As Niji mentioned, our SKUs, that's our stock-keeping units for suspensions. We have amoxiclav 156, we have amoxiclav 312.5, and we have 457 in Nigeria. We have 228 in Ghana. Why you might not see the 228 in Nigeria, it's presently not in our Nigerian market, but these 3 SKUs are present: 156, 312, and 457. They are the pediatric preparations we have in Nigeria. And they are in ratio of 4:1. That's the 156 and the 312. While for the 457 is in ratio 7:1. And I would like to state at this point, one of the benefits that are amoxiclav, often we get asked on the field, why 312? Why not 228 in the Nigerian market? One of the benefits of 312 as against the 228, the 228, if we look at their preparation, it contains 200 milligrams of amoxicillin, while 312 contains 250 milligrams of amoxicillin. Now, for patients who present from between moderate to severe infection, you might have, especially in days whereby our economy is fast dwindling, such patients might need to use 2 bottles, while if you use the 312 for your patient, you might be saving them money, and also at the same time, they'll be able to afford other medications on your shelf. If you've ever seen a amoxiclav bottle, either the 156 or the 312 or the 457, you'll find that compared to the other ones available in the market, we have a syringe in ours which ensures for accuracy, precision in dosing, and also it has a fruity taste. Usually for pediatric patients, they like to take medication when it's sweeter. The taste is what appeals to them. So you can be assured that when you are prescribing or when you are giving amoxiclav, either 156 or 312 or the 457, your patient is not going to reject it because amoxiclav, the KK brand, has a fruity taste. And we also have, for mothers which usually find it difficult to feed their children or that's to give them medication, the syringe will go a very long way in ensuring precise dosing. We have amoxiclav 375, 625, and 1 gram. The 625 contains 500 milligram of amoxicillin and 125 milligram of clavulanic acid or clavulanate potassium, as the case may be, while the amoxiclav 1000 milligram contains 875 milligram of amoxicillin, which is the main active ingredient, and 125 milligram of clavulanate acid. Why should you choose amoxiclav? I like to ask this. As I stated earlier when I wanted to start, Novartis has the #1 generic antibiotic production plant in the world. And we are one of the top 3 producers of antibiotics in the world. That's even aside our generic business. We also are one of the top 3 antibiotic producers in the world. This is one of the reasons why you need to choose amoxiclav, the KK brand. Amoxiclav, it's pronounced amoxiclav. Please, for the sake of patients who would come to, because oftentimes we find that when patients come to request for amoxiclav, you just give anyone. There is actually, this is the original amoxiclav you are seeing, the KK brand. Now, amoxiclav is a product of choice in empirical treatment. Empirical treatment, when there are no MCS done, amoxiclav is a treatment of choice for empirical therapy for patients who present with upper RTIs. It's also, we have a bioequivalent study with the originator brand as well. So you are very sure of the efficacy. It's a Novartis brand. If you know Novartis, Coatem is our products, and I'm very sure it's one of our, we are the originator brand of artemether lumefantrine. So you are sure of the efficacy. In Novartis, as patients are at the center of everything that we do, we are very patient-centric. So you are sure of the efficacy. Also, it's available in film-coated tablets in aluminum blisters, thereby preventing it from direct sun ray light. Also, we have the suspensions in fruity taste, and the dosage, the syringe is present in the pack as well for precise dosing. Thank you very much. If we have any question, but before I finish, thank you. These are a brand of anti-infectives, so that when you see them on your shelf, you know they are not. You might not see Novartis on them, but then these are. We can tell you authoritatively, these are Novartis. Amoxiclav for the adults, dose the 1000 milligram, and also we have it available in injectable form. That's 1.2 gram and 600 milligram. We also have a brand of azithromycin, which we refer to as Sutrox. We have it available in 200 milligram, 20 ml preparation. We also have 250 milligram and the 500 milligram. This is a Lendacin, a brand of Triazone from Novartis as well. Thank you very much. Sorry, please. I asked earlier if we have this on our table. I'd like us to open them, please.
Baby, you're a miracle, my life.
Please, have we opened the ones on our table? Can I get a yes or no? Okay, thank you. Please, if you have them open, can you raise it, please? Okay. Sorry, the lady in red. Please, can you stand up a bit? Is it orange? Sorry, I think the ray of light. Please stand. Thank you. Okay, so the one presenting to you, what can you see there?
2 children.
I didn't get you.
2 children.
2 children. Okay. And the children look lovely, right?
Yes.
Thank you. Apart from that, the SKUs, can you please mention them?
What?
The milligram.
She said milligram. Not milligram. Milligram.
Yes.
I'm seeing 25 milligram.
No, please look at it. It's there.
156 312 457.
457. Thank you very much. Now, can you tilt it a little? Okay. If you have, which one, Idaya? Is she on the 45 milligram or the 25? Now we have 2 phases. There's one for the mild infection at 25 milligram. Then we have 45 milligram per kg per day. That's for the moderate to severe dose. Is she on the moderate to severe? Mild. So, okay, mild. Okay. I think she's... Are you here, please?
Yes, I am.
Okay. So if you have a child who presents with a mild infection at your pharmacy and presents with a weight of... can you turn it to 7 kg? 7 kg. For the mild infection is the 25 milligram per kg per day. Are you there? So for a child, a toddler who has a weight of 7 kg, what is the meal the child will be using, please?
3.5.
Okay. Thank you very much. Please, do we all understand this? Yes. Thank you.
All right, please, a round of applause for her. That was a wonderful presentation. If you were listening,
thank you very much. Cindy, you know when they asked that lady, what can you see? Says you see, she saw 2 children.
Power of perspective, that's what she saw.
Yes. I can't tell my guy there. So if my guy, they ask, what do you see? You go see money for there.
So women are not interested in money. Feminists, where are we? Okay, please, a round of applause. We have done so well.
Yes.
Thank you for staying with us up to this time. Okay, we're going to be having a short... Okay, we're going to be having a tea break session just for 10 minutes. We'll sit down, we'll get served, but feel free to go out, network, meet people. The purpose of any young pharmacist gathering is to meet young pharmacists like yourselves.
Yeah, network.
Expand your network, meet people, go out.
As a network, may not miss your tea.
But just let's just take a short break.
We have 10 minutes.
When we come back, we'll be having another presentation.
So, but just be on your seat. The protocols are going to get to you and serve you to make it orderly. And feel free, as you say, network, talk to somebody. Okay, but just 10 minutes. We have 10 minutes for this as we get ready for our panel session that is going to take place immediately after the tea break. Okay, we've kept our panelists waiting for so long. I've met so many of them in programs. I've had them speak. I've sat under, the tutelage, and it's been so inspiring. In fact, I really want to get to listen to them again. So today is a very big day for us. So please relax, take your tea and the snack, and just you can network 1 or 2 people, and then we proceed. So I want to call out another network. I think I've done so much of MTN. I think I've not done Airtel. I have so much recharge card here, Father Lord. Okay. So let me do Glow and 9 Mobile and MTN. Which one should I go first? Ma? I want to hear, which one should I take first? Glow. All right, Glow users. Do we have Glow users here? I can't see hands. Do we have Glow users? All right. And Glow it is. While we were having the presentation by Novartis, one of our big brother came in. You know, he's a man of timber and caliber. He's an Iroko. So I want us to recognize the presence. Let me leave it for now. Let me not disturb him. He's doing something serious. Let me take the Glow recharge card. 43988. 43988. 43988. 29387565. 25. That's all. So he's our winner. Yay! Correct guy. Congratulations. We found a winner for our Glow recharge card. So let me call the next one quickly. Airtel users, are you in the house? Please, we're serving the tea and the snacks already. So please feel free, eat your food as we get ready for our panel section. So Airtel users, 55500830655052. Why are you making me to laugh now? 3 6 That's all. So who is my winner? Who is my winner? Airtel. No winner. Winner. Thank you. So that my some people are falling for it. Maybe I will not do that again. MTN, finally. Should I go on? DJ, slow on. So that they can hear me call the number. MTN users, are you ready? 9 5 5 1 7 9 8 2. Okay, I was just paused there. During the presentation, a lot of tables were having some side talks and it was disrupting the presentation. Please, I want to indulge us to try to be more quiet and listen during presentations and when sessions are going on. But we have times that you can discuss. Like now, this is tea break. You can go up to a table, walk up to somebody, ask for the number, network. You want to change your jobs. You want to ask. Just relate and interact, okay? All right. What was the last number I called? 2. All right. 8 9 8 3 1 1 7 8 1. You said I should not do so I'm not doing That's all. Who won it? Congratulations. Thank you. Please, music.
I know you're looking at me.
We have 7 minutes remaining.
You're looking at me 3 times.
Just ask people questions from the table, interact, stretch your leg a little, have your tea, and then I'm coming back with some more cards. I can't go home with all this. I still have MTN, Nine Mobile, Glow, Airtel, Airtel, Nine Mobile. I think I should take one Nine Mobile. Do I have Nine Mobile users? If it's one person that is in Nine Mobile, just come and collect it, please. Who else is in Nine Mobile here? Only one? Okay, 2 people, 3, 4, 5, 6. Okay, let me just call it out. If it's just 2, I'll just call the 2 and share the Nine Mobile within the 2 of you. But since it's around 6 people using Nine Mobile. So Nine Mobile, 3, 4, this one is fastest finger. 3, 4, 0, 2, 8, 8, 7, 1, 4, 7, 3, 6, 0, 8, 2, That's all. So who's my winner? Yeah, congratulations. But you didn't wave that you are using Nine Mobile, okay? I think our audience can also participate in this giveaway. So, you know it's been streamed. So if we didn't see a winner here, know that somebody online has won the card, okay? All right, let me do Airtel one more time. Airtel. I want to do so much as I can do because of time. So that when we start the panel sessions and we move on, we can have time for other things, okay? Airtel users, are you ready? Airtel users. 52 35 58 56 61 06 69 10 That's all. Okay. So who is my winner for Airtel? Wow. Congratulations. That's the second time you're winning, right? That's the second time. Congratulations. So you win the next one, you transfer the airtime back to me. All right. Which one should I do, please? All right, I heard I should do Glow. No, I still have more Nine Mobiles. Let me do one more Nine Mobile. Nine Mobile, are you ready? If you have gotten your snacks or tea, can I just let me know where they stopped? Please, can we make it snappy? I think by the time we are served, we can just start the panel session quickly and make progress because of time. Nine Mobile. All right, so let me call Nine Mobile and then we'll move on. Nine Mobile. 2 3 6 1 4 3 0 2 0 5 7 7 9 9 9 Congratulations! That is the second time you're winning, right? The third time. The first time. Good. As I step down, let me do MTN quickly. MTN users. Should I go on? MTN, should I go on? Okay.
Yes. As the tea break is going on, please, one house. We'll be having the panel section now. Our panelists are ready, and the moderator as well for the panel section.
Yes.
If you were in Abuja, I keep making reference to Abuja conference because it was one of a kind. You would know that the panel section is something you want to listen in, you want to actually be part of. So right about now, I'll be calling the panelists that will be doing justice to this section upstage. I believe they've been ready for us for a while now. So we have 4 panelists in no particular order. Pharmacist Ezine Onwekwe. Pharmacist Ezine Onwekwe, please, a round of applause for her. And apologies if I've ordered the name. Pharmacist Morakiyo Adejari.
So, Pharmacist Ezine is the Victoria Vaccine Program Coordinator for ACDC. You're welcome, ma'am.
Thank you very much. Please.
And then wife Morakiyo is the former founder of Mind Medicine. You're welcome, sir. Please.
Round of applause for our wonderful panelists.
Okay.
Also with us on the panel section will be Pharmacist Uzo Amatoku.
She's the Regulatory Affairs Head, Sanofi Aventis Nigeria. She gave us a beautiful lecture the last time we
met at the Sanofi presentation. Yes. Round of applause for her, please. As we are eating, let's also clap. Finally, the last but not the least, Pharmacist Omowumi E. Oga, the CEO EXC Pharmacy. Round of applause for her as she makes her way up to the stage. Do we have anyone joining us, any panelists joining us virtually? I think not. Okay. The moderator of the panel section, okay, that is Pharmacist Taiwo. Please, a round of applause for her as she also makes her way up stage too.
Fam Taiwo in the house.
Fam Taiwo, Taiwo, make some noise.
Okay, thank you very much, Cindy. Thank you, KC. I will not be moderating this panel session alone. I will be co-moderating the panel session with pharmacist Temitope Ben Ajepe. Woo! All right. Thank you very, very much. You all are very welcome to today's panel session. Okay, and I believe that we are all aware of the theme of today's opening ceremony, the new normal, emerging roles for young pharmacists. We are currently joined virtually by Pharmacist Onwekwe, the vaccine program coordinator of Africa CDC, is unavoidably absent, and she's joining us virtually. And we look forward to having a very interesting discussion on the theme. Thank you very much for making our time to share your thoughts with us today. Please give a round of applause to our panelists. All right. Tammy?
All right, good afternoon, everyone. Or is it morning now? Good afternoon, everybody. I want to thank our panelists especially for joining us. I know that we started late, but once again, I apologize. Thank you so much for taking time from your busy schedule to join us today. So I would like, without further ado, I would like to just dive into the meat of it. Can you tell us, starting with the gentleman, because this is a heavily female panel, can you just tell us what your thoughts are on the theme of this program?
All right. Good afternoon, everyone.
Good afternoon.
My name is Moraki Adijari. I'm a pharmacist, like I believe most of us here are. And today we're talking about it's emerging roles, correct, for young pharmacists. There's a lot that can be said, but I would just like to draw attention to the other trends outside of the practice itself. The world as we know it today has changed significantly, and it will be it'll be to our own detriment if we're not paying attention to the changes in the trends as well. And I'm guessing we'll touch on that a lot today, and how those trends, are impacting what the possibilities around work currently, as well as the future of work is, both within and outside of the profession. I think there are a lot of possibilities within the space, but I'll take us off track a little bit to also talk about the possibilities outside of the space and how your profession as pharmacists really gives you, thank you, sort of gives you the perfect launch pad, to explore beyond what the current possibilities within your profession are. So I'll leave it at that for now, and hopefully we get to touch on more things as we proceed.
All right. Fam Uzo.
Okay. Good afternoon, everyone. Thank you so much for inviting me. I've had a very exciting time. I've been smiling from ear to ear. I think the topic is on point. I really want to congratulate the ESCO and the people who made a choice of the topic, because, it's so important that you know the opportunities that you have. Coming out of school, you're fresh, you're a young professional. Sometimes it's possible for you to be too narrow-minded. You don't know the possibilities that you have. As pharmacists, I agree with my colleague. Your training is like a launch pad. You can do anything. I don't see any reason why someone like Cindy can't pursue public relations. I don't see any reason why. It's very clear that she's so passionate about it. So you're unlike some other medical professions. You're not so restricted. You do everything. You get a bit of everything. You get a bit of the business. You get a bit of science. You get a bit of regulation. So there are possibilities, and you can do anything. So really, this kind of forum is very eye-opening. And I think it's something you should leverage on. It's something you should listen to, and hopefully, I know that you will leave here with more clarity. Yeah.
Hello, everyone. My name is Omoumi Emmanuel Oga. First and foremost, I want to commend the organization of this program. I was talking to Shina Okpanubi a few minutes ago, and we were really surprised that young pharmacists could do something like this. And I heard about the national conference. Really, a round of applause for all of you. So speaking to the topic, emerging roles for pharmacists, for young pharmacists, that topic is very important, right? I was discussing with pharmacist Morakinyo, saying the pharmacy profession, if we're not careful, could be a curse. So it's a blessing and it's a curse. Why? Many times we say we are pharmacists and we stay restricted, but there's a world of possibilities beyond the pharmacy profession. So your profession as a pharmacist gives you the platform, and then you can now step back and look at different industries and ask, what can we do as pharmacists? If you look at it, many industries have been disrupted. You have the retail industry, has already been disrupted. The hotel industry, e-commerce has been disrupted. And so that tells you that very soon we should expect disruption in health. Now, as pharmacists, how can we lead that? And so that's what we should be looking at as young pharmacists. What can we do to change the status quo? What can we do to improve on what's already on ground? So I think I'll stop there for now.
Well said. Thank you very much. Please give her a round of applause. Thank you very much, ma'am. Indeed, there is a world of possibilities with pharmacy. I would like to hear from pharmacist Ezine Onwuekwe, who is joining us virtually. Pharm Ezine.
Can you hear me? Good afternoon. Hello?
Hello. All right, ma'am. We can hear you. You can go ahead. All right, well, we hope that she joins us fully. We would now like to hear from our panelists. You all are undoubtedly blazing trails in your various fields: community pharmacy, public, global health, regulatory pharmacy, tech. Many young pharmacists who look up to you would like to know what took you from where you were many years ago to where you currently are. And if you would be kind enough to share a bit of your story, we would appreciate that.
Okay. So I have been practicing for about 12 years, 13 years, I believe. So how did I get into retail? I call it retail pharmacy. I started so during internship IT, I had my stint in the hospital and then youth service, and I knew that was it for me. So I usually like challenging things. And so that stint was okay for me. I had had enough of the hospital experience. Now, during my youth service, I served in Lafia. And I looked at the pharmacies around. And for some reason, I knew that wasn't it. I felt pharmacy could be better than that. And every time I was opportune to travel out of the country, while others are going to look at different tourist attractions or going shopping, I was busy looking at the different pharmacy stores there. And it was quite funny because I'll look at it and I'll take down my notes. Now, after that, I was opportune to work with GlaxoSmithKline. And I was in the vaccines department. I enjoyed my work there because it was an opportunity to do something different. Something, as a vaccine rep, I wasn't just going to see doctors and pharmacists, which is what the usual medical rep would do. Then we were going to see, we're going to schools, we're going to churches, we're having corporate meetings with organizations. So you're going to MTN, you're going to Airtel. And it showed there was a world of possibility. So that was quite an interesting phase for me. But I always struggled while at GSK. There's something we call PDP in GSK, and that's called your Performance Development Plan. And it was basically, how do you want to move from where you are to where you want to be? And I always struggled with that because I knew, I'm enjoying my work. That's not what I want to do. But if you ask me that same question about my personal ambition, you would see I had a big plan on what I wanted to do in the retail industry. And so last year, I decided to take a career break. And then I decided to face retail. And we started. It was quite interesting. We had one branch, moved to 2 branches, and currently we have 4 branches with about 2 more opening at the end of the year.
Amazing.
Thank you. So I guess it's just the passion, trying to do things differently, and of course, learning from those who have blazed the trail ahead of us. So that's basically it.
Beautiful. Thank you so much. Could you pass the mic to Pharm Uzo? Pharm Uzo, regulatory pharmacy is something that many young pharmacists aspire to. But seeing you doing beautifully at the zenith of it is something we'd like to hear about. Please share your story with us.
I didn't start out in regulatory affairs. It was basically adventure and an opportunity. Okay, so I started off as a medical sales rep with me and Baker. And when me and Baker was a franchisee for Aventis in Nigeria then. But then mergers and acquisitions, Sanofi, it became Sanofi Aventis, and they wanted to come into Nigeria and set up an office. And we're given the opportunity to stay with me and Baker or move over to Sanofi. I decided I wanted to move over because all the products I knew, they were going to be moving over, and I was too loyal to my products. The Amaryl, Tritase, I was wondering, Tavarnic. I wondered, what was I going to be doing without those products, basically? So I decided to move over to Sanofi. So we started with sales. I got tired of being in sales, actually, and I wanted to move over to something more settled. So it was like an opportunity. And I volunteered. So I volunteered when it was a very small office. When my country manager needed someone to do some work, carry this, carry that, I would do it. So immediately there was an opportunity for a marketing assistant, someone supporting the product managers that were offshore, and they said, who could do it? He said, why not her? So you see the importance of being available, the importance of going the extra mile. I'm just saying, going through a story. So I became marketing assistant. Going forward, a time came, there was the affiliate wanted to expand. They wanted additional roles like supply chain. I hope somebody is listening because these are opportunities for you. Supply chain is an opportunity for pharmacists. We have pharmacists in supply chain, and it's wonderful. At this time of disrupting the new normal, in this time of the new normal, supply chain is, if you're able to solve problems, supply chain is really a good place for you because, you need to support the business. You need to get them the products they need in the shortest lead time, and, you will be celebrated. So I was given the opportunity of moving over to supply chain and regulatory. So I took the challenge. I said, okay, so I'll move over to supply chain regulatory, and I did. After a while, the affiliate was expanding further, and they said, we would like someone to concentrate either on, we want separate departments, supply chain, regulatory. And I decided, okay, regulatory is good. An opportunity to, like regulatory starts the process, for every organization. If you don't register the products, they cannot sell the products. They come back to you at every time. So you're like a springboard for them. And I said, okay, I will go into regulatory affairs. And with that exposure, I was able to know more about how products come about. Know more. I've handled functions like quality. I've done things like anti-counterfeit coordination. This is where I spoke with you. I've worked with biosimilars. It's basically are you open to opportunities? Are you open to adventure? Not everybody can be open. I know not everyone is as adventurous, as some of us are. There's people that are a bit more adventurous. But don't close doors to yourself. I don't say to yourself, okay, I've come into sales and my manager is trying to open my eyes to somewhere else and I'm saying no. If I hadn't taken the challenges, and the risk I had taken, I wouldn't be here. You wouldn't have seen me that day talking about anti-counterfeit coordinator. It's actually extra work for me. Anti-counterfeit coordination is not, many times I'm not being evaluated on it, but I believe, it's something I should do. It's something I should carry my passion into, and that's where I'm doing it. So it's very important that you listen. We are here right now. Some people are having some side chats. Don't mind me, I'm picking on you like I always pick on Cindy. Yeah, but you should listen. You should be open to your opportunities, and you should take risks. You should jump. You should go the extra mile. You should stretch. That's very, very important. And, as you stretch, there will be more clarity. There will be more opportunities. There will be more open doors. You won't even be the one needing to open doors for yourself. Your managers will open doors. Your colleagues will open doors. You never know what would happen. It's really limitless.
Beautiful. Thank you so, so much, Ma. Morakinyo wants to tell us about his own stretch.
So, firstly, I appreciate the stories. I appreciate the fact that they seem quite structured or that there was some sense of direction. I didn't have that. If I was to summarize my story, I would say, firstly, embracing uncertainty, an appetite for risk, you mentioned, delayed gratification as well, and I think I'll leave it at those three for now. So, and serendipity, interestingly. So I was privileged to have a roommate in my final year who, had similar interests to me for just hitting our heads on the wall, trying to solve interesting problems, right? So we started out and tried to explore building a product in our final year. It was myself and 5 other classmates, so 6 of us, for an electronic health record system. Now, at the time, this wasn't something that was popular in this part of the world, and it was simply born out of a desire to, do something else. I had done locum pharmacy for a while, and it was clear to me that I didn't want to do that for the rest of my life. Now, this is not to say, or this is not to take away from the profession. It's very important that I make that very clear today. But it just became more obvious to me that I was tired of doing things the normal way, which is why we then started to explore building out things. Now, why I say an appetite for risk is because over the 2-3 years we tried building things, we failed woefully. This were 3 years of not working like most of our other colleagues who were already making a lot of money, or at least a lot of money at the time. Right, so it was then taking that leap to then start to explore more. Okay, if this didn't work, what else could work? What's more interesting that we could try out? And eventually we stumbled on something that did work, which was the e-commerce platform we built at first. And I've been privileged enough to, move on to working on other things. Interestingly, that's not what I do now, but it was the perfect environment for me to discover myself further, that beyond the profession, there are more sides to me. So I love this, I love that. And, while building products, I then discovered that, I have an appetite for actually building or designing software solutions. And I've been doing that for the past almost 5 years now. And I'm glad I took that path. Delayed gratification because it wasn't rewarding at the outset, but we stuck with it, and I can say there are great upsides to it now. So I guess what I'm just trying to say here is we are still young, right? Young pharmacists. This is the perfect time to take those risks that, you will not be able to take when you are 40. And chances are that you will regret more the things you didn't try out, more than the things you actually tried out and probably even failed at, than things you bothered not to explore at all. There are so many sides to everyone here. I mean, in my sets, I'm glad Ajibade is here. We had people who started to sing. People would go out to perform songs. People would go out to draw stuff. At the time, it didn't make sense, but now it does, right? So I guess I'll just leave it on the note to, explore the other sides of you. Pay attention to, the emerging trends and try to stretch yourself beyond what just the profession requires of you. Yeah.
Well said. Thank you. Thank you so much.
So I really like what Olga said about her traveling outside of the country and always taking the time to understudy what practice was like outside. And then coming closer home to what you said as well, that we don't have to restrict ourselves. That we're pharmacists doesn't mean we can't stretch. So I want to know, in your journey, what are the technologies? I know you're very invested in tech. What are the technologies you have leveraged on? And for the purpose of the audience, what technologies have you leveraged on? And looking back in retrospect, what do you think people sitting here today can capitalize on? Because our systems are very unstructured. I like what you said, your journey was very unstructured. We don't have the infrastructure that is available outside. So what are those technologies we can leverage on and then leapfrog to stabilize our own systems in our own unique context?
Okay, so pardon me, but I would like to rephrase your question and then answer it some other way. I wouldn't place as much emphasis on the technologies you can leverage because that is constantly changing, right? There are 1,001 ways to do whatever it is you want to do right now. I guess the priority should be more on systems and processes, right? So you identify a problem and then you try to understand what is and what could be. From a point of view of this doesn't work or this could work better, and how can we then improve on that? trust me, once you have clarity on what it is you want to build or what it is you want to improve on, the right way or the most efficient way to execute on it will jump out at you. The reason is because even in the event that you want to build a solution or you want to build a new technology, you're not going to build it all alone. Firstly, you're going to put together a team with different skills, and from within that team, you then start to get insights on how best to go about it, right? In my journey, I have done things in e-commerce, I have done things in enterprise systems, and in doing that, I figured, or now I understand better, that the technology is not really what's the most important thing. It's actually understanding the problem and then figuring out a way to, create a solution in a way that, firstly, who you're creating it for loves it enough to constantly use it or pay for it. In some cases, not pay for it, but, give you that data that is relevant to you. And then over time, you're better able to monetize that. So yeah, more emphasis on just paying attention more to problems, figuring out what the best, most efficient ways to resolve those are. And yeah, the technologies will always be at your beck and call, however much it changes over the years.
All right, thank you very much, Murakiyo. I see that Pharmacist Ezine is set. Pharmacist, please let us hear you. We'd like to know, of course, you are working with the almighty Africa CDC, and many people who are interested in public health, global health, would want to rise to that level. Could you briefly share with us what your story is like? I know you had experience in community pharmacy, yes, and then you were able to grow into the international development space, international health. We would like to hear what has helped you thus far to be able to transit successfully from the conventional to the relatively unconventional for the average Nigerian pharmacist.
All right, good afternoon. Can you hear me well?
We can hear you a bit. If you could speak more audibly, that would be great.
Hi, can you hear me better now?
Yes, we can.
Hello?
Yes, ma'am, we can hear you. Please go on. All right. Apologies on behalf of Amazing. I guess it's the network. Okay. Okay, great.
Yeah, we had a discussion and it went well. I don't know what you're doing right now. So sincere apologies for all of that. So my name is Gbagada. I'm a pharmacist trained pharmacist at the University of Nigeria. And yes, I started with the almighty. I did that at health pharmacy, and I was lucky enough during my YC to work for an NGO to run the DRS for my company too. I think that's where I do that with life. It was a job that was way bigger than me. And I really could do my boss for doing that job, but something that somebody with an experience of about 5 years ago, slightly. But the thing is, I tried to make my decision. I thought it, I did my best, I put my best, and made sure that opportunity I had, I did the best of it. And it was because of that job that I got 2 years out of school, I got a job in I just was university, and I think because of the experience I gained while 7, and the help putting that I've been focused on from every my life, not because so I have to study for that, and then for long so that was how it came and get the job. And then for people who want to get into it's a significant space to get into, especially international. What I think is, are you ready for it? As a student, what is working? Are you ready? And so you have mentorship help with that thing. Not that they're going to get the job, but they're going to help you position yourself better to be able to apply yourself that would make you attractive to the national. So that's what I'm going to say briefly about that.
Thank you very, very much. One thing I picked from all that you shared is networking. Not that it will get you the job, but it will strategically position you on the path to the job of your dreams. Thank you so much. I would like to ask Fam Uzoa, regulatory practice. I remember that I used to be interested in regulatory pharmacy. But on looking at how it actually plays out in Nigeria, NAFDAC, for example, I wasn't exactly excited anymore because it didn't play to my vision of my interest of the unconventional. And I think it is the case for many young pharmacists, especially those who do not want to be boxed in a corner. So I'd like to ask you, what excites you about regulatory pharmacy? And what emerging areas can young pharmacists begin to look at in the space of regulatory and administrative pharmacy?
Thank you very much. I can understand, if you're not someone who is excited about routine, regulatory affairs may not be, something you'll be looking at. Okay, for me, for me, what has kept me in regulatory is the fact that the company I work for is continuously evolving. There's never a dull moment, it's always this or that, and a wild portfolio, so many changes that you have to manage, so many times you need to negotiate with health authority, to get, one thing or the other from them. So that's what has kept me, I work in Sanofi, it's a multinational, and there's so many things. We have vaccines, we have biologicals, there are, drug products. So it's vast. What we do is vast and is immersed. And we are given the opportunity within Sanofi, to explore aspects that we are not in. For instance, if I'm in regulatory, I can decide to do something out of regulatory. But one thing I want to say is don't box yourself into any corner. I don't box myself in. I'm in regulatory affairs, but I never box myself in. You've seen it from my varied experience. Sales, marketing, supply chain, it has all helped me in regulatory affairs. I'm a go-to person. I'm a problem solver. So that's one of the reasons why I'm in regulatory. In regulatory affairs, you are a problem solver. Everyone comes to you. You have to have good analytical skills. You have to have good oral and communication skills. You have to be able to grasp concepts very fast, assimilate scientific data, evaluate scientific data. So those kind of things have kept me in there. Attention to detail is very, very is something that is very critical if you want to be in regulatory affairs. So how do I fight off the boredom? Because sometimes it becomes very, very routine. I solve problems. I look for problems to solve. I'm the kind of person that I don't sit still. If you would watch me there, I kept on getting up. I'm always looking for something to do. So I look at one product and say, Mario, why is it this way? Why are they changing the pack? What is the consequence for your market? I'm the one probing. I'm the one looking for marketing. What do you think the implication of this for? Why don't you fight it? So, that's the kind of thing that has kept me in regulatory affairs. The fact that I have enough energy, I have enough passion to put it into what I'm doing. Do you understand? So when you come into regulatory affairs, it doesn't mean you have to stay in regulatory affairs.
Thank you.
So when you come in, don't box yourself in. There was something that came into my mind, and I want to say it now. There are so many free resources in this generation. Don't dull yourself. Google has 1,001 free resources. Which one are you doing? Coursera has so many courses that you can do for free. Which one have you done? They are all quiet. So I just want to say, because I may not have the opportunity to say anything else, so you need to push yourself, beyond the norm. So what has kept me regulatory affairs that I keep pushing myself. You never see me be sitting and be bored. You understand? That's why I've been able to last. I'm pushing myself. I'm talking to the GM. I'm talking to communication. I'm talking to public affairs. Very soon I'll be doing something in vaccines. I'll be going into a shadowing. I'm going to be shadowing somebody in public affairs. So don't sit still, and don't say you don't have the opportunities. You have the opportunities. You can stretch. You can do more. You can take those courses Google is offering. You can take those courses Coursera is offering. You can take those courses Udemy is offering. There are so many. For me, it's amazing. So many free resources. When I open my computer, I'm not as young as you are. And I just wonder if I was as young as you are, the possibilities that I have. You can evolve. So don't say, okay, regulatory is routine. If you want to get into regulatory, get into regulatory. If you get tired of it, get out of it. There's no reason. Nothing is boxing you in. If you want to get into sales, get into it. When you get tired of it, get out of it. If you want marketing, get into it. When you get tired, get out of it. So nothing is boxing you in. You have the opportunity and you need to explore. That's about what I can say. Okay.
So from Olga, this question is directed at you. So looking at the work you have done, especially in the beauty space and with vaccines, and centering on the fact that it's retail, like you put it so nicely, what can you share with us as young pharmacists as regarding pharmaceutical care? And I just want you to speak, talk on the pain points now, like trying to venture into pretty much something that pharmacists don't necessarily do in our own neck of the woods. So maybe someone out there who is more interested in mental health, someone else who is interested in drug information services. What are those core components of pharmaceutical care that you have encountered on your journey and how we can maneuver?
All right. Thank you. First off, when Bukola asked me to be on this panel, I asked, are you sure I'm the right person? Because I felt I had just forayed into this aspect of pharmacy, and I felt there were more, people who had more of an experience in this. However, one thing I have seen with my short stint in community is the average person out there is hungry for information. They really want to know what is wrong with them, but more importantly is they want to know, how do I avoid this? One of the things I have encouraged my team to do is, we're not in the business of selling drugs. We're not in the business of making money. Of course, we need to make that money. But we're more in the business of supporting our people to live healthier. And how do we do this? Right? Let's give them that information. Sit that person down and provide more than the person needs, more information than the person needs. Equip the person with the right... with everything he needs to make the right decision. One thing I would tell many of us here is preventive health is an aspect of pharmacy, medicine that many people are not doing so much about. And of course, COVID has given us the right platform to look into this. And COVID is one. We will have many more diseases that will come out there. We had Ebola and we saw how people cringed and were wondering, what do we do? COVID came and it's an opportunity. Who knows what the next one will be? So in your sphere, yes, we have mental health, we have the chronic ailments. But one of the things I've seen people ask is, how do we prevent this? What do we do? How can I protect my child? How can I protect my parents there? So I think an aspect for those of us in retail, be that person that your clients will come in and say, I want to see pharmacist this, I want to see pharmacist that. And why? He will sit me down and educate me. He tells me the information I need to make the right decision. I have a young pharmacist working with me. His name is Femi. I don't know if he's watching this. Many times at our OPIC branch, people come in and think he owns the place. And you see people come in and say, we want to see pharmacist Femi. We want to see pharmacist Femi. And so I engaged him. Femi, why do you do this, right? Why do people always want to meet with you? And he says many times when people come and they want to buy a drug, he would first tell them, I'm not selling this drug to you first. And I'm wondering, okay, if you're not selling this drug, how do I pay your salary, right? But what he does is he sits down and then he takes them on a journey. He wants to know, what's your history? What's your drug history? What's your disease history? He wants to collect them and get that patient's profile. And then he's looking at the drug, and then he's advising the patient. So because it's coming from a point of information, that patient is able to trust what he's saying. And really in community, you need your patients need to trust you. I think that answers the question. All right, thank you.
All right. Thank you. Thank you very much. Okay, supply chain. There was a lot of craze around supply chain. And tech seems to be the new oil, right? Okay. How can we... I know that we are saying that people should still try as much as possible not to follow the craze, because the craze may not be for everyone. However, we know that tech affects every sphere of life, particularly healthcare. How can young pharmacists begin to utilize trends, especially in advancing universal healthcare coverage? I would like to ask you, because your area is the new oil.
All right. Interesting question. So yes, supply chain, universal health coverage. One thing is common, fragmented systems. And because of how fragmented the systems are, there are quite a number of inefficiencies. Now, with inefficiencies come opportunities to, do interesting things that optimize whatever value chain there is, with supply chain being the emphasis here. Now, to do that, firstly, I feel there is domain knowledge that is required, firstly, in understanding how supply chains work, with a focus on whatever industry it is that you are, focused on. So that'll be the first step. The next step would then be in understanding why those problems are there, who is benefiting from the inefficiencies, what other systems are there to circumvent or, to solve whatever issue there are with those inefficiencies. The last leg would then be, I guess, the technology you're interested in hearing about. And there are quite a number of ways to go around that. I don't have expertise with supply chain, but I'm guessing the technologies you would also use to resolve the issues in that chain they're not going to come from heaven. It's something that exists already. And I'm sure quite a number of us here have heard the word or the phrase, data is the new oil. Data is the new oil. There is a plethora of data that we are generating from literally every system we have today. And our supply chains are not outside of that system, right? So it takes being deliberate then in being able to figure out, okay, what's possible based on historical data that has been gathered over the years, what works, what doesn't work, and how can you then process that data into, reasonable insights on how best to then resolve whatever issues there are with whatever chain it is you've identified. And yeah, so that's one way to go. I guess machine learning can also help in that regard. But you see, universal health coverage is way broader than just the supply chain. And if we delve into that today, I don't think we'll be able to finish. But yeah, I'll just leave it at the basis of, understanding firstly where the inefficiencies are, getting a level of domain knowledge on whatever supply chain it is you have a focus on, and then, trying to do your own research on how best to optimize or, circumvent existing systems to achieve whatever result it is you're looking for.
Well said. Thank you very much, Marakinyo. Okay, so I'll go back to Fam Ezine. I should mention that Fam Ezine is speaking with us from Ethiopia, thanks to her work with the Africa CDC. Thank you very much for making our time to join us, despite your busy schedules. So I'd like to ask Fam Ezine, seeing that her work is in the field of infectious diseases. Yeah, you made mention of Ebola, and now there is COVID. And many times we speak about focusing on preventive health because it's one major way to advance healthcare for all. And you are doing a good job, Fam Omomi Oga, in the area of vaccination in your pharmacy. And Pharmacist is also working with an international agency in that light. And I know that many young pharmacists also look forward to working in that space of infectious diseases. So I'd like to ask Pharmacist how more pharmacists can plug themselves in that space. Oh, okay. I see she's offline. So any of us could respond then. I'd like to ask how more young pharmacists... Okay, she's back. Great. I'd like to ask how more pharmacists can plug themselves in that space. Because when we look at infectious diseases, maybe other healthcare professionals might find it easier to slot themselves into that area. Say doctors, microbiologists, pharmacists. Many of us do not exactly find it easy to get there. So I'd like to hear from you, Fam 18A, and of course, Fam Amaomi Oga. Thank you.
So what I want to say first is thank you for my age. I think we go to school, we study all these things, and somehow we in our heads we think we can't apply them. So we come out being a bit timid. I would like to say so because there are very many opportunities pharmacists leverage on that we do not leverage on. Because I don't see why you have a conversation around vaccination and pharmacists are not there. You have a conversation around EMR and pharmacists are not there. It's a pity, and it's not because we are not given a seat at the table. Sometimes it's that we are too afraid to actually even join a conversation. So I think it starts with us knowing that this is our thing. You have the capacity, you have the intent to do this. So don't shy away from any opportunity you have. At the primary healthcare centers, in the hospitals where you work, at the community pharmacies where you work, you have someone who's doing that in the community pharmacy. What are you doing about vaccination? The thing is, where you are, apply yourself the best you can. So that when bigger opportunities come, then you have the experience, then you have the expertise, then you can say, I've done this before in a small scale and I can do it in a bigger scale. So I'll just say, please, let's not be afraid to really get into that space. We call doctors bullies, but I don't think they're bullies. I think they just, proudly own the space. So you also should be able to proudly own the space because it's also meant for them. So that's what I can say. Apply yourself where you are. Be bold enough to take the steps. Be bold enough to put up that initiative to your boss. Be bold enough to say, I should be part of this initiative because I have. So that's what I can say about that.
To do is gain the knowledge, look for that knowledge. When I joined the vaccines team, I had just 2 days of training in vaccines. And I remember then, so we had, I think it was a week-long training then in GSK, but no, just 1 day. 1 day, we used 1 day to learn about vaccines. But I knew because I had an interest in this, I had to learn more. And so oh my goodness, I was going through a lot of material. I was going through the internet. I was going through, you have a wealth of knowledge on the CDC site, UNICEF, WHO. And I remember then, we could do this then, I was always adjusting my presentation slides. And during meetings, when I make a presentation, that's during the GSK in-house meeting, my marketing manager will come and say, Wumi, where did you get that slide from? I'll be like, I adjusted it, I researched something and I adjusted it, right? Of course, that was wrong, and I was stopped, but that was because I was looking for this knowledge everywhere. And as pharmacists, guess what? Nobody owns the space in infectious disease. Nobody. No, doctors don't own that space, nurses don't own that space, right? We are all healthcare professionals. And pharmacists are the most accessible healthcare professionals. But you need to know what you're talking about. So you start from gaining that knowledge. Right, find out, look at data, look at the trends, and more importantly, own your space as a pharmacist. Now, when these people come to you, you also want to direct them. You want to be able to tell them what to do. As pharmacists, beyond having the ability, beyond having this knowledge, for vaccines, you actually are supposed to store vaccines. You are equipped, right, with the knowledge and with the right infrastructure, right, to store vaccines in the appropriate temperature. And then guess what? You can create awareness. Many times when I talk to different people, I remember then when I was talking to doctors and nurses, I realized we really did not know. Many of us did not know about anything, right? So sometimes you pretend you know, but we really didn't know. When the news about the mosquito vaccine, the Mosquirace came out, I'm sure I received over 20 calls. And I had left vaccines about 6 years ago. I received over 20 calls about that vaccine. What's the dose? Does it work? Has GSK brought it in? I'm like, no, this vaccine was just launched, right? Nothing has been, it's not in Nigeria. But that means people are hungry for information and they are looking for where to get that information from. So what I would tell every young pharmacist here is equip yourself with the knowledge. Now, once you equip yourself with that knowledge, go out there and let the world know you know these things. We have people who are doing a lot on social media. I'm sure we know about the noisy pediatrician. We know about Aproco doctor, and then there's this other guy. And these are people who are using the knowledge they have to inform the public. So why is the pharmacist not doing something? I'm not sure if we have pharmacists doing that. Oh, we do. Oh, fantastic. Oh, fantastic. Right? So we need to do more of that, right? Carve a niche for yourself. Carve a niche for yourself and then go out there and let the world know that you know this thing. Thank you.
Beautiful, beautiful, beautiful. We do have a number of pharmacists who are utilizing social media for health promotion. I know we have Farm Radio, we have Health Talks with Lyo, and a number of other, we even have Savvy Pharmacists. Yes. So we have a number of pharmacists who are exploring and utilizing social media for health promotion. Thank you so much for that, ma'am. Temitope has a question for you.
All right, Famuzo, here's a question I've been dying to ask, and it's targeted right at you because you sit in the regulatory space. Not to go anyone's ox or anything, we know how regulatory affairs in Nigeria can be quite in the dinosaur age. And like you rightfully said, tech is moving at such a neck-breaking speed. So how do you keep up? Because we're charging all these young people to go out and do what you need to do, get the knowledge. But then you come out, you're equipped, and then you now meet the regulators who sit at the apex, and it's like they're slowing you down. So this question is two-pronged, actually. How can the pharmacist here mitigate that, or how can they maneuver that? And then how can we, that I don't know if Taiwo was talking about when she said she doesn't want to be regulated, because I'm very interested in the regulatory space. How can we now, do more for the people coming ahead? Because there's a lot to be done, and it's like the regulators are not keeping up. They're really not.
Thank you so much. There's really so much to be done. There's a huge gap. But you see, it has evolved. NAFDAC has evolved, I can tell you. NAFDAC has become more conscious that they have to meet up with the international way of doing things. There's no way they can sit, in there's no way a regulatory body right now can survive without meeting up to international standards. And they've been going through audits. With the new DG of NAFDAC, there's a lot of audits going on. WHO is auditing. They are putting in place a lot of quality management system. So it's not how it used to be. And the new DG is very, very interested in how do you put it?
we can, And sometimes they will say, I don't feel your problem is too much, Are you the only company? Nobody can push, and they say nobody is very troublemaker. The Farmer Association, they listen more to you. That's why we work more in regulatory affairs. We work more in the Farmer Association space. We have people in regulatory affairs, and they have a group in the Farmer Association, and they use that to solve their problems. And they write a paper, and they go and negotiate with the health authority. Hello. So one way to make things happen is to pull together. To pull together in the farmer space. That's why you have farmer associations. Farmer associations are mainly help. So farmer associations
to help the regulators to see us and to hear us. That's very important. And it doesn't just happen in Nigeria, it happens in international space. So one company alone can make an impact. I do believe in one person's voice. One person can spark it. Sanofi can spark it and say, I'm having this problem, and can go to the association and say, we need to take up this challenge with the health authority. By the time Sanofi comes to the health authority, she finds out that Novartis has that problem. Pfizer has that problem. GSK has that problem. They take it up. They write a paper. They invite the DG to a meeting, and she starts to listen. When they have the ear of the DG, then they have the ear of their organization. So it's not, all hope is not gone. Previously at NAFDAC, everything was done with paper. It wasn't just email, but now they have a platform, a registration platform. When you want to submit applications, you go online. We no longer submit applications as you used. I don't know when last you were at NAFDAC. Things have evolved, things are getting better. Regulations, previously, NAFDAC had no guidelines, no clear guidelines. No clear sample schedule. You just, every time you needed to call an officer, but things have changed. Their sample schedule is on their website. So as things evolve internationally, you find out that the country regulatory affairs, the country regulators, they also have to involve. So if you're interested in going to regulatory affairs, this is not the time to be discouraged. This is the time to get all the information you need to get and leap into the space, because things are really, really evolving, and it's going fast with the new normal. So this is some of the advantages that the new normal has brought. So what do you need? People, this question has come about the routine, What do you need if you want to go into the regulatory space? If I sit on a board and I want to interview you for a regulatory affairs role, I don't need your experience. I need to know your skills. I need to know what problems have you solved. So this is the trend now, and I'm going to give you a tip. Because many of us are looking at, going for interviews, wherever you want to go for interviews, and you're saying, okay, I don't have the experience. People are not recruiters, especially in multinationals. They're not looking for your experience. They're looking for what kind of analytical skills do you have? What kind of problem-solving skills do you have? Can you pay attention to detail? The previous challenges you've had, where you are, the community pharmacy you are working, were you able to solve it? I'm working with a very brilliant regulatory associate right now. And to recruit in regulatory is very difficult, because when you recruit in 2 years, the person wants to go into marketing. And I didn't want it. There are people that have stayed in regulatory and they're trending in regulatory. But I didn't want a situation where I will recruit somebody and she go into marketing. She goes into sales, So we're looking, and I really wanted someone that, could make an impact. The workload is huge. So we start listening to them. They came in, but this lady, she came online. She didn't come for a physical interview. Her colleague, the fellow applicants, they came for a physical interview. And we asked her some questions. It was very clear that she was a problem solver. And she was not just a problem solver, but she had a structured way of solving problems. When we interviewed that lady, I stood up. I said, this is the girl. Yes, she had worked with NAFDAC during her internship, but the other ones that had come in had also worked with NAFDAC. But it was very clear that this lady, she was solving problems, and she was thinking. She was a thinker. So I'm asking you, where you are right now, what kind of problems are you solving? I'm sorry I'm digressing, but it's very important for me, because I've been through a lot, and I think this is my opportunity to inspire somebody. what kind of problems are you solving? When I sit with you in an interview, how are you thinking? What have you done? You are in that community pharmacy. What kind of problem did you solve? What tool did you develop? When you saw that problem, what did you do about it? So this is what interviewers are looking for when they are interviewing you. Because I had to stand up. There was no way I could sit. I told them, this is the girl. This is the girl. No, I was so excited about it because it was very clear that there was no host bar about her. She was serving in the North. She was in every program in the North. And she was very analytical about what she was doing. So where are you in that space? Can an employee, and those love you, can an employee stand up and say, this is the person I'm looking for about you? Do you have staying power? He said that when he developed the apps the first time, nothing was working for him. But he had his why. What is your why? I'm so passionate because you have too much potential. And it's not a matter of competing with anybody because, potential does not compete. Potential dominates. Potential, I did not come and talk about regulatory affairs alone. Potential does not compete. Because you're cheating yourself. I told my children one day, I say, don't be the kind of person that you are looking at as your friend that got 80%. Because she got 80%, but you are capable of making 100%. But because you are looking at when I got 80%, you peg yourself at 80%. Don't do it yourself. You are cheating your potential. What is your potential? You need to dominate your space. And don't be lazy. There's too much laziness everywhere. There's too much social media. You shouldn't be on some platforms. Leave those platforms. We are waiting for you. My children are waiting for you. Nigeria is waiting for you. Africa is waiting for you. The world is waiting for you. Who told you it's only Nigeria? She's speaking from Ethiopia. She's speaking from Ethiopia. The GM of Sanofi, when she sits in a board, she's a woman. They refer to her. Folake Odediro is mentoring somebody in Egypt. The person came and submitted herself to Folake for mentorship. So don't think that I'm this little pharmacist from Nigeria. No. It's not only Nigeria that is waiting for you. The globe is waiting for you. And because of the kind of environment you are living in, you are able to stretch because you want something. Do not disappoint your potential.
Amazing, 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 amazing. Such a firebrand response. Thank you so much, Ma. Thank you so much, Ma. I would like Famarakinyo Adejare to respond to that question too, because he is in the space of tech, and we find many times that tech and regulations are usually at loggerheads. For example, as co-founder of MyMedicines.com, online pharmacy was seemingly a new thing at the time, and some pharmacists were reluctant to embrace it because of the fear of regulations. So as pharmacists begin to explore unconventional areas, particularly in the space of technology, we know what happened in the fintech industry, where the CBN and other financial stakeholders rose up against the young players in that field. So we would definitely have a similar occurrence in healthcare sooner or later. So how can young pharmacists, as they begin to explore unconventional areas, particularly in the tech space, how can we stay on the good side of the law?
So, ground rules. Innovation would always pave the way for regulation. Regulation will constantly play catch-up to disruption and innovation. You have to constantly have that at the back of your mind. So if you are waiting until the regulation allows you to do a certain thing, it's a chicken and egg situation, because you have to do it first before regulation then catches up to it, to then say that, okay, this is how we want to regulate this space. It has happened in literally every tech story you can think of so far. DeFi, logistics, whatever it is, even in healthcare. So at the time when we were trying to do e-commerce for healthcare, yes, there were apprehensions like that. Okay, how do you manage this online? But yeah, those are just, bottlenecks to figure out what the solution is for, right? So it's coming to a place of understanding that you can't wait for regulation. You need to disrupt first, and then regulation will always figure itself out. I'm not asking you to do anything illegal, right? Those are two very different things. But it's very, very important for you to understand that for whatever you're trying to do, unconventional, like you say it is, provided you are certain and then you have a clarity firstly on your why, and then you're actually meeting a need or solving a problem, I'll take focus on that and let regulation figure itself out. You would always find ways to manage those relationships and the expectations that then start to emerge based on whatever space you're playing in. So yes, innovate, let regulation catch up to you as you proceed.
Beautiful. Thank you. Thank you very much. Okay, as we begin to round off, I would like to encourage you all to pen your questions if you've got any. Since our theme is the new normal, emerging roles for young pharmacists, I think it's important to begin to point out the emerging areas in certain fields of practice. So we would like to hear from you. Given your experiences so far, what would you say are the emerging areas where youngsters need to begin to plug themselves? So I will start from Momi Olga.
All right. So I won't say there's one correct answer, but like we have all said here, it's in the problems, right? You want to look around you and say, what are the problems here? What are the problems in the health space? What are the problems in logistics? What are the problems in storage, right? These are areas where we can plug in. So I would not come and say, as a young pharmacist, you should look in this direction or look in that direction. What I would say is look around for the problems and start figuring out how to fix those problems. Because when you fix those problems, guess what? The world will look out for you. Thank you.
Amazing. Thank you very much. Famuzo?
I don't think I can say it better than she has said. It's very clear that that's the reason why she's succeeding. Look out for the problems. I keep saying it. That's what every employer of labor wants. If you want to get into paid employment, they are looking for problem solvers. And once you show them that you can solve problems, even if you don't have experience, they will take you on. So you're very right. Keep your eyes open. Look out for the problems. Get the knowledge that you need, and then take the risks that you have to take. Delayed gratification goes a long way. There's so many things you can do. Supply chain is there, regulatory affairs. Please don't be discouraged, because you are the ones that have the energy, basically. You're the one that have the energy to push those who are so used to the system. Because sometimes when you work in a system, you get so used to the system and you don't want to do any more. And you say, well, I've tried, and it didn't work. But everybody says it's impossible, till somebody does it. So if there's a place you have your eyes on, get in there, get all the information you have, spark that fire into the system. So that's the kind of energy you bring in. Thank you.
Thank you very much. Fam Ezine, if you can speak, we'd like to hear you. Fam Ezine. What would you say are the emerging areas?
Okay, so I'm going to say and for health. And Hello?
Okay, great.
You can hear me?
A bit better.
Okay, great. Okay. So what I'm just saying is I'm going to be a bit biased and say public health and not just supply chain, because when people hear public health, they just think of matters that is just supply chain. It's beyond that. You look at antimicrobial resistance, you look at things bomb vaccines. I mean, Ebola and COVID and the new malaria vaccine, these are areas that should tell us that there's more room we have to do infectious diseases, especially in the drug side of that. So these are all the opportunities for us to explore beyond the traditional pharmacy route. Not that the traditional pharmacy route is anything wrong with that. Like someone said, try to solve problems, and these are new problems, and with new problems comes new rules. So as you're solving these new problems, you're going to see new opportunities. And I really hope that people know that there is the African Medicine Agency that is coming very soon. And I think this is where I think a lot of pharmacists should be looking at getting employment in, because medicine is so I'm just going to say, try to solve problems, pick a public health and try to solve problems in public health. We're very few here. And that's
Thank you very much, Ma. Famurakio.
Yeah. So there's not much to be added to what you've said, really, beyond the fact that it's interesting when you start to apply yourself and how the skill sets you have, the knowledge base that you have, is applicable in fields both within your current practice and outside of it. I know pharmacists today who are doing things in insurance technology, who are doing things in transportation, who are doing things in decentralized finance, right? It's great. Figure out what works, figure out what the trends are within the industry. But more importantly, open yourself up to, learning more beyond just what your profession requires. I'm sure a number of us here have interest in other things. Learn a new language, both spoken and written, by the way, code. Learn about data science, learn about artificial intelligence, and learn about it not necessarily from a perspective of, I want to get a job. From a point of view of just amassing knowledge about what the new norm is, right? Because in the years to come, these are the things that would form the basis of everyday living. So it's important to be in the know of those things. And I guess one other thing I would also like to leave us with is embrace the uncertainty and the fact that you'll probably fail at some of these things. But yeah, the beautiful thing is the failure really just opens you up to more learnings. Because interestingly, we learn the most when we fail. So yeah, open yourself up more to that. Explore things outside of your comfort zone. Because yeah, like you mentioned at the beginning, the profession is both a blessing and a curse. Because it tends to create a comfort zone for you where, you believe you are in the know of it all. But it's so important that you're constantly exploring outside of that space. And you'll be surprised at the things you can apply yourself to, both within the practice and outside of it. But yeah, thank you.
Amazing. Thank you. Thank you very much. So at this time, we'd like to take questions, if we've got any. Do we have any questions in the audience? So we've got one. All right, so do we have questions in the audience? One, please come forward to ask your question. Okay, or if we could pass the mic to him, that would be good.
Good afternoon, everybody.
Good afternoon.
Yeah, I'm Dr. Chibo. I actually came around because, hello, everyone, please listen. It's just, I feel this is one of the opportunities. I feel I should say what has always been in my mind while I was there. I've always felt, right from beginning of my career, that pharmacy people, I feel, I'm going somewhere. Idea is I like what the panel, everybody's been saying, but I just feel everybody's just busy doing one thing or the other. You don't know how serious it is. See, I'm the country head of Mason Nigeria. I came here for a reason, because I'm working on a project for 2022, and it has to do with young pharmacists. So the truth is that from day one, every pharmacy person, you would expect that, okay, I used to feel I'm young, but these days, I think I'm no longer young like that again. So with the younger generation, we feel, we think later we are going to do better, but from my experience, it's as though everybody is doing the same thing. We don't understand the fact that this is 2022 already here, and as of today, there's no form of disruption in the pharma space in the last 30 years. Trust me, everybody is doing exactly the same thing. Every single person. The same model GSK is using is the same thing. Even both the big and small, almost the same space. And all of you, even the younger generation, everybody seems to be comfortable with it. People, see, last week I was in a meeting. This Dr. Adeshina, the African Development Bank guy, do you know what he said? In fact, he went into pharma. He said they have $2 billion that they want to invest in the pharma space in Nigeria. There is no capacity to accommodate that money. This was last week. I'm serious. And all of us, we are just doing, let's graduate and do something. Why I want to say this is that every single young pharmacist, whether you're a pharmacy student, you're working already, whatever you're doing, remember that the future, like she said, is depending on us. And we can no longer afford to disappoint the future. Everybody, right now, fintech that disrupting paystack people, so those paystack children, two of them, they got to, I've been in a meeting where two guys, these guys are 21, 22, they developed a solution about a job. I was there, they approved their $2 million. Funding is not loan. They give you to go and develop the project. I've never been in, I really want to meet this tech guy. I've never been in any space that is tech related that you see a pharmacist. No, I'm telling you now where it matters. I've seen. Wait, calm down. The idea is so that you get angry. It's fine. So far you do something about it. So all the time, any tech, okay, social media, the last social media week that was held offline, I saw solutions from every sector. There was no single solution from pharma. And I was there, I was feeling terrible. All of us it's like we don't like money. Because the non-pharma people are making billions from our sector, and we are just every time we come and go.
Thank you so much, Dr. Chike.
Thank you. I hope I was able to get you guys angry. That's the aim. God bless you.
Amen. Thank you. So have we got questions? Okay.
Okay. Can I read it? Let me bring.
Yes, you can read it.
Okay. All right. Can anything be done to make the internship selection processes at various regulatory bodies much more fair? I think the question is going to.
Okay.
Okay. So I believe that internship positions should serve as stepping stones for young pharmacists to venture into the regulatory space. That's the question.
I can't speak for the regulatory authorities. Really, I'm a regulatory professional, but I'm not practicing within regulatory authority space. I'm practicing in a company. So these are the opportunities that regulatory affairs professionals have. You can either practice in a regulatory authority, just like she's doing. CDC is kind of regulatory. WHO is regulatory. NAFDAC is regulatory, you know. So you have regulatory professionals in organizations, and what they do really is to interface, to be the face of the organization in front of the regulatory authority. But I can speak for what the organizations are doing. Within Sanofi, we just started our internship program. Please, can somebody clap for us? Yeah, so I can speak for what we are doing in Sanofi. I don't know if I met the young lady. She's one of the 3 interns we are working with in Sanofi. I don't know if she's still around. Okay, so she's gone. She's left. Okay, perfect. So there was an open application. The vacancies were thrown open. The pool of applications have come in, and they were interviewed by a board, by a panel. You know, there was no. Every selection was based on what you're able to do when you come in front of the panel. It was very exhaustive. There were presentations. Very brilliant presentations, and 3 of them were selected. You should be part of this Sanofi internship program. You should ask, I don't know, you can't, some of you can't anymore, but if you know somebody, they should aspire to it. And I hope it inspires other organizations, other pharma associations, organizations to do the same. So they're going to be rotating. They're going to be working in sales. They're going to be working in marketing. They're going to be working in medical. They're going to be working in regulatory affairs. They're going to be working everywhere within the organization. And we hope to be able to take them outside into manufacturing, to hospital, and to community pharmacy, so that they have a feel of what it is like, you know, to be a pharmacist in Nigeria. So that's actually a solution that Sanofi is providing for the internship space. So I hope it's something that other organizations can copy, you know, and do. So this will actually help to solve some of the problems, because you're right. The internship program should be like an opportunity for young pharmacists to see, you know, and choose from what they have, you know, what is open to them. And as they work within the organization, they can see other roles like supply chain. They see the possibility of public affairs. You know, there's so much you can do really within them as a pharmacist. Thank you. I hope I've been able to answer your question.
All right, do we still how many more questions do we have?
2 more.
2, okay. Please, let's run through quickly so we can be done.
All right. Good afternoon, everybody.
Good afternoon.
My name is Pharmacist Ejidike Vitalis, and I want to really appreciate the discussion so far. Our panelists actually did a very good job, and I believe they've ignited so much fire in us now. But the question is, what happens after now? Most of us might go home and then we'll just engage again in whatever we're doing. Can we reach out to you, our tech guy? Can we reach out to you for mentorship? Can we reach out to any of you? Like, is there any way we can follow up after now so that we keep this fire burning? Because we need to really make a change. And that's exactly what we need to do. And we need to start now. Thank you.
Thank you.
I benefited from mentorship too. I have a lot of mentors. And yes, so I think from the little knowledge I have, I'm always willing to share. The best platform to reach out to me, and maybe everyone here will be on LinkedIn, right? So just reach out to us, and obviously, I'm always willing to share what I have.
I would encourage, you know, is you have a very vibrant ESCO. What I can encourage is, why don't you put in place a mentorship program and then invite mentors? You know, there are many people that are willing. I'm sure he's willing. She's already said she's willing. You know, and people are really busy. People are for you to set up this kind of program. It shows that you are able to do something. Do a mentorship program, and then go and look for people that they are available to be mentors, just like you'll be able to look for this panel. And then, if you are interested in them, throw it open to your members and say, if you are interested in mentorship in this area, and this area, we can fix you up with a mentor. So that would really be a very structured way of mentoring, and that would be a way in which you don't have to know everybody. to be able to be mentored by somebody. But I must warn you, mentorship relationships are very serious. Mentors are very busy people. So before you enter a mentoring relationship, you should know exactly what you want. And you should be able to work with your mentor. Yeah, so that you don't get dumped. So it's very, very important. So I think it's something you can take. And if you need some help, there are some organizations that have some structured mentoring program. You can come, Sanofi. We have some structured mentoring program. I'm sure we can help you. Yeah.
Okay, great. So, firstly, you've touched on everything. Yeah, definitely reach out. But it helps to also have an idea of what it is you want to, explore. Because, whoever it is that's going to mentor you would not do that work for you. And if you are on the lookout with the expectation that they are going to tell you exactly what to do, then I would say that's not the right way to start. So definitely pick out an interest area. It doesn't have to be what you're going to... It doesn't have to be something you'll be doing in the next 10 years, 50 years. No. It just has to be something you have an interest in right now, right? Then approach the person. In fact, that would also help you in figuring out who best to approach. Because it makes no sense if you're approaching someone to mentor you on something they don't have any interest in. So definitely have an idea of what you want to explore. Approach whoever it is, and then hopefully it goes well from there. And then I get a sense that what you also mentioned, say structured mentorship program, is probably also in the works as well. So that would be great.
So we have one more question.
No, one after this.
Thank you so much for this amazing session. I hope to meet you later to ask you, but I think this could help for other people that couldn't ask this question. The question about regulation and the startup systems. When Famora started, he said some ground rules, and I hit the drum roll. I was expecting to hear some ground rules, and he started telling us about how disruption should come first, which is amazing. But please, could you actually give us some ground rules so that we don't go and mess up stuff you actually learned when you did yours and tried that you'd like to share with us so that we don't also...
Okay, so I'm glad that I mentioned that, provided it's nothing illegal, right? It's tricky because if there is no innovation, what's regulation regulating, right? You can't regulate what does not exist. That's why I said regulation catches up to, innovation. Now, that's not to say there are no ground rules to guide whatever it is you're trying to create. Case in point for when we were building what we built. Everyone knows that to dispense a prescription medication, you have to receive a prescription in return for that, right? Now, that was a major concern for the regulators at the time. It then took us going back to figure out how to, implement those systems that you cannot bypass in whatever it is you want to create. So when I say ground rules, that's what I mean. Understand the things that are there that you cannot change, but do not deter yourself from them innovating on things that there are no regulations around already. So I'm hoping I've shed more light on that for you. Is that helpful? All right.
Thank you.
The last.
You have a question again. I thought that was the last one. Casey. Okay, please, this is the last question. We're out of time.
Good afternoon, everyone. I'm Pharmacist Samuel Jiabulu. From this discussion, I think all we have been talking so far has been like the existing rules within the pharmacy profession, like community, med-rep, and regulatory supply chain. And I think for emerging rules in pharmacy space, most of it is be tech-enabled. That is just the way I feel. And I think tech is the new future. You mentioned earlier about social media. That's a tech-enabled space. But so far, I've not heard anything about telepharmacy. Because I know that another emerging space that is tech-enabled for pharmacists as graduates. So I don't know if there can be any implication regarding telepharmacy and the roles that are probably associated with telepharmacy.
All right, thanks, Samuel. Great point. So I'm hoping that this is a conversation that continues to happen, and the relevance of this is so that more and more people can start to talk about it. Now, you've mentioned telepharmacy, you've mentioned telemedicines. Really, the skill sets to flourish in that line, you have it already, right? So I guess it's more of a place of you exploring that path more, beyond just the conventional, or I want to set up a retail pharmacy store that has to be at a physical location. There are platforms now that you can leverage in such a way that, and I'm glad that there are now talks around satellite pharmacies, where you can then start to explore delivering the skill sets that you have to people that need it virtually, through telepharmacy, like you said. But yeah, it also takes being deliberate about that. Those are my 2 cents on that. I don't know if anyone else wants to talk about it.
Remember what we said about looking at the problems around. And telepharmacy is obviously one solution to the problems around. And so that's why I say you need to look around what's happening. I beg to differ from the doctor who said there hasn't been any disruption in the pharma space. How many of us know about Pillbox? So Pillbox is the Amazon solution to chronic meds. And so people who are on chronic meds have their drugs delivered to them at home. And this is a solution that has been brought about by a company that's not necessarily in the pharma space. And how did they get to that solution? They saw a problem somewhere. And so that's my response to you, Samuel. What is that problem you're seeing? Is it the problem of we're having a lot of outflow of pharmacists outside Nigeria? So is there a solution to that? We're not saying they should stay in Nigeria, but are we also going to say Nigerians are not going to benefit from pharmacists? So do you have a solution for that? So my response would be, look around you. What are those issues? Because trust me, there are many issues. If you come into the community pharmacy space, there are many issues. If you go into the hospital space, if you go into the regulatory space, there are a lot of issues. But how well are you engaging with players in that industry to know what the issues are and prefer solutions? So there's no one answer. We can't tell you telepharmacy is the way forward, or telemedicine, or this, right? You should actually give us the solution. Yeah, man.
Thank you.
All right. Sorry?
All right.
Okay, all right.
I think that's it. So that was the very last question. I want to thank you very much for your attention throughout the span of this duration. Thank you. A very big thank you to our panelists. You have shared so much insights. I'm sure a lot of us have quite a bit of nuggets to take home. So once again, from my colleague and I, Tari, do you want to say bye?
All right, thank you. Thank you so much, Fam Morakinyo. Thank you, Fam Uzo. And thank you, Fam Omomi. It has been a pleasure discussing with you. And thank you very much, everyone, as well.
And if you don't say hello, I will say.
Okay, there is a request for pictures with the panelists. Fam Morakinyo, Fam Uzo, Fam Omomi. Would you be kind enough to come up stage for a quick picture? Fam Temitope and Fam Ezine in diaspora. So it would be great to take a picture with you. So the moderators will take a picture with the panelists, and we'll have the chairperson's already nodding his head. Okay, downstairs. Okay, downstage. Okay, we'd also like to invite the national chairman of PSN-YPG to join us in the picture. And of course, the week planning committee chair, Fam Bukunola, you can join us as well. Is she around?
Looking at you 4 times in a row, I had to let you know. So I came to say hello. And if you
us, seeing the line of conversations we've had so far, and then also the solution Mega Medex is bringing and what Mega Medex is about altogether. So let's dive right in. Okay. Now, Andy Grove, who happens to be a tech guru, once mentioned that not all problems have a technological answer, but when they do, that is the more lasting solution. And if we were paying attention to the panel, we heard about disrupting, innovation, creating solutions. Now, that's what technology has so far been able to do, from the time of using just pure herbal mixtures to having capsules, having extended release tablets. We can say that technology has helped in bringing solutions. Now, how have pharmacists so far adopted to tech? You know, I was here and I listened to what Dr. Ugbo said, I guess, and he said he had not seen PharmaSpace. But so far, we see that people use the technology system to buy food, Jumia food, Konga. Even, I'm sure this week alone, a lot of us here have had a Zoom meeting. I had one yesterday, even while in transit. So I would say from our curve here, it's seen clearly that about 34% of pharmacists in Nigeria are gradually adopting technology. They are within where we want to be at the early majority, although eventually with time we have others come on board. Now, a simple question. How did we all register for this program? Was there like a book where please write your name? Well, I did mine online. So it's really clear that technology is the main game. So why Mega Medex? Why Mega Medex? Having seen the trend of events with pharmacists and technology, it became quite clear. You know, but one thing that Famora Kenyo said, and not even all the panelists said, they said, identify the problem and then find a solution to it. So Mega Healthcare It's a solution to the redundancies that we have seen in the supply chain, in the pharma distribution space. We are a business-to-business healthcare platform. What I mean by this is we don't deal with end consumers. We don't do customer. We do strictly business-to-business, an online distribution platform whereby we ensure that drugs are supplied, the wholesome distribution of drugs from manufacturers directly to community pharmacies where the consumer needs it. Now, everything about logistics, everything about safety, everything about wholesomeness of your drug, that's the solution we are providing. Once you get a drug from Mega Healthcare, you can sleep because you are very sure of the efficacy that you are getting. Now, that's the twist to it. With the use of technology, we've made it easy. You don't need a biro, paper, OS list, write, long. No. It's all at the tip of your finger. I would explain as we go on. Also, we have now a question a friend of mine asked me today was, what opportunity is Megamedex giving young pharmacists? Because a number of us here have done locum. I did locum myself for a couple of years, and they're like, I want to start, I need funding. Well, surprisingly, we do have funding. Not surprisingly, but we're here to create solutions. With SunTrust Bank and Megamedex, we have funding for pharmacists that want to stock up for as up to 2.5 million, 10 million. You get funding to stock up your pharmacies. And then that's just one of the many, many solutions that we have provided. Now, why the Megamedex platform? As you can see from my slide, I believe you can see, there has been an increase in the curve of how many pharmacies have used the Megamedex platform. Currently, we have above 1,000 visits in a month to the platform. And then it is quite clear that pharmacies are gradually taking up the idea of technology. So we can't erase the fact that it might look slow, but it is definitely happening. It is definitely happening. Then, why Megamedex platform? How to use the Megamedex web app? Now, it's quite easy, very simple. In 5 simple steps, your browser, you check it. When I go out to talk to my table, I'm not hiding anything. When you ask me for product and price, I say, go to your phone. You will see everything there. It's not hard. So with prices, you see your prices, you select what you want to buy, and then everything, logistics, delivery, leave it to us. We make your work easy. That's how we make your work easy. And then, what are pharmacies actually saying? It looks too good to be true. Well, let's see what people are saying. We have testimonials from people. We have from Abiono. It's interact. Oh, before I go there, has anybody here used the Megamedex platform? Oh, yes, thank you. Thank you so much, Fam Oye. That's from Savant's Pharmacy, and it's real. It's very real. It's interactive. It's easy to use. You don't need an IT person. This is literally someone's comment about the platform. And then the reason why is once you buy online, you get your order saved automatically. So the next time you are buying, it's there. You just need to tweak the figures. Okay, I want 10 of the quarter. I don't want 5 this time around. And then easy, like procurement on the go. So easy. So now, guess what? We don't stop there. That's what we talk about, innovation, going further, taking challenges. This is not where it ends. We are introducing today the app, the Megamedex app, a mobile app. So it's our baby, and then we are proud and privileged to introduce it to the Young Pharmacists group. It's a privilege. We understand the importance of young pharmacists and the role they play in innovation and taking challenges. With the Megamedex app, you get notifications directly. You carry your Megamedex everywhere, and you increase the speed of ordering. I'm going to relate 2 stories currently. We had a conversation with one of the owners of a pharmacy, Mount Horeb, and then she was like, "Oh, I want to be able to monitor what we are buying, even though I'm not in the store. And with the Megamedex app, I can do it. I can see what we are buying on the go." And then I had friend of mine that also said, "Oh, the app was easy. It's in less than 30 minutes I was done, and that's the end. I'm at peace." So finally, you can search for the Megamedex app either you can check for products, either via categories or via suppliers. You get to see the product, you get to choose what you want to buy, and then you get it delivered to you swiftly. In summary, I would just like to say this. From our discussion here, I have seen how that innovation, critical thinking, finding solution is the main, similarly, like she said, data is the new oil. I would say that the people that provide the solutions, kind of people that provide the solutions is the new oil. Because when you have someone that is problem solving, that is analytical, you can place that person in any sphere and then they'll get things going for you. So I would say that with the adoption of technology, we have seen the importance of technology in the pharma distribution space, and then pharmacists are gradually adopting, and there is definitely no hindrance, nothing stopping us as pharmacists from pushing forward, like Dr. Ugbo said, in technology. So therefore, with this, I would like to say for everyone here that is an Android user, to please, why are you so excited, Casey? To please get your phone and download the Mega Medex app. Now, with all I have said, I would like to get our commitment. Do we think that this app is worth it? Do you think it's easy? Do you think I don't have to write lists, then snap it, then send WhatsApp before somebody will tell me this was available? I can see it right there on my phone, and I don't have to be in the pharmacy to do that. So based on everything I have said, do we think the app is worth downloading? Oh, really? Beautiful. So then, based on that, let's do this. For Android users, please get your phone out. Go to megamedex.com. Click on download app. For Android users, for iOS users like myself, watch out, it's coming soon. And then in the spirit of celebration and celebrating the future, we have shopping vouchers for the first 3 that are able to successfully order. So we have a portal open. Every process there is seamless. Successfully order for a product on the app today. And then the winners will be announced at the end of this meeting. I would like to get your feedback. Our table is at the back. You meet myself or any of my team members there. Thank you very much for listening. It's been a pleasure.
Thank you, Angela. Can we please give her a round of applause again? Thank you for your patience and thank you for that presentation. So I think I'll be one of the recipients of that shopping voucher. That's the power of the microphone. My Ogasa. All right, so quickly, we're going to be having New Heights come up for their presentation. But I'm going to call an MTN recharge card right away. So MTN, please. Okay, and we would love that we please try to maintain decorum and listen. Because I will not make this place rowdy. Our people online are all shouting joyfully and, kudos to this program. They're all enjoying it. So, thank you those following us online. We're also enjoying it here. Myself, I'm enjoying it because I just got a shopping voucher from Mega Medis. Thank you, Angela. So, MTN users, 4613. As New Height come over, 4613 3621 9488 1955 0 Who's the winner? Do we have a winner? Do we have a winner? There's no winner. Maybe somebody online has won this one. So let me keep this one. All right. One and then New Heights, please. If the slide comes up on the start up. Okay, Global.com, Glow Mobile, 43988. That's Glow users. 29794 66138. Glow users. So who is our winner? Any winner in the house? So New Heights.
Say you know me again. The kind pain when I feel that day, me I never feel talking again. I'm okay, no go do like this, so I know your friend don't like my beat, but you for don't say this kind thing, baby. Just let me know if you know what I do again. I know go disturb you, I know go scratch you. Just let me know if you know what I do again. I know go disturb you, I know go scratch you, but don't call me back.
Good afternoon, everybody, and my distinguished pharmacists. Standing on existing protocol, my name is Joy Idebanaria, representing New Heights Pharmaceuticals. Please, I will actually need your full attention. I have freebies here for you, for those that can actually answer the questions at the end of the presentation. So these are the NHP pharma portfolio. We have the dispersible, NHP dispersible, suspension. We have the PCM suppository. We have the vitamin C 1,000 milligram, vitamin D 10,000 IU, and vitamin D 50,000 IU. But first of all, we're talking about the vitamin D, its importance to the body before I go straight to the products. So vitamin D, what is vitamin D? Vitamin D is actually a fat-soluble vitamin. It's produced when our body is exposed to sunlight. But the vitamin D produced when our body is exposed to sunlight, it's in the inactive form. There's a conversion that actually takes place in the liver that converts it from the inactive form to the active form, which is the 1,25-dehydroxy vitamin D3. That's cholecalciferol, that is therapeutically needed in the body. There are few sources of vitamin D3, like the milk, but for those milk that are fortified. But the ready source of vitamin D is natural sun and the supplements. So that's the reason why I'm going to link it down to my product, because you need the supplement. The conversion is this, but I won't go straight to that because of time. Then is vitamin D3 deficiency possible? Many of us believe we have abundance of sunlight in Nigeria, and we are living in the tropics. So the question is, can I be deficient? Can I be insufficient? Yes, of course. There are so many factors to that. So what do I define as vitamin D deficiency? It's a serum level that is less than 20 nanogram per ml. So when I take a blood sample and I check and I have anything less than 20 nanogram per ml, it means I am deficient of vitamin D. So there are two key words here. Vitamin D deficiency is a global health issue. About 1 billion are deficient and 50% are insufficient. So mark those two words I mentioned. One is insufficiency and the other one is deficiency. How do I know if I'm deficient or insufficient? So the prevalence of vitamin D deficiency is more in the elderly. You know, like our elderly patients, our mommies and daddies, they usually don't go out because of their age. Maybe only on Sunday, mama wants to go to church, and that's the only day she goes out. So she does not expose herself to sunlight. And I mentioned initially that vitamin D, there's a conversion in the liver. So for mama whose organs are already failing, the kidney is already reducing its function because of age, and the liver, how will this conversion take place? And some of them are already having complications with their liver and kidney. It means that no matter the exposure she has under the sunlight, there might be little or nothing converted because of the organs that are already failing. So our elderly patients need vitamin D supplement, which is already in the active form. Then also nursing residents, like I mentioned initially, that when people stay more in the house, they stay indoor, they are not exposed to vitamin D in the sun. So for nursing home residents, people who have been bedridden for 3 months, 6 months, 1 year, the only source of vitamin D is the supplement. Then we also have the obese patient. Vitamin D is a fat-soluble vitamin. So the obese patient needs to take higher dosage of vitamin D because when it's taken into the body, it binds to the adipose cells and little or nothing is released into systemic circulation. Then the melanin on our skin does not allow for proper absorption of vitamin D, the blood pigmentation. So people of lighter complexion have more access to vitamin D than the dark people. Then a research was carried out in Kano to attest to the fact that yes, even in Nigeria, we have deficiency and insufficiency. It was carried out from this cattle rearers, the nomads, that move from one town to another. They actually stay a lot of time in the sunlight, but because of the clothes we wear, they cover up their whole body, they wear hijab and everything for the female. So sunshade, our caps we wear under the sun, also prevent proper absorption of vitamin D into the body. Then how do I know I have vitamin D deficiency? So right now, COVID, initially when COVID was on the increase, vitamin D was very, very much on our shelf and it was selling very well. But right now, COVID is no longer there. So our vitamin D is still lying there. The ones we bought in December, some of us have not sold it. 2 of us. Many of the pharmacists are complaining that, oh, vitamin C sales has dropped. What can we do? Who are the people we need to recommend this to? 1, asthmatic patients. They need vitamin D. Vitamin D has an anti-inflammatory effect to the respiratory tract. So if you get people who have asthma that are always coming down with relapses even after nebulizing or using inhalers, introduce vitamin D into their system. It will boost their immune system. Right now, when I have catarrh, I don't take antihistamine. I take vitamin D and I'm fine with it. So if you have patients, that's the reason why it was related to COVID, because of the anti-inflammatory effect it has. Then you have patients who have arthritis. Arthritis is also an inflammation. So when you introduce vitamin D into their system, it boosts their immune system, coupled with the medications they are taking. It's just like an adjunct to them, and you see their health improving. Then also back and low back pain. You have patients who have been coming regularly to the pharmacy, complaining of severe back pain, muscle pain, and they've been taking analgesic and pain relief until date, there's no relief. They should go and check for vitamin D level in their blood. Many of them are deficient. The story I'm going to tell you is a life story. It's not because of my presentation. We have someone very close to us in our company. She suffered from backbone pain for more than 3 years. She, at the time, they got tired of visiting Nigerian hospitals. They flew her outside the country. When she got to Dubai, the doctor checked and there was nothing. So the doctor said, okay, madam, have you checked the vitamin D level? She said, we don't know about it because then COVID has not come. We didn't know about vitamin D. When she checked, she was deficient. And a single dosage of vitamin D was what got her back on her feet. She was already bending. So many of her patients are suffering ignorantly without knowing that they have deficiency of vitamin D. So when you introduce this to those who have been complaining about back pain, muscle pain, you will see an improvement. Then also for patients who are actually addicted to sedative, that cannot sleep without sedative, introduce vitamin D to them. The vitamin D actually helps to balance up sleeping pattern. It helps to regulate the dopamine. You know, dopamine is the neurotransmitter that helps to regulate sleep. So when they take in vitamin D, it regulates the dopamine and they sleep well. I have 3 persons who I introduced vitamin D to. And right now they sleep very well. One of them, when she wakes up 12 midnight to use herself, that is the end of the sleep. But when vitamin D was introduced to her system, right now she sleeps at any time she wants to sleep. I wake up comfortably 5, 6 a.m. Before 12 a.m., whatever happens at the middle of the night, she will tell you the story. So it helps for those who are having sleeping imbalance. Introduce vitamin D to them also. Then for those that have depression, like I said initially, dopamine also regulates mood and motivation. For those who are having low, they are withdrawn for others, depressed patients, when vitamin D is introduced to their system, there is an improvement because it helps to regulate dopamine, which helps in the mood regulation also. Then for those that are having alopecia, it strengthens the hair follicles. Then it also helps to make the body more sensitive to insulin for those suffering from type 2 diabetics. When you introduce vitamin D to them, it actually helps to regulate insulin pattern in the system. Then for those who have bone loss, like we mentioned, our elderly patient, because their bone minerals are already going down, when you introduce vitamin D3 to their system, it helps in the reabsorption of calcium and strengthens their bone. So when Mama was 2 years, 3 years, 10 years, she felt that nothing happens to her bone. There was no fracture. But right now, 70-year-old mother falls down. She has what? Fracture. What happened? The bone minerals are already reducing. The bone densities are reducing. But when you introduce vitamin D to them, it helps in the reabsorption of calcium, and they are actually fine with it. And many of our ladies use vitamin D today because it helps to reduce acne. It has effect on the sebaceous gland. Yes, it has effect on the sebaceous gland. So what it actually does is that it regulates the sebum, the oil. When there is deficiency of vitamin D, there is what we call dermalipogenesis. But when the vitamin D increases in the body, it regulates it. So the oil that is being produced will be regulated. So it reduces acne also. Then, New Heights Pharmaceutical actually have 2 ranges of vitamin D3. We have the 10,000 IU. We also have the 50,000 IU. So I know the question many of you might be asking your mind, why this high strength? Good. The Endocrine Society guideline recommend that up to 10,000 IU taken daily is safe. It's not toxic. 10,000 IU daily is safe. Although our 10,000 IU is taken once in a week, and 50,000 IU is taken once in 2 weeks. So it means you just need 2 tablets in a month. So the issue of, I miss my dose for those who are actually taking other routine medication is not there. Just once in 2 weeks, 2 tablets in a month. So it actually helps to improve compliance for those that have so many ranges of medication they are taking. And it's marketed by New Height. We are actually sure of it because we know New Height delivers premium products and we don't sell fake products. Many of you know us for that. And also it's manufactured in the UK. It's a foreign product. So let me go straight to the vitamin C. And I know this will interest you because there's a promo on this already. The good thing about vitamin C produced by New Height is that, one, it is time release. Majority of the vitamin C stays in the body for just 6 hours because it's water soluble. When you urinate, you pass it out. But as it's timed release, it stays up to 12 hours in the body. So because the ascorbic acid is released little by little, it is safe for ulcer patients and also diabetic patients for their wound healing, for diabetics. So because the ascorbic acid is not released once compared to the effervescent vitamin C. And also the citrus biflavonoid is 100 milligrams compared to other brands. And it comes in 2 sachets. So if a patient comes into your pharmacy and asks for NHP vitamin C, good. Maybe the price is something he or she cannot afford immediately. Because it comes in 2 sachets, you can sell out 1 sachet and the person will come back again to buy the other sachet. So it makes it faster to move from your shop. So the promo we are actually having right now for vitamin C is that for the community space, we know that majority of you are our influencers. Even if you tell madam, buy NHP vitamin C, if you tell her, madam, it will not sell, she will not buy from us. It's the truth. You are the influencers in the pharmacy space. So we are actually coming up with this promo for you that sell 50 packs of NHP vitamin C, 1,000 milligrams, and get 5,000 naira. The money goes to you, not to the pharmacy, not to the MD of the pharmacy. So there is multiple entry. So if you're able to sell up to 100 in a month, you get 10,000 naira. We are giving the money to you. We are not giving it in form of product. It's cash. It's a cash price to you. Then also that goes to vitamin D3 also. If you're able to sell 50 packs in a month, you also get 5,000 naira. If you're able to sell 100 in a month, you get 10,000 naira. Then let me go straight to the ibuprofen dispersible. Ibuprofen dispersible, that's this product here with me. One good thing about it is that it's the first ibuprofen in dispersible form in Nigeria. It's the first of its kind in Nigeria. So it has a very high onset of action because of its bioavailability. So when we talk about bioavailability, we talk about the absorption rate of a medication. And in the order of bioavailability, we have the solution, we have suspension capsule, and we also have the tablet. So this is dissolved into water and taken in. So when it dissolves, the active ingredient dissolves immediately. So when you take it, you get the effect immediately. The effect is exactly immediate. It does not need to be metabolized in the liver for the active ingredients to be released. It has very fast onset of action. Then it has a duration of 8 hours. It has a very pleasant taste. It has orange taste. So that's the reason why majority of the dental clinics are buying this from us. So it's just like I'm taking juice and I'm getting relief of my pain. That is one of the dental clinics. That is the testimony he gave to us. That the reason why he's selling it in his space is because of the taste, and it actually has good effect. Then it's safe for children. Then we have the NHP suspension, which is also for our children. It has good taste. It also relieves pain in 5 minutes. And it's administered by weight, not by age, because some children weigh higher than their age, some weigh lower than their age. So the administration is by weight and not by age. So before I round up, I would want to ask a question. Whoever is able to answer the question will get a gift from me. So from my slides, if you actually went through it when I was speaking, you will see some of the things I spoke about. So I mentioned it should be taken by children from what age? It's on my slide. From what age? From what age? The dispersible.
The ibuprofen dispersible.
Ibuprofen dispersible. For what age?
For what age for children? According to her slide.
According to my slide.
Yes, yes, sir. No, there's a hand first. Yes, sir. 3 months.
No, dispersible, not suspension.
Okay, there's a lady that raised her hand up here. Okay, you wanted to answer. Okay, maybe the same.
Nobody.
Too. Okay, one more person.
4 years.
You said?
4 years.
4 years? No. Anybody? I will take my gift back.
Okay, there's somebody.
2 years.
2 years.
No.
Okay.
Please, someone should try. I think I'm hearing something very close.
Somebody is saying something here.
Please give.
7.
7 years.
I actually heard the 7 first from here. From here first. Who is the person that said 7 years? Please come for your gifts. This is sold for 2,000 naira. This is 2,000 naira for 20 tablets. So 200 milligram goes to 7 years, and for adults, an adult takes 400 milligrams. So an adult will take 400 milligrams, which is 2 tablets to dissolve in water. A child of 7 years will take 1 tablet to dissolve in water, and it has onset of action of 5 minutes. I mean 5 minutes. Try it out, and you have a good testimony about it. So thank you for listening.
Thank you so much, New Heights. Can we appreciate her? Thank you so much. So that one is for the child of 7 years. So
please, before I go, if you know you want to go in for this challenge, vitamin C challenge and vitamin D, please, my colleagues are around with their papers. Just indicate the interest. We'll supply your pharmacy the product, and then you keep running with the sales. Thank you.
You're welcome.
Thank you very much, New Heights. Okay, right about now, we're going to be having the keynote citation to be taken by Pharmacist Temitope Ben Adekbe. A round of applause for her as she makes her way up to the stage.
Our keynote address speaker today. Before Pamplemi will start, I want to say something about it before it comes up. I happened to be at Oluyole 2019, and I was still in pants then. So I needed somebody to talk to about what I'm going to do in pharmacy. And I met somebody, and she said, meet Famshino. And I was like, I was thinking he's one big guy that you meet him, you have to dobale and all. But I just met somebody cool, just hi, how are you? And Do you know the advice he gave me that year has kept me running? So let's hear a citation, man.
Adeshina Okwanubi, trainer, consultant, and business coach. Adeshina Okwanubi is the lead consultant of Pharma Alliance, Africa's first retail pharmacy business support network, a group that comprises over 100 retail pharmacy stores with a combined annual turnover of over 7 billion naira. He's a graduate of the Faculty of Pharmacy, University of Lagos, with about 20 years post-qualification experience, spanning consulting, sales, marketing, customer relations with some of the world's leading pharmaceutical companies. He rose through the ranks to become the customer relations manager of Pfizer Specialties Limited, with responsibilities for Nigeria, Ghana, and the entire East African region. He voluntarily retired in 2013 to set up his own consulting firm. Adeshina is a thoroughbred business development coach, and he's the convener of Nigeria's premier retail pharmacy business summit, tagged The Panel. He's a recipient of the prestigious Pfizer Global Innovation Award, which was presented in New York in 2011. Apart from Pharma Alliance and The Panel, he has pioneered a number of technology-driven initiatives in the Nigerian pharma industry, and these include RX Evolution, the pioneer online job placement portal in the pharmacy industry, Pharmacademy, a pharma industry-focused learning platform, PSN-MCPD, an online platform for administering the continuing education program of the PCN, and Pharmacy Map, the most comprehensive geospatial map of the pharmacies in Nigeria. In January 2021, his organization launched Pharma Gateway, a payments gateway for collection of pharmacy dues across all the technical and interest groups of the Pharmaceutical Society of Nigeria. He's a high-energy enthusiast and passionate speaker, and his message is anchored on vision, integrity, and passion. Please join me as I welcome, please, a round, like a standing ovation, please, because after listening through all these qualities, we need to give a standing ovation for pharmacy.
Thank you, please. Don't mind her, just sit down, sit down, sit down. Good afternoon, everyone. Good afternoon, everyone. Don't worry, those of you in the WOW booth, just be listening. What you're doing is also important. All right. I thank you for the opportunity for bringing me, here to speak to you. My name, first of all, introduction. My name is Adeshina Okwanubi. Don't believe everything they told you. I'm just one of you, a YP. Am I correct? I'm YP, right? I don't understand. This, I'm OP. All right, okay, so I'll share with you my thoughts around the theme of today. And I'll appreciate it if it's going to be engaging back and forth speaking. And so I went to the University of Lagos. Anyone here? All right, good. I went to the University of Lagos. I left there about 2002. Okay. I'm just trying to be sure that we're all together. Okay, so after I finished in 2002, we had this, there was this gap we had before induction. So I spent that time with JK Pharmacy. After JK, I did my internship in Luth. After the 1 year in Luth, I was posted to Imo State. Anybody from Imo State here? Oh, good, yeah. Is anybody by mistake from Owerri West local government? All right, so I served in Owerri West local government, but when I was going to the east, because I was active in PANS, I was secretary of PANS, and I was involved in hustling. Is that a better mic? I was involved in hustling for PANS. I spoke to one of the companies that was supporting us, the Kakaki Chemists. And even though I didn't know where I was going, I said, let me take your products with me to the east to market. And he gave me the rights. And for the 1 year, while I was in my place of primary assignments, in the evening, I was hustling between Imo, Rivers, and Abia states, hustling. And I think I made some tidy cash there. After that, I came back to Lagos, got a job with Pfizer as a sales rep. I started from Ibadan. And after about 2 years plus, I was promoted to become the first medical education and customer relations manager for Pfizer with oversight about 8 countries. And while I was there, one of the things we came up with, I'm sharing the story so that you can know the journey so far and then probably find a place for yourself, in the journey. There was something we conceptualized. It's called the Customer Care Boot Camp. It was a training for counter assistants. And so after I did that for a number of years, by the time I had done about 8 years in Pfizer, I took an early retirement and I started my own organization, which is Shine Consulting. And with that organization, we started with counterattack, the same thing I was doing with the organization. So it's important what you do where you work. And I tell people, for your organization as if it belonged to you. Because the moment you mistake working for your company as working for someone else, you should change yourself. But when you work in a place and you know that you're working for yourself, just in contract with another organization, you get to put yourself into it. And that way, when I left the organization and I started my own training programs, it was easy for me to know what to do. And then after that, we gave birth to Farm Alliance and then a few other projects. So what are the other things I started after I left? I started the panel while I was in Pfizer. Because today the panel is 13 years old. But I left Pfizer 8 years ago. That means I had been doing the panel for 5 years before I left Pfizer. However, I was not doing it on Pfizer's time. I was doing it during my leave. And what does that mean? That means for those 5 years, I didn't have a life. After I worked, the 1 month I was supposed to go and rest, I used it to host the panel. And then after I left from panel 6, the conference ended because now I had time to focus on it. In the process, we started Farm Alliance. So immediately I left employment, the same year I started Farm Alliance. And what is Farm Alliance? Farm Alliance is just community pharmacy owners coming together to talk about business. And today we have about 200 stores, branches in the network. Not businesses, 200 branches in the network with a turnover of more than 10 billion naira in the businesses. How many of us know RX Evolution? Oh, good, yeah. So sometime down the line, I saw another need in the industry. When we were out, not today, there was no social media when we came out. So if you need a job, you go to, where's that your office again? Ogudu. PSN executive, now look at notice board. Now say, Alpha Pharmacists, you now write down the phone number, now go. And because those who wanted to give the jobs were offline, and then those who wanted the jobs were online, we became the bridge. And we started by posting on Facebook. After a while, when Facebook showed me 1 or 2 times, we migrated to a website and all that. And thanks to your vibrant national chairman, we have birthed another platform, which I'll be sharing with you very soon. And then down the line, another project came. How many of us know Moxie? Oh, good. Okay, how many of us sell Moxie? It's not just knowing, selling. Good. So how did Moxie come about? There was an issue in the system. NAFDAC was clamping down on retail pharmacies for selling Calpol, imported products. And there was an engagement session. And we asked ourselves, what exactly is the problem? Is it that Nigeria cannot produce a world standard product? And we went back, picked a few global brands, and said, what do they have that we don't have? And we reworked it, and we created those brands. That's why you see that ours is the only one that has a CRC card. Normally, when you buy your paracetamol, you use knife, Abi, to cut and, syringe those in. We said, what do the global brands have that we can do? And so that's what gave birth to Moxie. Why is Moxie? Some of you say, so this is the guy behind Moxie. I must have hammered. No, we have not yet hammered. We are still chiseling. The hammer is coming. But why is it expensive? The raw materials for Moxie are sourced from Europe. So they are premium raw materials. And so it's important because our promise is to give you what the world brands give you. And in the next few months, we plan to scale up into about 6 more SKUs, which we are sure you'll support us with. Then we have some publications in the market. I'll be fast. Then last year, when COVID hit, we had to hit back. Because COVID now made sure, we're into training, capacity building and all that. So the moment COVID came, that means there were no trainings. That means some people are going to go hungry. And I said, it won't be me. And so we launched the virtual platform for training in the industry. And we've been running trainings ever since. And then this year, we launched Pharma Gateway. How many of us pay dues? How many of us pay YPG dues? And how many of us use the Pharma Gateway platform? All right, good, some of us. And why did we do that? We found out that as a young lady pharmacist who is registering a premises, you will probably have to pay about 8 to 9 dues into 8 or 9 bank accounts. And the headache of that alone, we know the money is a headache. Let's make sure it's the only headache, not going from bank to bank or in and out of bank apps. And we created that platform where you just create your profile. You are told how much you need to pay, one payment, and everybody gets their money. And that's what Pharma Gateway has been doing. And we're glad that the feedback has been amazing. And then it's been said we have PSN digital solutions that we run. And then in between all the things I've mentioned, I call some businesses Sarewa business. They are not sustainable. It's just chop and go, You can't build a future on it. And so we've done a little bit of those in the past. Forget this suit. I've sold cows before. I know you are shocked. I didn't say that part of my life. If I told you, you would like me. So I've sold cows when I was a rep in Ibadan. I've sold cows. I've done indemnity insurance for ACP. We did that for a number of years. How many of us have been in pharmacies where there are some TV screens that have health education messages that we did that, and all that. So those are things we've done, and then you've seen our videos here and there. Coming soon, part of what we have in the offing, it's been said that there's a geospatial map we are building. What that means is that there's a map of all pharmacies in Nigeria, just like you have Google Maps, but this one is only pharmacies. And so we know where the pharmacies are and all that. We are driving that, and we are going to commercialize very soon. A number of us want to get overalls. When we're in school, we didn't mind, just go buy lab coats and all that. But the older you get and you want proper lab coats, those types you see in the magazines and all that, you can't find them. I've been pushing people for the past 6 years to produce that solution. Nobody has. So we have decided to go ahead and do it. So in the next few months, you'll be seeing a new online platform, smartcoats.com, that have trendy lab coats, name tags, everything you have to make you look the way you want to look in the pharmacy. And then what I said is coming. A collaborative effort between us and YPG is about to be birthed. And that is pharmajobs.ng. So we are gradually phasing out RX Evolution, and we are replacing it with PharmaJobs. And that platform is already, if you go online, it's there already. The jobs are there already. What are we doing? For the job owners, we are going to be offering free job postings up to the end of the year. But for you, the young pharmacist, once you sign up to this platform to get the job alerts, which will be a benefit, we'll be giving you weekly giveaways once we roll out data giveaways. You know the way we roll these things. And then one of the things YPG insisted on is that there are issues between employers and employees. And so there'll be on that website, you can lodge a complaint to say, and then it will be reviewed by the internal mechanisms of YPG against employers and all that. Not name calling, not call outs, but proper documented things. We also work with ACPN to make sure things work properly. And then, of course, there's a blog there, career tips and all those things. And what do you need to do? Just sign up today, and then you'll be glad you did. Pharmajobs.ng is the portal. And it's when you sign up that you get the giveaways. Anyway. Okay, I want to appreciate an organization before I launch into my presentation. How many of us know Pharmacy Plus? Okay, you know, okay, maybe you don't know Pharmacy. How many of us know Reload? More hands go up, good. Now, I want to appreciate Pharmacy Plus because if there's an organization, one, and if there's a CEO who loves young pharmacists like crazy, it is Pharmacy Plus. And the CEO of Pharmacists is in the room. Sir, I know you are hiding. Can you please stand up for recognition? It's at the back there. If you put with the mask on, you think it's a YP. You know? Why am I saying that? He's seated there. Why am I saying that? When Yimika ambushed me, okay, thank you. Okay, now he's standing up. Yeah, thank you, sir. When Yimika ambushed me for the YPG national program, he willingly, not only did he sponsor the Abuja program, he also sponsored a YPG delegation of about 20-something to the panel of this year. Apart from that, he sponsored the employer-employee session of that event. And that's just to show his commitment to the YPG. Now, for today's event, when Yimika handed me over to Bukola, he was the one I went back to. Even though it was very tight, he still supported the conference. And after he did what he was going to do, he said, you know what, you guys deserve some extras. And that's why you have the WOW booth behind there, also paid for by Pharmacy Plus. Let's appreciate Pharmacy Plus, please. That's a business deeply committed to young pharmacists. And I just want us to, in exchange, support the business of Pharmacy Plus. Those are their brands there, Alphabetic, Reload. How many of us know White House apple cider vinegar? You may not know, that's also from Pharmacy Plus. Menorites is a product that's being pushed aggressively now for menopause in women. You want to drive that. And then in the foods area, Oatsville, those canisters of oats is also from Pharmacy Plus. Now let's get into the meat of the matter. I was going to ask this, but the time is fast spent. I will just give you what I brought for you, because I was going to ask, what do you want to hear? Because it's possible that I prepare something that doesn't make sense to you. But you have to manage it like that, because the time is fast spent. And the question I'm asking is this. Are we graduating pharmacists for the past, the present, or the future? What training did you get in pharmacy school? Did it give you the requisite experience to navigate the times you are in? And there's something I always like to tell young pharmacists. I've been at this talks thing for a while. After your B Farm and Farm D, sometimes you want to ask yourself, are there really opportunities out there? I was discussing with the CEO of Pharmacy Plus before I came up. The number of pharmacy schools are increasing every day. Now that's good for the industry, because that means supply is increasing. But no matter how many we produce, there's something I'm very sure of. As a pharmacist, you will always get a job. You will always get a job. The only problem you will have is the problem of choice. I don't want to rep. Nah. I want to, production. You do production small. I want to go and do community. I'm sure you know, if you have siblings, they don't have it so nice. I'm sure you know. Now, interestingly, you guys even now have a minimum wage kind of thing that your siblings cannot even attempt. They say, she used to go, let's even see work. Yes, how much? 120, no. 150, it's turning 200. Yeah, now you're talking. It's okay. So, you need to understand the space you are working in. And because we do RX Evolution, we do a lot with jobs. And so there's this story of this 24-year-old young pharmacist that went to a multinational. And he had actually done well. And they asked him, so how much would you like to earn? The guy said, sir, fresh from NYSU, 300,000 naira, sir. Is that all? The guy said, well, in retail, multinational. An official car, yeah, we'll give you that. With a driver, of course, we'll give you a driver. Accommodation allowance outside the 300, then vacation. They said, well, actually, that's in the package. We are also going to give you education for your 4 children up to university level. The guy said, wow. And then also, for your wife, we'll be giving free delivery anywhere in the country. The guy started to say, Oga, nah joke. The guy said, now you start them. So, the issue is this. There's a dilemma between what the young pharmacist wants and what the employer has to offer. And so, the challenge is between your sense of worth and the organization's sense of value. What does that mean? Your own sense of worth is the value you place on what you are bringing to the table. While the organization's sense of value is their perception of the worth of what you think you are bringing to the table. Unless there's a convergence, there'll be fight. And so the question always begets, which one comes first, the egg or the chicken? Is it, Oga, pay me and see what I can do? Or do, then I will pay you? Now the matter will see the judge now. And so, when taking a job, it's not about whether the place can afford to pay you. No. It's whether they can afford to fire you. I've gone for an interview before. They were going to pay me like 3 times what I was earning then as a manager in Pfizer. I know it's a telecoms company, but they're a very notorious telecoms company. And after they gave me the job, I said, okay, I'm not coming. They say, you're too proud. I said, this is my career. It's me that will say whether I'm coming or not. And the question I want to ask you is, what you are doing today, is it what you were born to do or what you are paid to do? Unless you do what you are born to do, you will struggle. And so because they said I should speak about the new normal, I welcome you to the new normal. And there's a difference between the old way of doing things and the new way of doing things. And I'll just try and put it in perspective and so that we can move. And these are my personal views. I say here that when you take a critical look at the way things are going now, it looks like not much has changed. It seems that we are back to the old ways, but COVID seems to have thrown a lot of opportunities up in its path. What do I mean? You know, COVID, one thing the COVID pandemic did was to put fear in us. And apart from the fear, it allowed our brains to enter reset mode. And so, but after that, we're like, if children go to school, they may not come down, but they are carriers of the virus. When they go home to the parents, story. Maybe they'll be going and coming, and what happened? So the children are back in school. Church is back, full to capacity. Parties and shows, full swing. Maybe we are here now. Buses and bus stops, full to capacity. Political rallies are back. So technically, we are back to pre-COVID. However, it seems that as COVID has dealt with us, it has also left a lot of opportunities for us, which is what I want to leverage now. All the problems that were there before COVID are still there. But then it has given us an opportunity to think about our reality. Let me talk about medical tourism. The medical tourism industry is assessed to be a $1 billion industry. You know what that means? In Nigeria, in the current day, that's 500 and something billion naira. Now, please note, that is not the problem of the government. What do I mean? It's not the problem of primary health care center. People who go for medical tourism are those who have chopped belefu. Am I making sense? Those that go to India, go to US, go to wherever they go for treatment. That is a failure of the private sector, not of government. And if you know how much money has been pumped into the healthcare space, the fear of fear will catch you. Which is why I'm saying, you know what? If you want to go, go. Those who are remaining, if their sense is correct, they will hammer in this land. Now, if major investments are coming into the healthcare space, there's a hospital on the island, Urake, owned by CFAO. Even Lagoon, they all do it. If you want to do a surgery, if you want London doctor to come, you will pay a separate amount from the Lute doctor. They will fly him in. What is medicine? Diagnosis, equipment, medicines, right? The labs are scaled, Mercure, Africa and the rest of them. You have world-class labs now. Now you have world-class hospitals. Equipment are on ground. We are about to turn the corner. And that's one thing I want us to all understand. E-commerce, the advent of COVID made people more open to e-commerce. Even though it's not yet a very profitable sector, if you know the metrics, but then it still represents the future. Fintech, we all know it. Oh, Paystack, what's their name? What's this, Flutterwave and the rest of them. Serie A funding, $1 million. Yeah, it's real. That is the reality of the times we are in. And that's what I think is confusing. And I know that guy was my junior in school. Now they say they got $2 million. Your head, charge up 557 times. Hey, don't hammer. Health tech, edutech, digital content, and then there are now many more jackpot opportunities. So if you want to go, please go. We are not begging you. Now, so right now, countries are actively hustling. Saudi Arabia, Canada, UK, everybody is saying you should come. Feel free to go. But for me, all I see in the new normal is amazing opportunities. What do you see? I know it's jackpot opportunities, yes. So, please choose one. I'm going to show you some images now. Just choose one. Do you want this one? This one, call? That one, call? This one, call? This one, call? You don't even know the name of the flag. You say, yes. Just take me out of this country. So let's look at Nigeria. What are the features of Nigeria? Number one, insecurity. Am I correct? Poverty. Am I correct? Harsh economic climate. How many of us do business you run a business in Nigeria? If you run business, you understand what I'm talking about. Poor health outcomes. We have the highest maternal and infant mortality, Poor working conditions in all areas of practice. Poor funding for the health sector. In fact, these are more than enough reasons for you to want to japa. That's why I'm not angry with you. Go. And there's something I usually say that offends some people. I don't know whether I should say it here. You are laughing. Have I told you? Now, when I say you should go, I'm advising especially the very smart and intelligent ones. Because the opportunities out there for you are many. Go. If you need sponsorship, I can sponsor you. Yes. Leave me with the rest. Because if you, the intelligent ones, are here with me, we'll be struggling to see the same thing. You'll be seeing the money I'm seeing. But if you go, leave me with the blind ones. Well, don't worry. I can manage them. And so, what are the prospects of the average young pharmacist? If you're in retail, the average wage bill is like 120K or so with crazy work hours. Abi? Then there's R&G by the side. There's patent medicine by the side. But there's a very interesting... Is Peter still here? Okay, Peter is there, yes. You have had some very wonderful national chairperson. Peter, Hansen, all of them. When they are YPG, say, yes, you should pay your pharmacy ad. Now they have started their own business. And how can they come? Are you paying what you said they should be paying? You say, oh God, it's not like that. We are just starting. I say, oh, you are just starting. And so those are the hard truths that we need to face. And we have a chaotic practice environment. What if you're in the hospital? You're in one cubicle dispensing somewhere. There are hardly pharmacists in private hospitals. You and doctors are only fighting half the time. The institution doesn't recognize you. A hard life. Industry. There's limited manufacturing going on. You are import dependent, driven by the Asians. We don't have a lot of brands in the market. What we have are products. Everybody's just producing what every other person is producing. They say, okay, fine, your own is this. What does it contain? They move in straight. No differentiation. No improvement. Pharmacist rep, non-pharmacist rep, all sorts of things. So, another name for Nigerian pharmacy can be called what? Problem. Do we agree? We have issues in the Nigerian pharma industry. Okay, let me start from Nigeria. Do you have problems in Nigeria? Plenty problems. Do you have problems in pharmacy? Plenty problems. So this supports your ambition to run away, right? Good. Yeah, on point. So a number of you have seen this before. If you've heard me speak, this is my gospel. This is what I preach. This is what I live. And so you keep hearing it again and again until the gospel sinks. I call it the problem theory. And so we're going to talk about the problem. So let me ask you, how many of you here have problems? So what's today? One person agrees he has problem. The rest of us, we are very spiritual. It's not my portion in Jesus' name. I know. Now, how many of you love problems? The same issue. Why can I love something that is bad? Brother, warn yourself. Now, this is money. How many of us like money? Not everybody. Can you see? So let's take a count again. How many of us like money? In fact, let me know how spiritual you are. How many of us love money? Even though I say the love of money, you still love it. It's okay. Now, let me tell you something. Everywhere clean money is made, emphasis on clean. Everywhere clean money is made, it is always in response to the creation of value. Do we agree? So whenever you see Davido making money, whenever you see Taoma making money, whenever you see what's of the young pharmacist, Jide Francis making money, it is always in response to value created. Whenever you see yourself being paid a salary, it is in response to value being created. So let's move one step further. What creates value? The development of a solution. So once you create a solution and the person who you created it for likes it and says it has value, then you make money. Do you understand so far? So what do you create a solution for? I can't hear you. Say it in English. Okay, problems. So if you have a problem and you create a solution and deliver value, you make money, right? But remember what you said 2 minutes ago. You don't like problems. That means if you don't like problems, you won't like solutions. If you don't like solutions, you won't like value. If you don't like value, you won't make money. Does that add up? That is why most of us don't have money. That is why a number of us will not have money. It's not a cause. It's not a swearing sometimes. I'm not swearing for anybody. I'm only telling you science. Unless you have a great love and passion for problems, you will not make money. Do you think Dangote likes the look of rice or look of salt? Or the guy has seen a problem. You guys are hungry. And so he has created a solution. He has brought rice and this, and then you pay him. Why do you think he's building a refinery? He likes the color of petrol? No. You guys have been saying, oil, refinery, no problem. There's a problem, oil, Abi. I will create a solution, refinery. Will you buy? Yes, that's value. Please note that the moment Dangote refinery comes up, every day you buy fuel, you are paying him money straight into his pocket. Think about that 2 times. So ask yourself, what can I solve that people will be paying me for? So it's easy for you to look at Nigeria, see bad road, dirty gutter, complain. Hey, suck away is full, complain. Somebody is sitting to say, how do I pack this shit and then charge them for packing this thing and then I make money? Pharmacy is this, complain. Somebody is looking and saying, how can I make progress? So what's the problem? Here it says that it's a matter or situation regarded as unwelcome or harmful, and it needs to be dealt with or overcome. So let me run. So this is what the principle says. The bigger the problem, the bigger the reward. Am I correct? That is why, how many of us know Zytiga? You don't know Zytiga? Okay. Which expensive drug do you know? This, no, leaves are right too. This COVID drug. Is it expensive, Abi? Thank you. The reason why it is more expensive than paracetamol is because paracetamol solves a small problem. That one solves what? A big problem. If they say paracetamol is now 10,000 naira per tablet, you say leave it. I will drink water. I'll go and sleep. When I wake up, the headache will go. Am I right? But when you need whatever that thing is called, you need it. Because it's solving a big problem, it commands a bigger reward. Every time solution is found to a problem, value is created. And when value is created, wealth is given as a reward. Every time wealth is created, maintained, and sustained over generations, we call it prosperity. That's why we want to go to Canada and the rest of them, because they've been able to create constant value and wealth. If the problem can stand in front of your solution, then value is not created, then poverty is the outcome. A country with abundant problems, with no one solving it, has what? Abundance of poverty. Does that look like a country you know? Okay, it looks like you're even sitting inside one. Now, a poor country is one that has abundance of people that command little or no value. Let me flip it on its head. A poor industry is one that has an abundance of people commanding little or no value. The reason why you are complaining about patent medicine stores is because you are not delivering value. Am I making sense? The reason why you are complaining about doctors is because you are not adding value. It's the hard truth. Let's say it as this. Are you still here or you have left? Good. So the moment you create value, money will come. To break the hold of poverty, we need a burst of solution providers. A wealthy country is one with abundance of people commanding superior value. Now let me poke you harder. What is your current exchange rate? You say? What is, I didn't say the exchange rate, your exchange rate. $1 million, Abi, they are paying you. Show me your last invoice. So, there are 8,760 hours in a year. How do you spend your minutes? A work year has about 2,700 work hours. How much is your hour worth? How many of us have an idea of how much we earn per hour? You know. Oh, 455 hours, better. So I say if you earn 110,000 naira, my brother, every one hour, they are issuing you 500 naira. So by the time you collect one for the day, they just don't pay you per hour. At the end of the month, they'll gather everything and then they pay you. Now, please do not be angry with your employer. That is their sense of value of what you have to put on the table. And usually when I do trainings for people, I tell them, can you vex and just say, hello, sir, I'm not coming tomorrow. I'm resigning. Will your guy say, please, no, don't go. Or say, I've been thinking of how to sack you. You have made my life easier. Unless you are adding value, nobody wants to hold you. And so I said that your hourly worth depends on the value of the product. Now, a number of us, you will nearly stone me if I say money is not important. How many of you agree that money is not important? I know. But that's what I say, and that's what I believe. It's hard. I know it's a hard pill to swallow, but that's the way. So let me tell you, most of us chase money, which is a physical thing. But the spirit behind it is what we don't have. And I'll explain it to you now. Because whether we like it or not, we need to understand that the concept of money is going. Am I making sense? What you now know as fiscal money is going. Now you use cards to pay. Now you do other things online. Now you're talking crypto. Money is going. The more you chase the paper, the less you have. So let me explain it this way. Let's go back to the beginning. And where is that? The Garden of Eden. When our forefathers and our foremothers offended God and they were chased out of the garden. And then one became a hunter, one became a gatherer. And they became two economies. And so the guy that was planting yam wanted to eat fish. but he was not a fisherman. So he had to exchange yam for fish. That makes sense? But the day he wants to eat meat, but then there's no meat and there's only fish, he will need to give much more of his yam, unless the guy who wants fish wanted yam. I mean, it's getting confusing, right? That's how confusing it was then. When they say, you know what, let us create something that we will use to represent the value of what we bring to the market. And so there was chaos in the market, and then they created money. What you have on the screen is far from you, but let me explain it this way. How many of us are Yoruba? Have you heard of Ponkon before? Yeah. Ponkon. Now, if you ask some of us heard Pon, we don't know what it means. Pon is the Yoruba translation for pound. Pon, that what you see on that screen is Ponkon. You will notice that when they say Ponkon, it's twice the Naira value. It tells you that back then, it was ratio 1 to 2. Am I making sense? But that's not the message for today. What you have on the screen has a fine print, which you may not be able to. Let me read it out. It says, Federal Republic of Nigeria promised to pay on demand the sum of £1. I felt that because, Nigerians were colonized, we didn't know how to write English. Because if I'm holding £1 and you say, when you bring this, I'll give you £1, you are confused. So, look, that's Mama Charlie, right? Now, Mama Charlie, the one that wrote the English language. The same thing she's saying, Bank of England, I promise to pay the bearer on demand the sum of £10. The person that wrote English cannot be wrong. What does it mean? It means that when you present this note, I will give you goods and services worth £10. Am I making sense? And that value shifts. How many of us have the privilege of holding on to foreign currency in the last 1 year? Dollars or pounds? How many of us? Should I release the prophetic saying? I should speak it. If you had, stay with me. If you had $100 in your suit pocket January last year, is it the same value in Naira as at today? Is it the same note? Is it the same value? Does that tell you something that note is not the money? Are you beginning to get where I'm going? It is the value of what you have to offer that matters. Can you see it? Can you see what's on the screen? What's that? You say cold. Did you drink it? Coke, right? 50 cl. The question is simple. How much is it? 150. This bottle of Coke is 150. Any other price? 150. Okay, good. Consensus, YPG Lagos, 150. If they give you at 200, thief, in this Buhari economy, you are selling Coke 200 naira. But how much do they sell it in ShopRite? Less than 150, Abi. But you said it's 150. How much is it in traffic? Is it 200 or 150? Or it depends on the traffic. For pharmacies that sell drinks, how much is it? 150. In TFC and Sweet Sensation, the same bottle of Coke. Oh, 500 for Mr. Biggs. 300, 250. But he said it's 150 now. What that means is that when you get to Mr. Biggs, can I have meat pie, scotch egg, donut, and no drink, no door. You now go out, Coke. Come here. How much is it in Marriott Hotel? Okay, let me not use Marriott. Let me use Sheraton. How much? Or you don't drink it? You don't take coke, it's not healthy. Now let me draw this analogy. You see, if at the end of today's program I succeed in damaging your mindset, I'd have done my job. Do you know sometimes there's traffic on Mobolaji Bank anyway? Do you know? In Keja. Do you know that if you buy coke in that traffic, you buy it for how much? How much? 200. Those who buy coke, I tell you, bros, now 2, not be 150, now 200. Okay, good. But if you drop at the gate and you buy it, is how much? No, at the gate of Sheraton, you don't enter though. 150, 200, Abi. You now walk 100 meters inside and sit down, and you want to buy the same bottle of coke. How much is it? Eh? You don't have to live in, okay. But if I buy for you, you drink. It's called the power of brand association. The Sheraton aura increases the value of that bottle of coke, such that if the last time I saw you was at Sheraton and you are drinking coke, when you see me here, you say, welcome sir, you don't remember me? I'm the lady that was drinking coke in Sheraton. Because that coke now, so that level, you don't remember how we operate at the same level. But let's go to the flip side. This is how much they sell. The next question is, how much will you buy this bottle of coke? How much will you buy it? If they are selling 1,000, 2,000, that's their own business. But how much will you buy? Let me create new scenarios for you. How many of us have traveled Lagos by the expressway before? Okay. When there's traffic. When there's traffic from hell. When there's traffic from the hottest part of hell. Okay, good. So you are there 8 hours, no movement. Even though you are pastor's wife, you have removed your jacket. It means only camisole. You don't send again. And then, you know, there are communities around the express. So, ice coke here, you now see ice block inside. How much will you pay for that same bottle of coke? 1,000 naira. Will you buy? Or you say, I die here. Or after taking 2 bottles of coke, just like in this meeting now, there's lunch going to be served, there are drinks, and then somebody come and say, I got buy coke, will you buy? The same coke has dropped in value, the same bottle of coke. So, now that you understand value, you see, I'm not necessarily going to address this thing, but I'm going to open your minds and let you make your decisions. Let me introduce you to a new gold mine, a new diamond mine. And I tell you this, the new gold is in platforms. Alibaba, how many of us know Alibaba? Alibaba. Looking at somebody. Alibaba is an online marketplace in China. There's a program, when we have Black Friday, in China, they do Singles Day, 11 of November, 1111. It's called Singles Day. That's on Black Friday. In that one day, Alibaba makes $30 billion in sales on the platform. $30 billion. So what's your budget again? Nigeria's budget for the whole 1 year. Okay. When you know, let me know. Now, you can't see this, but what this slide shows is that between 2008 and 2018, between the top 10 companies, about 1, 2, 3, 4, 5 or half of them are platform organizations. 10 years ago, there was only one. Now, this is what a platform organization is. Facebook. Facebook is the world's largest media company, but doesn't have its own content. Who produces content for Facebook? Who? How much they pay you? Free. Good. Alibaba. How many products does Alibaba make? None. Amazon? None. Google is the world's largest software vendor, but doesn't write most of its apps. There's something they call open source. You know open source, there are a number of well-known applications that are open source. Meaning that just you come, write your own, you improve on it. They're not paying you, it's free. Airbnb, world's largest hotel chain, no property. Skype, world's largest phone company, no telco infrastructure. Netflix, world's largest movie house, no theaters. What have they done? They have created a platform. They have said, everybody, come, all of you, mumu, you go. When you now gather, they'll now go out. Come and see you. I have people. People now pay them to come and access you guys. That's the platform. That is why they paid. WhatsApp had not made $1 in revenue before. Who bought them now? Facebook. Before Facebook bought them for serious billions of dollars. Because they had created all of you. Hey, baby, what's up? Piao. Adeo, emoji. Piao. They just shoot and see them. They're all there. Come. And they paid. And so you need to begin to rewire your thinking for the new normal, the new economy. Let's leave the unicorns alone. A unicorn is a company that is valued at about $1 billion. And it's interesting that we now have Nigerian unicorns. Flutterwave is a unicorn. SpaceX is a unicorn. InterSwitch is a unicorn. Their valuation in dollars is over $1 billion. And some of them, you know the boys, we used to drink Gary together. No be Yola, I'm Yoluwa. And they punish him, I'm my junior. Oh, that's a story for the gods now. The guys rolling with the guys. So, it is said here that, you know, there's now, in health tech, there's now DNA, what's it called? Pay as you go DNA. You buy the pack, take your swab, you send it back. They will tell you where your great-grandfather came from. And so Samuel L. Jackson there, he came to Gabon because when he did his own swab, they say his root is from Gabon. And so, now you may not be able to build a platform, but the oxygen that the platform lives on is content. And that's why they say content is king. And I say here that with the rise of platforms comes the rise of content. I have Macaroni here. I have Investor Sabinus, Mark Angel Comedy, Yawa Skits, Brother Shaggy, Sisi Yemi. These are guys who are leveraging social media to make a killing. If you know how much YouTube pays in dollars to these guys for what the content they put on YouTube free of charge, you'll be shocked. That's the new normal you're talking about. Am I beginning to make sense? But then there's a science to it. A number of us have struggled, social. There's a science. You can't jump it. And so, like I was saying, as a person, as a pharmacist, what is your replaceability index? Like I said, it's not about how much they can pay you. Can they replace you? And I say in the healthcare space, with the evolution of technology, they are taking different people out one by one. The people who seem to be hardest hit now are the lab guys. And they are fighting, but they are fighting a lost battle. Even sperm analysis, there's now a do-it-yourself DIY kit. There's Sperm OK, marketed by New Heights. Now, if you are a guy and you have to assess the quality of your sperm, the thought of it alone is difficult. Not to now talk of you go to a lab to do the sample collection. How? I mean, even you they think I'm okay, they will give me one room, okay, I'll go there and then do what? But then this is a company that has packaged a solution that in your house, just do it. You analyze it by yourself. You by yourself will see your results. And so the advent and New Heights has the flurry of home test kits. From prostate to pregnancy to malaria. So the same thing that have gone to lab to kill, collect blood and everything. Now in the comfort of your home you can do. You can see that a profession is being threatened. That's why they are fighting pharmacy with everything they have. That you can't be doing lab, you can't be doing tests. I hear in Lagos, a farmer is even saying that we are not saying you can't do the test too, but you can't put it outside that you are doing the test. Because the lab guys are going to tell them that, look, they have collected all our bread. And so we need to be wary. And they're coming for pharmacy too. And so we disrupt or be disrupted. Technology is not a solution, it's an enabler. This is what the MD of Nokia said. He said, we did not do anything wrong, but somehow we lost. And that's very instructive. They were doing their business, but they were dying in the process. I'll just help you understand, because some of us don't understand this tech thing. We just hear tech. It sounds tech, but we don't understand how it works. So I'll walk you through the 6 Ds, and I think I'll be closing from there with a few live examples. So this is the 6 Ds of exponential framework. The first thing that needs to be done is for the thing to be digitized. After it is digitized, it moves into the deceptive. The deceptive mode, it moves into the disruptive, demonetized, dematerialized, and then democratized. What does digitized mean? The first thing is to make it a virtual product. So the moment you move that handwritten document and you have a soft copy, it becomes a digital document. The computer reads it as a series of ones and zeros. The moment you move your video from a disk or from a whatever and you make it online downloadable, it becomes digitized. Am I making sense? The next thing to do is to make it deceptive. It enters the deceptive phase when they're like, just like Bitcoin, it's a lie. It cannot work. How will people leave their house and go and sleep in the house of somebody they don't know? In a country they've never been to, you know? That's the deceptive phase of technology. Uber, that I will enter a motor that is not yellow and black, and it will just park, I will enter, they will not carry me away, is a lie. So the first thing they did was to digitize the solution. Once you digitize, it enters the deceptive phase. You know, just like when we did Pharma Gateway. Right now we're in the deceptive phase. It's a lie. They want to steal out. Some states are saying, PSN wants to know how much we are making so that they can now come back and remove our money. That's the deceptive phase. The next phase is the disruptive phase. When they start saying, come on. You be like, this thing is true. This thing is going to be true. At that point, it's disrupting things. The next thing, I'll share the slides with YPG so you can study them later. The next thing is it becomes demonetized. Things you used to pay for become free. And so, in the past, you will buy a digital camera, you will buy film. Am I correct? Today, you buy a camera and then buy film. But now the film part is free. It's demonetized because it's now a digital product. And it's interesting that the people that created the technology was Kodak. They created the digital camera, but say lie. There will never be camera without film. And then somebody did it. And then they ran out. Then the next thing is it becomes dematerialized. The phone you carry today is about 20 gadgets all in one. You have a camera, you have a clock, you have a radio, you have, all those things were individual gadgets that have all been dematerialized into that small gadget. And then the last stage is democratized, where it becomes everywhere. Dear guys, the future is the convergence of health and technology. So the question you want to ask yourself is, where is that convergence and where can I play in the convergence between health and technology? So what are the challenges of tech adoption? Fear of the unknown or fear of failure. Paper represents security. People like paper. That check I signed. Show me where I signed. Bring the document. Paper is security. But then it's all vaporizing right now. There's a digital migration journey. There are people who still don't believe, no, I want to pay my dues. I'll now go on my phone. Press no, let me carry my cash. I'll go to bank. Pay, let them give me teller. I'll now photocopy the teller. And then, so there is that migration. It takes a while for people to join. And some people are resistant to change. I remember one of us who is here, I won't mention his name, we were in a meeting with the association. He's a very progressive young pharmacist too. That meeting. And, he saw what we were presenting. I said, but so with this solution, can't we, make sure that the elders on the table now say, calm down, young man, calm down. If they don't come physically to the secretariat, what makes this place a secretariat? I laugh. Now it takes resistance to change. I'm still fighting the battle. I hope I win. And then it takes resolution of leadership. What are the areas requiring technology invention in Nigeria? This industry is one that is seriously lacking in market research. Everything we do is blind. Oh, we want to import paracetamol. How many should I bring? Any amount, no only. Who will buy it? Is the people, no only. And when we sell it, is everybody not? There's no data anywhere to support anything. Should we then do the liquid or shall I bring everything? If it expires, God knows how to work it. So if you have a solution that can collate data and present it in a way that is useful for business, you are in money. I know you won't use it. About 5 years' time, when I finish what I'm doing, I'll come and start it. Regulatory activities needs to be automated. Patient care needs to be. So you need to begin to think, what problems are my patients having? How can I use technology to solve this problem for everybody? Logistics and distribution, manufacturing, learning and development, HCP engagement. Look at regulatory. Every year, PCN produces this book. If you go now to the secretariat, to the council in Yaba, the one for last year is there. Hard copy. How much research are you doing with this hard copy? Very limited. If they say, look for Yimika Oguns in this book. Yeah. Okay, Lagos. Okay. Oh, why? Which one? But if this thing was in Excel, what do you need to do? Search Yimika. All the Yimikas will come out. Add Oguns. How many are you people? It's only you now. And they come out. So that's digitization. Then when you now move it and then add on to it, then you begin to see value. It is said that about 5 years ago, 75% of local governments in Nigeria don't have a community pharmacy serving them. 75, 3/4. But the question is, where are these places? In Oyo State, 17 out of the 33 local governments did not have a pharmacy. Abuja and Lagos are the only 2 states in Nigeria where there's at least one pharmacy in every local government. Opportunities everywhere. You want to go, Abi? Go. We are here. And so this is analysis of the pharmacies across the country. Now, this is a geospatial map. This map tells you where exactly the pharmacy. This is the project I said we had. But then if you now zone in closer, this is Oyo State. You will find out that virtually all the pharmacies. Oh shit. I should just be going. Okay, so all pharmacies are actually centered in Ibadan. All the other places are no pharmacy. It's only technology that can show you this information. I was supposed to share with you opportunities that are in the box and those that are out of the box. My time is gone. I cannot expatiate on them. But these are all the areas where you need to be looking at to find the new gold you are looking for. These are the key considerations, the things you need to do. How do you begin to deliver value? Why do young pharmacists fail? There's a problem of character, competence, and commitment. There's a problem of vision. We fail not because we aim too high and lose, but because we aim too low and we hit it. There's a problem of passion. There's a problem of commitment. There's a lack of business and clinical skills. And then there's a big problem of patience. Let me round up with this one. I was supposed to take each of the things we had done and show you how we did it. But let me talk about panel. And I'll talk about the lessons I learned from the panel. So the panel is the retail pharmacy. How many of us know the panel? Okay, so for those of us who don't know, the panel is a retail pharmacy conference that brings in community pharmacists from all over the country into one place for a 3-day conference. We started in 2009. That's 13. This year was the 13th edition of the conference. And these are the lessons I learned in the process. Number one, you start from where you are with what you have. Most of us want to start business at the level of where our current employers are. No. Start with what you are. Start with what you have where you are. When I started the panel, I did not have a company account. I did not have money to do the conference. I did not have anything. All I had was an idea. And I hosted the conference. I paid the venue from the money people were paying at the gates. After I reached 100,000, I went to pay them. And then for those who, because the money was not enough, they were paying into my dad's engineering account. Somebody come and say, sorry, this engineer, I say, it's paid there. It's us. Don't wait for things to be perfect before you launch out. Number two, the vision does not have to be yours. It doesn't have to be you that created the thing from the get-go. You can build on what somebody else is doing in some other place in the world. Lesson 3, be careful with good advice. It can be dangerous. What do I mean? When we started the panel, we wanted to operate at a particular level of quality. Some of my advisors were like, no, Shino, just must they eat lunch? The way we do in PSN now, you eat puff-puff today, tomorrow. Hope they're not watching. And all the rest. I said, no, standard breakfast, standard lunch, and all those things. That is what has kept us till today, because people know the quality to expect. They were telling us to calm down, all those notebooks. It doesn't have to be so fancy. Lesson 4, watch out for the voice of God through man. At the point I was getting discouraged at the panel, she's actually the founder of my medicine, Sabimbola. When you do a program and a member, somebody that paid, does vote of thanks. And she's taking me, I say, you don't know what you are doing, but continue. Some of us have tried it in the past and we left it. Just keep pushing on. And that was the tonic I needed to do the next edition, which was our breakthrough. 5, when competition comes, be happy. Some people hate competition. I love competition. Because for us, when competition came, the person who wanted to do the similar program used my venue, used my speakers. And that was the time we moved to a bigger venue. So you want to play? Let's play the game. That was the first and last that person did. Know your numbers, your expenses, your price points. Start with your market where they are, not where you wish them to be. People will come against you. Please note, nobody throws stones at fruitless trees. Can you see? You know Christmas tree? That's a tree that has no fruit. Have you ever seen anybody throwing stone at it? You think it's mad. But orange, mango, once you have fruit, they'll throw stones at you. And so we had our fair share. There was this group there called Pagon. They've died a natural death. But they really came after us. They went on Facebook. They say he's into advertisement only. Somebody said the advertisement is not free. Those he advertises for, pay him handsomely. What about the panel on retail pharmacy organizers? A smart way of reaping unsuspecting pharmacists. RX Evolution cannot fool me. I'm smarter than him. This was how many years ago? We are here. They are. Did an analysis. I love this analysis. He says, if 500 dumb pharmacists, this is Facebook, if 500 dumb pharmacists register for this panel of frustration, 500 times 15,000, 7.5 million. Revenue for one day, 7.5. Cost of conference, 2.5. Profit per panel, 5 million. Organized 4 panels, 20 million. How many pharmacists make this from their shed? At least he's not looting public funds. Where did they say? They say, RX Evolution Healthcare smiles to a Papa branch of Zenith Bank in his Honda Element at the end of every panel. They even wish car for me. So when you do something good, they will come after you. But be focused. Lesson 9, brand building takes time. That's one thing I've learned from Reload. Consistent brand building year on year and see where the brand is today. Disappointments are part of the package. When we started this program and Bukomi was working, Bukola and his coordinator were working about, I don't know what it feels, but it's part of it. Keep to your standards. Be open to ideas from strange places. Be your own competition. Don't wait for other people to compete. If there's no competition, be your own competition. Stay focused. Think big. But the cue ball, white ball, is the God factor. The God factor makes all the difference. If you do everything, and your hand is on my brother, game over. I'll end with this saying from Macaulay. He says, when the end comes for you, and it will definitely come, make sure it makes you climbing new mountains and not sliding down old hills. Thank you very much. You've been wonderful.
Thank you, sir. I will give a round of applause.
Wow. Thank you so much, sir. I know, in fact, we didn't want to stop. We wanted to continue. In fact, if we say we should give extra time, should we give extra? Thank you, sir. I think the escorts will take fix with him. Yes, so thank you so much. Quickly, we're going to have a birthday celebrant, and he has a big cake. So if everybody leave, I'll cut the cake alone. But right now, I want to take remarks quickly from
the MD and the Chief Operating Officer of Pharmacy Plus, the President of Pharmacists, Chukwuemeka Obi. He'll be giving us his remarks shortly after this. Thank you very much.
I'll please appreciate him as he comes forward. Cindy, continue. Let me take my picture. Yes.
Please, as he takes his step on the stage, let's give him a round of applause. He's a lover of young pharmacists, someone who has been a great support to young pharmacists in Nigeria. Thank you so much,
sir. Good afternoon. I just wanted to do a quick in and out, but Shino held me down. I want to greet every one of you, and I want to thank the organizers and the past presidents of YPG. Forget about the white bird, so I'm still a YP too. I want to acknowledge the good work you people are doing, and I want to thank each and every one of you that made our time to come here today. And the reason is very simple. Some of the things that will make all the difference in your lives are the things you hear and the things you see. Shino is one person I always like to tap his brain. And I was here where the panelists were here, and I listened to to each and every one of them. And I must have to tell us something. Most of the things that we are chasing are not in far-flung places. They are here. They are here. It's just for us to look deeper, scratch deeper, and you'll find them. If there's something I heard which I want people to take home, is the issue of trying to find one problem in this space and solve it. If you're able to do that, money will chase you. Yes. That's the reality. I left pharmacy school this is my 27th year as a pharmacist. And when I left pharmacy school, one thing was very clear to me. I know I wasn't cut out to write CVs. And I made up my mind that, look, I want to start something and watch it endure. Our flagship was this product, Alphabetic. And over time, God has helped us. I like how Shino ended, the God factor. For every one of us, I want to implore you. Those that want to go, those that want to leave this space, I wish you well. But one thing I've known over time in my life that, look, Nigeria holds so much promise. Not even promise, promises. And where there are no problems, there's nothing on the table, there's no money on the table. I still made a pitch for a business for the abroadians. That was on Saturday. And one of the slides was highlighted, not even one, 5 slides. The first 5 slides was to show what the problems were or the problems are. Then you now talk about the solutions you want to bring to the table. The financial was the second to the last slide. Even competitors. In a business where there are no competitors, that means you must have to look at it again. What am I trying to say in essence? Look deeper, scratch deeper, and search deeper. I love young pharmacists. I do. I do. I can't remember, even when, from inception, you know, Peter is here, he can attest to that. When there was no value to be taken. Today, a lot of people will come around because there's value on the table. People are bringing value, right? But then I don't know whether you did not offer me any value. But I was doing it out for the love. And still today, the love is still there. I wish you guys well, and I look forward to seeing you guys at the top. But whatever you want to do, always think about the value you want to bring to the table. I've always said it every time. Oh, there are no jobs. Look, there are jobs, and I'll keep mentioning it. I'm owing one of you. The lady is supposed to be in Port Harcourt. I promised her because she said that I've forgotten her name, but for the purpose of this, whatever, if anybody remember, I can't remember this, I mentioned that she's challenged me, and I told her anytime you're ready. She reached out to me, but I can't remember what her name is, so I cannot figure out her name from my phone. And then some of my guys are at the back there. Some of my guys are at the back there. And they know. We have a staff that is doing 13% of our entire turnover. Chisom, is it a lie? One person. And I can tell you the number is massive. If I see 10 people that are ready to do the same thing, those people are employed though. So when people say there are no jobs, I laugh. So on that note, I don't want to take your time because I know, we have been, most of us are tired, and the smell of the food at the back is, the aroma is something else. Some of us wants to have a feel of that. I want to thank you for sparing our time to come. Don't think it's a wasted time or a wasted effort. But most of the things you hear here, take it home, chew them, and try to imbibe them. You know, if there's something I learned early in my life, is reading the biographies of people that made it. You know, when I read How I Lost My Virginity by Richard Branson, it blew me away, and I read so many others thereafter, and it has always helped. You know, if you're able to replicate what somebody successful has done, even if by maybe up to 50%, I can tell you will touch success. On that note, I want to thank you for sparing our time to come, and for all of you, I will tell you you're my friends, and anywhere you see me, engage me. Only that mask have made things very difficult. I see some people I don't recognize them. I wish you all well, and you do have a good evening. Thank you very much, and enjoy the rest of your day. Bye-bye.
Thank you so much, sir. We are going to see value, sir. PSN-YPG, we deliver value. Thank you very much once again for that remark. Right about now, I'm going to be calling the representative of the Lagos State PSN chairman to come and give us a remark.
In person of Pharmacists, Kende Adepoju, a round of applause for him as he makes his way off stage for his remark.
Okay, just a minute before his take up. Mega Medis has lots of gifts, shopping voucher, and cash prizes at the back for us. Now, the deal is download the app and sign up and order for a drug. I've done it, and it's free, and I have a shopping voucher already. So order it quickly and present it at and you get your cash prize or a shopping voucher gift. Thank you.
All right, thank you very much. Good afternoon, everyone, distinguished pharmacists and colleagues here present. The chairman of the occasion in absentia, Honorable Hakeem Shokule, who is the chairman, House Committee on Health, Lagos State House of Assembly. Our keynote speaker, my very own brother and mentor. I've known him for a very long time. Pharmacist Shino Opanubi, the project catalyst for Farm Alliance. He is not just the project catalyst for Farm Alliance. We call him the catalyst because he has successfully catalyzed a lot of growth reactions over the years. And the keynote address was very stimulating. Please, can we just give him a round of applause? Thank you, Farm Shino. Our distinguished colleagues and our panelists, invited guests, I welcome you all, and thank you for waiting this long. I bring you greetings from the Lagos State Chairman of PSN, Pharmacist Gbagada Iyola FPSN, who is unavoidably absent. And I can confirm to you that up till last night, this event was top on his list of programs that he planned to attend for today. But unfortunately, he had to attend to some urgent official assignment, and he has asked me to represent him. All right, so he sent his apologies. And for those of you who know the chairman very well, you will agree with me that he is an ardent believer in the YPG project, the YPG dream. He is big on personal and professional development, as well as mentorship for young pharmacists. So it is indeed a great pleasure to be here and to be invited. The theme of the week, the new normal, emerging roles of young pharmacists, is both instructive and timely. The COVID-19 pandemic has no doubt impacted every aspect of our daily and professional lives and ushered in a new reality. And this reality has caused an increase in economic burden, disruption into supply chain, increased cost of treatment, shortage of global food supply, increased disease burden, just to mention a few. And with challenges come opportunities. The opportunities are limitless, just like Famshino mentioned. And I would like to just use the analogy of Pharmacist Shino. In 2014, I was at the ACPN National Conference in Ilori. That was held at Aka Center, Event Center. And he came up stage, addressing the delegates. He held a note. I can't remember the denomination, about 500 or 1,000. And he asked them, how many of you want this money? The hands went up. And he held the money, the note, squeezed the note, ruffled the note, and lifted it again and asked the same question. How many of you still want this note? And the hands went up again. In fact, this time, more hands went up. And he was trying to let us understand that the value of Naira is actually not in its state at that time. So the same thing, COVID-19 pandemic has come to ruffle us as professionals. But of course, our values have not changed. We are still pharmacists. It should challenge us to look beyond the normal. It should challenge us to look outside the box. Take advantage of the opportunities that are there in blockchain technology, artificial intelligence, robotics, and improve on the practice. Ladies and gentlemen, I can tell you that PSN Lagos State will continue to support and mentor and open its doors to all young pharmacists, irrespective of practice areas, to harness the opportunities of the new normal. Distinguished young pharmacists here present and those watching via the internet, it is time to think outside the box and take advantage of the plethora of information and opportunities at our disposal. Let me add that Lagos State will stop at nothing to continue to open its doors. Our mentorship program is being revamped to provide more mentorship, tutelage, and collaboration with young pharmacists. In closing, I would like to urge you all to keep an open mind, keep learning, keep changing the narrative of pharmacy practice. I wish you all a memorable week. Thank you all, and God bless YPG, Lagos State.
Thank you very much, Pharmacist Kende Adekboju. We can do better than that. A round of applause. I see our mouths are busy, but our hands are not. Please, a round of applause for him. Thank you very much, sir. If you've been listening so far, you understand that the crux of the matter has been value creation, searching for more than what is conventional, So, young pharmacists, I'm hoping that at this point of this opening ceremony, we should be thinking of disruptive ways, innovations that we can bring to the table. All right.
Which table?
Any table you find yourself, really, anyone, even the one you're eating on right now.
Yes, I can see some things on the table.
All right. Remarks from the YPG National Chairman.
I can also see that the National Vice Chairman is seated right beside her.
All right.
We recognize you, sir.
Please, a round of applause for the YPG National Chairman, the leader to over 5,000 young pharmacists in Nigeria. It is not easy. Please make some noise. Thank you, ma.
I go down. Thank you very much. You know, usually we undulate a lot when we are claiming numbers for YPG. it's very interesting. Sometimes we go from 1,005 to 2,000, and I'm much more comfortable with percentages. You know, I can tell you that over 75% of the community pharmacy workforce are members of my organization. You can't argue that with me. Okay. All protocols duly observed. The catalyst of catalysts. It's always a pleasure listening to you. I would be remiss in my duties if I do not recognize the presence of the leaders of YPG here present, past leaders of YPG present. From Onimisi Benjamin, he usually calls YPG his baby. You know, it's been a couple of years, and he was one of the brains that made YPG become an interest group of the PSN. So I would like you all to just appreciate Dr. Onimisi Benjamin, who's here present. And like the moderator said, my vice chairman is also here present, Pharmacist Ajibade Oluwabukumi. And yes, the person that just finished speaking happens to be, Emmanuel, he's your great-grandfather, Abi? Okay. He was a one-time state coordinator of YPG Lagos. He was pioneer. He was a pioneer. So it was my great-grandfather, I think, in YPG Lagos. It's been... Anyway, the summary of this is, it shows that YPG believes a whole lot in continuity. YPG believes a whole lot in being able to pass the message across from one generation to the other. And having these men who have gone ahead of us still here present with us today means a whole lot. So, I bring you greetings from the National Secretariat of PSN-Young Pharmacists Group. I'll do a little bit of history. In October 2019, the very first YPG Lagos Week held. I was fortunate to be a part of that administration. I was the general secretary, I think. And I dare say that was the first independent week of any YPG chapter in Nigeria. The vision was to have a week where young pharmacists could network, address pressing problems, and also make a lasting mark on their community. The theme for that year was Young Pharmacists as Champions of the SDGs 2030. In 2020, the theme was the future of healthcare, leveraging pharmacies as the first port of call. And today, 2021, which marks the third edition of the YPG Lagos Week, the theme is the new normal, emerging roles for young pharmacists. We have come some way since we first started, and I know I speak for all the past leaders and visionaries, Kenneth Phillips, Muyiwa Olagunju, Fumbi Okoya, Olabi Oyekomi, amongst others, when I say that I am immensely proud of how far YPG Lagos has come. As national chairman, it gives me immense and great pleasure to be here present. I imagined I would have a challenge knowing if I was coming here as IPC of Lagos or if I was coming here as national chairman. But it's fun to be able to handle both positions. I'll just say a little bit about PSN-YPG. The mission of PSN-Young Pharmacists Group is to help develop individuals who can act as agents of positive change at local, national, and international levels, both in the profession and in the society. based on the spirit of national cooperation towards sustainable development. The core of our mandate generally revolves around providing value, empowering young pharmacists, increasing professional competencies, providing increased access to both local and international opportunities, helping to protect young pharmacists from exploitation in the workplace. We're also committed to building relevance in PSN-YPG as an organization. This is for the benefit of those of us who might just wonder, okay, we keep talking YPG, 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 what exactly do you people do? So this is just a summary of some of the things that YPG has been about for the past couple of years. But the overall goal of all of this is to make PSN-YPG work for us, is to make PSN-YPG work for you as a young pharmacist, is to make PSN-YPG work for me as a young pharmacist. And this cannot be made possible without participation, cannot be made possible without your involvement. Imagine Pharmacist Obayomi Emmanuel and his team put this together and nobody showed up. We would not be having this event. So without you, there is no PSN-YPG. Also, even as I prepare to exit the stage, I know that if you have been paying attention to YPG events, you would know we're rounding up another year, another mandate. I look forward to a leadership that understands what PSN-YPG stands for and is committed to performing and getting things done. Again, nothing can be done without you, so we should be looking out for a leadership that is committed to providing value for you as an individual and also for the organization. And for PSN-YPG Lagos, I must say that year in, year out, we strive to surpass what has been done. And today, I am proud. I am proud of what you have been able to achieve here today. Today is just the opening ceremony. So in the spirit of involvement and showing up, you know that there are still other activities lined up. So I will encourage us all to show up. There is no particular sect that gets to lead YPG Lagos or that gets to lead PSN-YPG. All you need is the will to do. And you just show up. Just show up and people get to see what you have to offer. In conclusion, I would like to, well, it's probably not my place to do a vote of thanks, but yes, I would like to appreciate everyone who has made this happen, the leadership of PSN-YPG Lagos, the executive council members, and one group of people that we don't ever remember, and that's the planning committee. Most times we give a whole lot of credit to the people at the top, and you forget the foot soldiers who actually got the job done. You have done a fantastic job today. So thank you very much for listening, and congratulations on having one of the best opening ceremonies yet for PSN-YPG Lagos Week. God bless you. Woo!
We can do better than that. Another round of applause for her, please. Thank you very much, our chairperson. If you have never seen our chairperson before, that is our national chairperson, person of Pharmacists, Yimika Oguns. All right, we have a birthday celebrant. Okay, so we'll just take that now. We have a birthday celebrant, one of us, a young pharmacist, who would like to share his special day with every young pharmacist seated in this hall today.
Revitalization.
I enjoin all of us to share the goodwill. I'll call the state coordinator to do the honors for us. The cutting of the cake, the singing, whatever. Please a round of applause for him. And Pharmacist Vitalis, HDK, please make your way forward, birthday boy, so we can quickly get this party started.
With this baby face, if I ain't get him, really hate me. Get him belly aches, love him waist deep. Every occasion, I put me in
Okay, so I think today is the birthday of one of our members. That's Revitalization. So quickly, I would like us to. I'm not really a good singer, but I know we have beautiful voices in our midst. So I would like us to sing a happy birthday song. Yeah, we have to sing the song before he cuts the cake. So can we all sing the popular happy birthday song? Happy birthday. 1, 2, go. Happy birthday to you. Happy birthday, dear Vitalis. Happy birthday to you. How old are you? For he's a jolly good fellow. For he's a jolly good fellow. For he's a jolly good fellow. And so say all of us. So we'll be cutting the cake. I want, who are your friends? People that you want to join this cake. Okay. He's asking for our national chairman, the publicity secretary for PSN Lagos, national vice chairman. Please do us the honors. Our former national chairman, Dr. Onimisi. Strong men. See, you're calling strong men than women. Tell me well. Run on the hustle and they try sustain. Every Saturday. From Ilaja down to Costa. This cake is carry my blessing run. Today now you tomorrow be my turn. Show me love, now go show me python. We be the same for Oluwa Kingdom. So me say, celebrate me. So we'll spell Vitalis. Vitalis is one thing. No, Vitalize is wrong. So Vitalis. Yes, so we'll spell it at the last word we cut the cake. So Abi, okay. Hey, sorry. L-I-S. Happy birthday.
Round of applause for him. Please celebrate him.
It's a special day. Okay, so I want to use this opportunity also to just present 2 quick awards. So let me climb the stage. Okay, so we had a very beautiful keynote address by Pharmacists. Where is it? Shina Panubi. So we would like to present an award for him, recognizing him as please, can someone? Okay, we want to recognize him as the keynote address speaker for today's occasion. And to do the presentation of this award, I would like to call one of our big daddies in YPG, one-time national chairman of PSN-YPG, Dr. Onimisi Peters. Please kindly do us the honor of presenting this award.
Thank you, my chairman, Pharmacist Emmanuel, for a job well done. Though you've called me to present an award, but let me use this opportunity to say YPG Lagos started on WhatsApp in 2016. Probably I was the first member on WhatsApp. Today, you can imagine how happy, excited and I am that what started on WhatsApp has transformed to what we're having today. You would be thinking that this is a national event, but this is a Lagos event. Thank you, thank you. Thanks for what you're doing. Please start preparing yourself for national assignment. Don't stop here. Now, to the biggest honor. You've done me a very big honor to ask me to present this to my own Oga. You know, when we started YPG project, we started with him. We went to him, we talked to him what we wanted to do, and he has always been there. Day, night, he will give you the contact, he will give you the advice, he will be there to talk to you. He will do everything possible to ensure you and he will carry you along. So when you see, I'm sure he knows he can call us anytime and we are there. He's one person, he will call you. You can't give excuses. You have to cancel other appointments to meet his own. Because he has been a mentor, he has been a role model, and he's still there. Thank you, sir, for what you're doing and for mentoring us and inspiring us. This award is an award of recognition presented to pharmacist Adeshina Opanubi. I hope you know his name is Shine because he shines. As keynote speaker at PSN-YPG Lagos Week opening ceremony, this award is presented on 19th October 2021. Congratulations, sir.
In my life for you, all over the news, all over the news. Only God and I know the kind of thing I do, the kind of thing we do.
Thank you very much, Dr. Peters. Lastly, I have one award left. Yeah, we want to also recognize and appreciate, like what was earlier said, the PSN Lagos chairman has been a constant supporter of YPG. My predecessor can testify that he's always ready to listen, can call him, can send him messages. He's just ready to assist us wherever possible. So today we would like to do the honors of giving him this recognition, appreciating him for his constant support for young pharmacists in Lagos. And to receive this award is the Publicity Secretary for PSN Lagos, representing the PSN Chairman, Pharmacist Kende Adepoju. Please, sir, can you come over? And to present this award is no other person than our national chairman, who was a former Lagos State coordinator, actually handed over to me, Pharmacist Shimika Oguns. Please kindly do us the honors. Thank you.
Okay, thank you very much for let me borrow the words of Dr. Pisa, for the honor of allowing me present an award to my chairman. I call him my daddy because that's who he is to young pharmacists generally in Lagos. I think if we were to count the number of cases he has had to help us settle between employees and employers in the past 2 years, it's a lot. It's a lot of cases, and it's an honor to present this award of recognition to pharmacists Gbagada Iyola FPSN, the chairman of PSN Lagos, ably represented by Francis Kende Phillips, for his continuous contribution to PSN-YPG Lagos. Thank you very much, sir.
Thank you very much. So, in closing, I'm trying to locate. Okay, I would like to call on. They say the All Beautiful Planning today's event has been chaired by a very wonderful lady. She has been, I'm sure most of us have seen her walking up and down. I want to call her for the vote of thanks, but before I call her up, I want to hype her a bit because she has really done a very good work, sleepless nights, series of meetings, and I don't know how to categorize. She has enough energy to dispense, and she has been dispensing it properly. And I would like to appreciate her. I would like to call the chairman of the planning committee for the week, Pharmacist Ogundele Bukola, to come and give the vote of thanks. Yes. Please, can we give her a sounding round of applause? Because without, I can confidently say without this lady, I don't know if this program will actually hold. Because I gave majority of the job to her and her team, and she delivered. So thank you very much.
Good evening, everybody. I'm so honored, and joy fills my heart this evening. And thank you wouldn't be enough to, first off, my chairman, PSN Chairman Lagos. Thank you so much. Okay. Thank you so much. Famshino Panubi. Please, can we give him a round of applause? That man is a father. Like, everything you're seeing here in the background, I was going to ask myself, like, is he part of my committee? He had to put so many things on himself in a short notice. Thank you so much, sir. So much honor in my heart to you. Thank you so much. YPG National Chairman, ma. Thank you so much, ma. Thank you so much for the help. Thank you for the encouragement. Thank you so much. My coordinator, Pharmacist Emmanuel Obayomi. So much love I have for you. Thank you so much for giving me this opportunity because I see it as a privilege. Thank you so much. To my planning committee, wherever you are, please, you deserve a round of applause for yourself. I couldn't have done this by myself. Thank you so much. Thank you so much. And to YPs in Lagos, you guys blew my mind today. I was pretty scared. I was like, would this all be filled? Thank you so much. Please, a round of applause for yourselves. Thank you so much to everybody that made this happen. To Taiwo, my facilitators, everybody, Ben Ajepetemi, you guys did amazingly well. Thank you so much. And I would like to tell you, this is just the beginning. We have so much things lined up for you during the week until December 11. Yes, December 11 too is another moment you are looking up to. And I want to see the same energy and the same drive till the end. Thank you so much. Have a beautiful evening, everybody. I love you so much. Thank you.
Loving you be my greatest sin. I said I was done, but see I'm here.
Yeah, we should close, but I want to quickly pick up someone. Okay, so we all know that elections are coming up. The YPG national election is coming up, and we have someone in our midst. I would just like to talk to us. His name is Pharmacist Okiche. I don't know if I got that pronunciation well, but I know I got Prince Will. So he wants to just speak to young pharmacists in Lagos. Please, can we give him a round of applause?
PSN. I know we have eaten and the meal is delicious. I just ate, I don't know if it is bakery, and this is my first time. I think it's nice. First of all, I want to greet these men on the high table and the national chairman. All protocols duly observed. Pharmacist Onimisi Peter, one of the pioneer chairman of PSN-YPG. So having the pioneer chairman of PSN-YPG, the current chairman of PSN-YPG in Lagos State, it is wonderful. No wonder the state is called the Center of Excellence. I can see everybody excelling with smiling faces. My name is Okiche Prince Ulugochukwu, the coordinator of PSN-YPG Rivers. What you are seeing here, we did in PSN-YPG Rivers, we did our own week in the month of September, and it was hectic. What you are seeing here, people put out their time, their resources to make sure that this thing is like this. So I want to plead with you, both the students that will soon join YPG, support them, because it is not easy. And PSN-YPG, the continuity is very, very important, because PSN-YPG is one of the best things that happened to pharmacy profession, bringing you closer to the leadership of PSN, and with that, we excel. Coming to why, one of the reasons why I came here today, when I learned the PSN Publicity Secretary of Lagos State, Pharmacist Kayode Kehinde, told me that an event like this will be is happening in Lagos State, that I should try and be present. So I looked at it, I said, let me come and see what is happening here, so that I can go back and tell my people, in Zion, it is happening. And really, Lagos State is doing well. So I met Pharmacist Sashino. Hopefully, when I hand over next year, Pharmacist Shino will be in Port Harcourt to do something for PSN-YPG. And the Sanofi lady, the madam from Sanofi that did the part of the panelists will be in Port Harcourt, because I believe in continuity. Like for our program this year, we had the Deputy Speaker of Rivers State House of Assembly, the keynote speaker. We tailored it towards politics. And here this is tech. So what it means is that PSN-YPG in all ramifications is making sure that their people, that the members are moving forward. Because as a tech guy, it takes only a political statement to spoil your business. It takes only a political statement to spoil your business. So if you are a tech guy and your colleague, who is a pharmacist, is a politician, when the bill comes up in the house, your friend who is a pharmacist that is a politician will not allow you to fly. Because he will give you feedback that this is what they are trying to do. This is this. You will now tell him, okay, this is what you are going to do for me to not fly. So in as much as we are pursuing the career, the emerging roles for pharmacists also puts politics into consideration, because it will not be, it will be a nice one that in years to come, that you have a Lagos State governor as a pharmacist. And then when PSN-YPG wants to do an event, you go to more, you have resources to do that and also train more young pharmacists. I'll start with, in 2017, I attended my first YPG program in Rivers State, which is called Let's Enlighten All Pharmacists. So after that program, I was in final year. I got interested in YPG activities. I came on board 2018. 2019, I was part of the committee that prepared the plan for the program, and it was a success. Then in 2020, I became the secretary. We did a lot of things to move the association forward. In 2021, I had the privilege to serve as a coordinator. And starting from the first program of PSN-YPG, from 40 to recording over 170 persons in attendance of PSN-YPG Rivers, the continuity is there and the growth is there. And we have the full support of all our leaders. And with the experience I've gathered, I want to bring it to the national level. In PSN-YPG 2019, we did a COVID-19 sensitization program, which gave us an accolade both in the national and the state level. We brought about newsletters to publicize activities and so many other things that we did. And 2020, we did, okay. So, come PSN-YPG election in Rivers State, what I'm bringing to the table, effective secretarial representation, effective inclusiveness of everybody in PSN-YPG activity, and social media. Because anybody that have not heard anything about you will not know who you are. And in PSN-YPG Rivers, we do it continuously. Media engagement, we'll bring it to the national level. And we're going to do a lot of things. And with your support, I believe PSN-YPG will move further. Thank you very much.
Okay, since we are still eating, in the spirit of the campaign, I would also just want to give you 3 minutes. I want to invite Pharmacist Vitalis, birthday celebrant, also has 1 or 2 things to say to us.
Ever since I got my first hit song, getting jealous.
Good evening, everybody. PSN. I want to sincerely appreciate the organizers of this event. Pharmacist Emmanuel Aboyomi, you did so well. I really appreciate you. Then to the past ESCOs of PSN-YPG, starting from my Oga, Pharmacist Peter Onimisi, and the current chairman, Capacity Woman. Greetings to you. I really appreciate your presence, and it's actually because of you guys, what you guys have done, that we are now competing now. We are leveraging on what you've done. So, and okay, my name is Pharmacist Ejidike Vitalis, and immediate past coordinator of PSN-YPG Anambra State. I'm currently residing in Lagos, working with Alpha Pharmacy, and I am an aspirant for PSN-YPG National Vice Chairman, come Rivers YPG National Election. And I want to sincerely appreciate what's happened here today. You know, everybody that spoke today, the panelists, our guest speaker, they centered on one thing: value creation, value addition. That is my tag, value creation. Now, what we have here, like what we have here today, is actually too much for Lagos. We need to take it to to the nation. We need to take it to Nigeria in general. That is the idea I want to do. We want to create value. We want to make you employable. We want to create access for you. There are so many things we've done. When I was the PSN coordinator, PSN-YPG coordinator of Anambra State, there's a whole lot of things we did. We liaised with the whole of officers. And coming to national, we hope to bring those things on board. Internship, continuity programs, partnership, collaborations. We need to create value. There's something I was thinking in terms of creating value. I was like, we can actually help ourselves grow with PSN-YPG. Because PSN, in general, has one intention. They have one big problem, which is fighting open drug markets. Now, they can't just open because there's a whole lot of forces against those things. But we can actually help ourselves. And the only way we can help ourselves, according to my PCN chairman, he said, we can assist ourselves. If two pharmacies can come together and compete and open an industrial pharmacy with the support of YPGs, we can go a long way. We can support ourselves. Now, imagine somebody imports and sells a particular medication, and then we leverage on the capacity and number of YPs to circulate this medication across board. You can imagine when you do it for 1, 2, or 3, or 4, 5 YPs at the same time, how you have empowered these YPs. These are many more we will bring to the table if elected. So I pray, come Rivers, we'll be able to make a good choice and continue from where our predecessors has stopped. Thank you so much.
Thank you so much, Fan Vitalis. Last but not the least, I know we all know her. She's everywhere, but I would like to give her the opportunity to just officially introduce herself and just talk to us about her ambition. Kindly welcome from Cindy, aka Cindy Cruz.
PSN. Good evening, young pharmacists. I'm privileged to be standing before you today. For the purpose of those that do not know my full name, because that's like always an issue, my full name is Ozuloha Chioma Cynthia, popularly known as Cindy Cruz. And I'm standing here today to officially inform young pharmacists in Lagos and beyond of my intentions to run for the National Public Relations Officer come November at the Port Harcourt conference, where the elections will be happening for PSN-Young Pharmacists Group. I'm currently the National Public Media person. I'm the Media and Publicity Coordinator for PSN-YPG, and having worked closely with the Office of the current National Public Relations Officer, I have first-hand experienced the issues that faced with young pharmacists with regards member relations, engagement, accessibility, and something that I'm more passionate about, which is value creation. So I don't know, I think it's like, I'll say divine orchestration, that most of the things that has been discussed here today is centered on value creation. PSN-YPG has, we've moved past just an interest group where we come and just discuss problems. We want to be solution-oriented. We want to be able to profess solutions to these problems that are fighting young pharmacists. And I believe that through value creation, tackling these problems firsthand, improving member relations, ensuring that there's accessibility, that young pharmacists can access the public relations officer at any point in time and convey our problems adequately. We'll be able to find long-lasting solutions to them. So one thing I would like to enjoin us is to get involved. I'm sure there are students here. Get involved. Don't even wait until you're out of school. I think I started getting myself involved in PSN-Young Pharmacists Group activities from my 3rd, 4th year in the university. I was just really curious. I was just really interested. So I believe that it's not out of place for you to also be involved in our activities as a student. I think the Constitution also says that final year students are affiliate members of PSN. If I'm wrong, anyone can correct me. So, but my point is, involvement is important. It starts from there. I don't know how many persons will be there at the conference in Port Harcourt, but even if you can't attend, please try and be involved. Try and be updated about what's happening. Try and be curious about the things happening around you. Don't just say YPG is in their own thing, doesn't concern me. Try and be involved. And I hope that come Port Harcourt, in November at the Port Harcourt conference, we'll be able to expand our frontiers. We'll be able to do more. We'll be able to elect amiable and vibrant set of young pharmacists that will steer the activities of the next secretariat. Young pharmacists, I would enjoy you to vote for a proactive person. Please share the word of proactivity anywhere you go, because that is what I'm bringing to the table. Remember, the name is Ozula Chioma Cynthia. Thank you very much, young pharmacists. Have a wonderful day.
Thank you very much. Just some quick announcements. Like she mentioned, get involved. I remember my first PSN-YPG involvement was in 2017. I think I was in 400 level at that time. I was in Abia State for the conference. I was a student then, and even final year student, I was in Ibadan for the next conference. So it's not until you graduate before you get involved. Just show interest, and you just see that you will be called. Quick announcement. This is the beginning of our week. So we have programs tomorrow, which is an online masterclass. The masterclass starts by 4 o'clock. It's on Zoom. So at the comfort of your houses, there's a topic on management of STDs. And there's also current trends of management of dental infections. I'm sure most of us have found that challenge when people come to your place of practice, complain about their teeth infections. And some of us might not really know the treatment management of such infections. Tomorrow is an opportunity for you to learn. So please, let's see it as a learning opportunity. Let's take out time, just 2 hours, and the masterclass session is done. Then on Thursday, we are having what we call Pharmacy Professional Awareness Campaign. And this campaign was adopted by FIP, which the initiative is to make awareness of the pharmacy profession so that we have more pharmacists. Actually, Nigeria is underserved, like the statistics that was brought out. Nigeria is underserved of pharmacists. And so we are going to schools, secondary schools. There are 4 secondary schools we are going to. The Chrisland schools in Ikeja and Lekki. We are going to Mafoluko Senior Grammar School, and then a community school in Mushin. These are 4 different regions. So if you know you stay within those regions, kindly, there's a link that has been circulated around. Kindly fill in that link, show up interest, so you'll be contacted on how we are mobilizing towards those schools. We'll be talking to them about mental health and also the pharmacy profession. So please, let's take out time from our busy schedule. Within 30 minutes, we are done with PPAC. Then on Friday, we'll be having an outreach. More details on the outreach will be communicated soon. I'm sure we've not seen posters about it. We are just trying to finalize some things, but more details on the outreach will be communicated soon. Thank you all for taking our time and for also staying this long. God bless you. Safe journey to our various destinations. Thank you very much.
All right, people. So, Angela from Mega Medis is going to announce the winners of the little download challenge stuff. All right.
Thank you very much for your engagement. I would like to say that this is ongoing. It's just... Sorry, can I see my winners? Thank you. This is just for this event. We still have many goodies coming up for young pharmacists, and to show you the reality of what we are doing, our top 3. All right, so transparency. We have Adebayo and gym tad. So the thing was, in the process of ordering, you didn't complete your ordering process. So that kind of disqualified you. I'm sorry about that. Then the second person, you were asked to download the app, then order via the app, but you downloaded via the website. So, but you are not losers. Please kindly reach out to us at the table. We have souvenirs, packages for you. So our winner, the first winner at 1:33 p.m., who did the first procurement, goes to Savant's Pharmacy. Please, are you in the house? So this is a shopping voucher of 10,000 naira at any ShopRite mall. Just walk in and enjoy yourself. So you are saying enjoy the holiday. Then the second winner goes to God Alive Pharmacy at 1:39 p.m. Who's that, please? Oh, wow. I hope it's not because you're organizer. Okay. So this is a shopping voucher of 5,000 naira. So please, wait, somebody should be taking my... come. Savants, come here with my money. Thank you. Somebody should please take a picture. Wait, you're second, you're not first. Come. Where's the voucher now? Yes, so this is the first winner. Thank you. Say cheese. Cheese. Thank you very much. And then God Alive Pharmacy, a shopping voucher of 5,000 naira. Thank you. And finally, my third winner. So it's real. Tisado Vivian at 2:08 p.m. Please, if you're around, can you say hi? Hey, please be around, or this is going to the next person. Wow, please give her a round of applause. So, Tisado Vivian, you get a shopping voucher at any ShopRite mall of 5,000 naira as well. Thank you very much for being innovative and taking up the challenge. Thank you very much. Hope to see you guys very soon. Thank you. Have a lovely evening.
Thank you, Angela. Thank you for the gift vouchers. God bless you. All right, want to take the closing prayer. I would like to welcome Muslim pharmacists. As I said when we started, that the Christian will take the opening prayer, the Muslim will take the closing prayer. Is Akonde around? Akonde Aziz, my friend, all the way from Shalina. Where is he? Or somebody should volunteer to take the closing prayer for us. Pharmacists, before you go, come and take the closing prayer. Thank you. I can't see Akonde. He's eating somewhere or he's hiding somewhere. Please.
She like it fast slowly. Sometimes she confuse me. Me never leave her lonely. Me never leave her lonely. And I didn't know when she need me. She like Tojoro.
Good evening, everybody. Good evening. Alhamdulillah, alhamdulillah. We thank the Almighty Allah for everybody that came around for this program. And I pray that, inshallah, by the special grace of the Almighty Allah, we shall all go back to our various destinations with no problem. And to the organizers of this program, may the Almighty Allah continue to guide and protect you all. Thank you. God bless.
Thank you from Amina for that prayers. Thank you, everybody. PSN-YPG. We see you again. We move to Port Harcourt, Garden City. Appreciation goes to the 30 wonderful interns of Yaba. You guys are awesome. Thanks for coming. Appreciation goes to all the Lutz, final year students, all the interns from Lutz, Butemeta, compass everywhere.
Because me, I don't get time.
Thank you all. God bless you.
Baby, don't kill my vibe for me. Shall we go make up till the morning? Oh, my ninja make up when you love Jackass or Dale. If we do, I make we free now. Cause of my money, I go give Titi Dala, I'm a child. See your love is so insane, oh. Now only you every day, more. Need my head with a grace, oh. Baby, girl, for you, I'm mad all the time, oh. They know if you quench, I won't flame, oh. And I'm not afraid to let you know, say. Still now you are one, and I'm loving the things you did make me do now. Go shut it. Don't treat me like a fool now. Oh, babe.